going to be on network experiments. Then Dana is going to present some work on data archiving to sort of build up our discussion yesterday about ethics and NIH requirements and things like this. And then in the afternoon, we're going to do a series of things around essentially relational systems. So kinship systems, block models, those kinds of things. And so it should be hopefully a full day and interesting. And for those that are interested, there is a ball game tonight, the Durham Bulls. If you're keeping up the theme of pop culture references, for anybody that remembers the old movie, this is the town where that was filmed. I know some people who are extras in the movie, actually. It's kind of a funny place when you're here. You bump into these people. It's no longer the same stadium as the movie, but it's still a great place. And tonight is actually Bark in the Park, so it's actually an interesting day to go because there'll be dogs running around. So if you wanted to come to the game and didn't sign up, we have a couple of extra tickets, and so let us know, and we will get those for you and get you on the list. I don't remember, we probably have 4 or 5 left over now or something like this. All right, so we have 2 extra tickets. And once those go, my scalping price goes way up. So it goes to a really large multiple of the price you're hearing. So, all right, I think we're going to just go ahead and jump in. I'm really pleased today to do this panel. One of the things that we get feedback on over the years is that it's people are here to do health. They really want to understand sort of what can you do with networks. And so we hashed this idea of doing interventions, and I was just tickled as pink that we got the folks that we do. So we're going to start today with Tom Valente. Tom has been working on network interventions in health for a long time. He has one of the best books on it, and I think a second book coming out soon is just on interventions, if I remember correctly. So it's it's great to sort of kick this off with that. And then we have 2 wonderful folks who are going to talk to us about their experiences doing network health interventions, Nina and Yami, who are doing in very different contexts, one out of the country and one in the country. So it's a really diverse set of ideas today. So we're going to kick off. The plan really is to have some short presentations and then a joint discussion. And so that's the structure of today. So, Tom?
Yeah, and thank you, Jim. And I unfortunately have messed up that structure before we've even gotten started. I have a too long a presentation for the time allotted for this today. So if I'm going to skip some sections and move past some things pretty quickly in order to have time for our colleagues to present and discussion. This is the outline of the talk. I started to change it, and then I thought I was going to get my numbering all off. So as a consequence, I'll just go quickly through a bunch of things. In particular, this first section on how networks influence behavior, because it's probably familiar to a lot of you already through the work that we did. And I have this sort of stylized presentation about the ways that networks influence behavior from a structural perspective. We talk about exposure models. We talk about perceived influences rather than actual self-report influences, which are C and F. If ego perceives C and F to do something, they're more likely to be influenced by them regardless of whether or not they actually do it. And then we have Somalian ties, increase the influence of alters. If your network is filled with others that are all connected to one another, you're in a highly constrained situation, and as a consequence, the alters have a stronger influence on ego than they don't. We have tie strength as an issue. We have indirect ties potentially influencing alters, and that's an open research question because some people say it's 2 steps, some people say it's 3 steps, and we don't know about whether or not the intermediaries need to be engaged in the behavior. And then, of course, we can have network-weighted influences, right? So in this context, if E is very popular, they're likely to have a stronger influence on ego than other people randomly in the network. You can particularly think about that in the adolescent context, right? Popular kids in schools have stronger influences on others. And then the idea of structural equivalence, which has been around for a long time in network analysis. There are theoretical and empirical evidence as why structurally equivalent alters may have a stronger influence than others. And then, of course, we can expand and contract that sphere of influence, right? By looking at direct, indirect, and further out ties. and so on. And then my own discovery of thresholds, right? When I was analyzing diffusion data back, three plus decades ago with the medical innovation data, I created exposure models. Exposure wasn't associated with behavior, and my advisor, Ev Rogers, who's pretty well known for talking about exposure, being associated with behaviors, and I didn't see it in the data, and I started to panic, and I thought, oh crap, I'm not going to get my PhD because the data doesn't say what it's supposed to. And I had the epiphany that, well, we can't wait for everybody to have a majority of people in their network to adopt, otherwise nothing would ever spread. So there have to be some people in the community that have low thresholds that are willing to adopt before others adopt, right? And in fact, you can think about your own behaviors, whether or not you have a low or a high threshold. I am a high threshold adopter, right? Unabashedly, I wait until everybody else does something before I'm willing to do it. And why is that? Because I'm smart, right? Why would I do something before everybody else does it? Wait until it's used. I know I can go to others to get advice on how it works and whatnot. And I always make the joke that, low threshold people do something that I would never, ever in my life do. Read the manual, right? Because they're the ones that they do it before everybody else does, so they have to figure out how it works. And then this is just a nice graph that I use to illustrate what thresholds are. Traditionally we classify people as early or late adopters along the x-axis, but we can also graph them as whether or not they're early or late on the y-axis. And so what happens, of course, is we see that there are people that would normally be classified as early adopters, but in fact they're late in their network. And then, of course, we have online influences. We have bipartite networks where we can look at, if people are engaged in events and activities together, they're more likely to influence them. And then we can lay attributes over top of that, right? Communication theory would always suggest that people who are homophilous are more likely to be influence one another because of those shared things. And so I usually conclude this part by saying that's networks of behavior change. Let's segue into talking about networks for behavior change, which really is the topic for today. And just a quick plug, all those kind of structural network influences we have built into our R package net diffuser, which enables you to do all of those things with just toggling a switch here and there. So it saves a ton of time, because in my PhD, I wrote all that stuff in Gauss, and then got, moved over to, I did it actually all in SAS, Proc IML, then had to do it in Gauss, and now we've done it in R. And I think that's the last time we have to rewrite all those things. So a number of years ago, we published this paper on network analysis for program implementation. It's the SNAPPy, keep that in your mind. And we basically, like program evaluation in other fields, we have these stages in the implementation process. And what we did in this paper, of course, is just talk about the different things you can do with networks as you move through these stages of implementation. And of course, we don't have a lot of work in this area, this notion of network ethnography, but if you're going to do an intervention, it's really smart to think about looking at the network, trying to map it, and figure out ways that the network may be implicated and involved in defining the program and designing the program. And I like to say that typically what happens, of course, is we work with communities, we find the people that are most central in that network, and they help us define the program, design it, and so on. But then, of course, it ignores the isolates that usually are the ones that are most in need of some kind of intervention, or these disconnected subgroups that are actually the ones that are at high risk. You think about a high school or any kind of community, it's this group out here that may be engaging in a whole bunch of risky behaviors, and they're not part of the system. Okay, and then the bulk of the work I've been doing lately is this notion of networks for designing programs, right? And many of you may be familiar with this paper I published a while ago, Network Interventions. And as Jim said, I've actually expanded this work into a full-length book, which is gone through a couple rounds of review so far. And so network interventions, not surprisingly, I define them quite broadly. Anytime we use network data to generate social influence, accelerate behavior change, improve performance, and or achieve desirable outcomes among individuals, communities, organizations, or populations. In essence, we can do everything, right? But before I talk about the details and specifics, I like to point out that there are a couple of principles that are critical every time we do an intervention, but become highlighted in particular when we talk about it in a network context, right? And so the first one is that our program goals matter, right? So sometimes we want to increase cohesion, or sometimes we want to increase fragmentation. And the example I often use is the idea of slowing the spread of STDs or STIs. And in that case, we may want to fragment that transmission network, or we may want to accelerate the uptake of condoms and other protective behaviors. And secondly, I came into the social sciences with a math background, didn't know anything about social sciences, and I thought, we don't know anything about behavior, right? I mean, people, one day they may spend the day on the couch watching movies, the next day they may be, going off to a baseball game or whatever. People are hard to predict. But I think actually in the past couple of decades, we've done a pretty good job of understanding what are the motivations and barriers to behavior change. We have pretty good theoretical models, and although it's easy to say, maybe harder to do, but a good, well-articulated theory about what's motivating behavior can oftentimes be quite important for bringing about change. And then finally, my goal when I started designing network interventions back in the mid-90s, I was like, this is great. I'm going to write a program. We're going to push that lever. Everybody's going to change their behavior. The money's just going to come pouring in. I'll be rich and famous and I'll get tenure, right? But of course, that's not the way it happens. We have to think about it as a process where our job is learning from the community as much as trying to change it. So this is the big table. Gotten a lot of press. And basically, it breaks it down into strategies, tactics, and operationalization, which are words that you hear a lot, particularly now that we're always in this political campaign mode. We talk about, what's the strategy, what are the tactics, what are the operationalizations. And the easiest way to interpret this table is to just look at this first row right here, where the strategy is identifying individuals that are going to be our change agents, right? And what's the tactic that we're going to use? Well, typically we try to find opinion leaders. And we'll probably hear a lot about popular opinion leaders this morning. And then, of course, from a network perspective, how do you identify the most central node in a network? Well, it turns out we have lots of measures for that, right? Degree, closeness betweenness, eigenvector, you've heard a lot of those. And in fact, at last count, we have over 100 unique algorithms to define the most central node in a network. So you have a ton of choices. But typically, we always just use in degree. All right, so why network opinion leaders? Well, they're easy to identify, it's intuitive, and even a decade ago, we had discovered over 20 studies that had used network identified opinion leaders to be change agents and found them to be quite successful. And in fact, it came about in this paper that we did where it occurred to me that there are lots of different ways in public health we try to identify opinion leaders, right? And we use the different kinds, celebrities, self-selection, self-identification, and whatnot. And so we went through and we downloaded a couple thousand abstracts in the public health literature. We went through them all to put them into these different bins, how many that are going to do that. And this was way back in 2006 and 2007. And I started to write the discussion section of the paper before we'd finished the data because I knew intuitively in my heart, we never do this, right? And I wrote the discussion section saying, the problem is, these things are not as valid and reliable, and this is the best way to do it. And of course, then we go through all these abstracts, and we find 20 different studies that had actually done that. I'm like, you gotta be kidding me. This is all in the literature? And it turns out that they were all in different places, right? There was one for kidney disease, and one for HIV, and one for acute myocardial infarction, and so what you realize, of course, is in our public health world, the National Institutes of Health is organized by organ and disease, not by health, right? And so all these things have been funded by different institutes, and they had not really cross-referenced one another. And then we run simulations, which is a lot of fun, right? You can generate a whole bunch of synthetic communities. You can seed the initial adopters to be opinion leaders, randomly selected or marginals. And of course, just by seeding it with those that are most central, you get faster diffusion and higher prevalence. And why did we use the marginal condition? Well, it turns out if you look at the literature on diffusion, a lot of new ideas and practices are first adopted and created on the margins of a community because those on the margins are free to innovate. They're not constrained by the network, and they have an incentive to do so. And then there was this review by Flugren and others where they found 18 trials. Some of them were opinion leaders versus no intervention, 1, 2, 3 other interventions. And across all of them, what they find is a 12 percentage point difference in compliance or behavior change. Now, that's a huge effect, Right, I teach program evaluation, and what we know from meta-analysis of interventions is we're lucky if we get 3 or 4 percentage point change with our interventions. The fact that you can get 12 percentage point changes just by using the network approach is incredibly significant. And why we aren't doing this all of the time, everywhere, all at once, that is a contemporary reference. I don't know, because hospitals all across the country should be doing this all of the time to improve their evidence-based practices. Now, the easiest thing that we can do with network data is calculate in-degree centrality. And as Jim talked about yesterday, it turns out in-degree centrality is incredibly robust to missing data. So it's great to use in the field, because if you go into a hospital and you collect data and you only get a 50% response rate, you can still validly and reliably identify those peer opinion leaders and use them to be change agents. And it's, like I say, you can use other centrality measures, but in-degree centrality works really, really well. And then this is just a sample data set, right? UCINet, there's the network. One of the things I always like to point out, so I have tons of data like this, right? These are 12-year-old kids in school. We asked them to name their 5 closest friends, and you can see clearly there's 2 different groups, right? And I bet most of you, since a lot of you are sociologists, know what constitutes the group on the right versus the group on the left. Gender, right? Thank you for filling in the blank. What did you say, Jen?
We said girls are icky.
Oh, girls are icky, yeah. Well, and it's funny, too, because a lot of times you'll find a few girls will admit to having a boyfriend, but boys will never admit having a girlfriend. And I remember looking at this, my daughter was about 12 at the time I saw this, and I thought, this is great, I've got nothing to worry about. And little did I know. Okay. And then there's a lot of theoretical work and very interesting work to be done, because you actually, once you identify those peer opinion leaders, what do you do with them, right? And there are a lot of different things that you can do with them, and I think it's going to be interesting as we develop out the science of network interventions, this continuum of passive involvement by the opinion leaders versus active involvement, right? And one of the early great studies in this field was done by Lomas, promoting vaginal birth after first C-section, which is still an issue, believe it or not. And they had guys, wearing badges and all kinds of different things to say, ask me about VBAC, right? And so that's a more active process rather than something passive. Now, the other thing that we could do, which we don't do, is identify bridging nodes in a network, right? Because sometimes we've got networks like those adolescents where there's different there's different subgroups, and you want to create more cohesiveness. Think about mergers and acquisitions, 2 departments join one another, that kind of thing. And I argue that bridging nodes might be easier to work with because they're not as constrained as central nodes in terms of their behavior. And just as a side note, we focus a lot, Jim said earlier yesterday, I think it was, where he said, one of the ways you get kudos in the network field, you become an expert, is by publishing a centrality measure, right? I published a centrality measure back in the 90s, a version of closeness. Well, the thing I focused a little bit on lately is now identifying ways we don't have very many measures of bridges in network. We have Ron Burt's notion of constraint and the inverse of constraint, but we've published a couple lately, one in 2010 and another one in 2016. Then, of course, we might identify peripheral or isolated nodes for certain kinds of interventions. And then, of course, this notion of identifying low threshold adopters, right? If we can recruit them to be our change agents, we're ready to go because they're used to adopting early. They're used to the process. We'll learn more about this morning, about what happens in the real world when we do this. The second strategy for network interventions is the idea of segmentation, right? That you find subgroups. We spent a lot of time talking about communities yesterday, right? We've got a lot of different community detection algorithms. You find subgroups in the network and you get them all to change behavior at the same time. And there are some behaviors for which that's incredibly the only way to get behavior change, because everybody has to adopt the innovation for it to happen, right? You think about, adopting a new computer system in a department. Everybody's got to do it, otherwise you've got incompatibilities. And I won't go into any details. You all have a lot of experience about ways that we can identify groups and networks. And then the
this nice little graph saying, yeah, networks are oftentimes modular, and it's good to define them. And then again, here there are implementation issues with that, right? Do they need to be the same size? Do we need to consider the attributes of the individuals? Do they need to be homophilous or heterogeneous on different kinds of characteristics? And then the other segmentation approach is to identify positions rather than groups. They may be more difficult to organize because by definition they may not be directly connected to one another. But again, there may be some settings, I think particularly about human service organizations where you have line personnel, program managers, directors, and so on at different levels of the hierarchy, and that may make a difference for whether or not the innovation is appropriate for them. And again, implementation issues there. Now, the coolest, at least in my opinion, kind of strategy is the notion of induction, right? So in strategies 1 and 2, we use the network to identify individuals and groups, where strategy 3, induction, is a little bit more difficult to define, and it may be easier to understand by example rather than definition, but I describe it as actually sort of activating the network, trying to excite behavior change on the network. And there are a couple of different tactics that we have in this realm. One, of course, is word of mouth, right? And that's been an old communication strategy for a long time. People create advertising campaigns, and the idea is to get people to talk about it, make it go viral. And in the world today, we have online retailers build this in, right? You purchase tickets on StubHub, and you can automatically have that purchase posted to your Instagram, Facebook, Discord, what was the other, Be Real, all those different social media ones we were talking about this morning. And then we had a bit of information about responder-driven sampling, which I found very interesting yesterday. And although it's rarely used as an intervention strategy, in fact, when you're doing RDS, that is interpreted as an intervention in the community. It may not be designed to do that. It's typically designed to make
intervention. And then finally, when we combine this notion of identifying individuals and identifying groups, then the question becomes, well, do we need to impose a leadership structure on these groups, right? Or when we identify leaders, do we need to figure out and make clear for them who they're going to lead for? And so it's back in 1999, we came up with this theoretical idea to sort of say, let's match leaders to groups. In other words, rather than just identifying the leaders and say, okay, go forth and communicate and convert, we say, no, you're going to go forth and communicate and convert specifically to these people. So here's a network, we identify the most central folks in the network, and then we match them to the persons that they're closest to sociometrically, right? So either directly or indirectly connected to. And this way, it says to 32, these are the people that think you're a leader, you're be responsible for them learning about this new behavior or this idea. And in my world, in an ideal world, right, I fantasize about having organizations with this kind of structure across different domains. So you have different people being leaders for different kinds of activities and behaviors, which makes a lot of sense because people specialize in different things. And what was really cool is we wrote the theoretical paper with simulations in '99, and then I interviewed for a job at USC to lead our Masters in Public Health program, and they had an existing grant funded to do tobacco prevention in schools, right? And in that program, they were going to compare our standard social influences kind of curriculum with one that's culturally tailored. And this was the whole idea. We need to make our interventions tailored to the communities that have certain cultural things. We have a lot of cultural diversity in Southern California, and so we created this program. And so I came in late to the game, but I said, hey, I have an idea, right? Let's go ahead. Typically what happens in schools is teachers, they'll collect network data, right? They'll put a roster up on the board or on the screen and say to the kids, take out a piece of paper, write down the 5 kids you want to be, that you think would make best leaders for a project in class. Teacher gets it, gathers them all up, does a tally in degree centrality again, just like that. And then 2 things happen, right? One is, and it's not the teacher's fault, but the first thing that they do, of course, is after they've done the tallying, they decide to edit the data, right? They go, Tom Valenti as a leader? I don't think so. This would be a disaster, right? He's constantly creating problems in school. So we'll scratch that one off and we'll go to the next person down on the list. And then the second thing they do, which for us is criminal, is then they throw the data away, right? And so what I said is, let's not do those things. Let's have them send the data to us. I wrote a Gauss program to identify leaders and match them to their followers, and then we'll test it out in this kind of randomized controlled trial across classrooms in these 16 different schools, almost 90 different classrooms. And what did we find? Lo and behold, right? If you do nothing else but identify opinion leaders and match them to their followers, you get improved performance on program appeal, and you get improved outcomes on smoking attitudes, self-efficacy, and the big kicker was susceptibility to smoke, right? And we know that predicts becoming a smoker, and so that was a huge, huge effect, right? And we aggregate up to the classroom, we get the same thing. And then in the one-year follow-up, what do we find? Sure enough, right, when we compare the two curricula, we find that in the culturally tailored curriculum, using the network approach was more effective at slowing the uptake of smoking. Awesome. You know, and the teacher condition did the best, right? So the teacher's better than my algorithm, which is not surprising. Nobody's surprised about that, least of all your author. And then we submitted this paper to the Journal of School Health, right? It's a high impact journal. They're going to love this, you know, it's saying such great things about teachers. They trashed it. I didn't like it at all. So, but what we found, of course, is that this network condition, and actually there was another intervention that had happened in 1999 by David Bueller with eating behavior in organizations, and they had a really successful time with that as well. But what we find, of course, is this network condition is the most appealing. It reduced pro-tobacco attitudes, reduced susceptibility. And then we replicated it a couple years later. I have a colleague named Steve Sussman who has an evidence-based program called Towards No Drug Abuse. And, you know, we were talking in the hall and he goes, well, with a new curriculum, I can see how a network approach might be effective. But what about an existing program? Can we make that better by using a network approach? And so we did that, right? And we had as our prime directive to create this TND network, compare it to TND vanilla, and see if it's more effective. And it was. So the key take-homes here are that network methods are effective at changing short-term outcomes. We have these turnkey network-based interventions now, but they're sensitive to curriculum. And this is the really important idea that in public health, we typically ignore the social context of behavior. We don't measure who people consume interventions with. Right? And I guarantee you that makes a huge difference. If I go to a movie and I watch it with person A versus person B, I may have a completely different reaction to it based on their reactions to it. So that social context is important, and how the curriculum is received is important from a network perspective. And then we can talk about other things. Then finally, the fourth strategy, which I initially called manipulation, right? And I realized, that's not really what we want to sell here, right? We want to talk about alteration. We're tailors. We're making things nice so that they fit better. And we have three different tactics to that, right? We can delete or add nodes. and the military spends a lot of time on deleting nodes, right? That's their prime objective in a lot of settings. And then, or we can change links, or we can rewire the entire network. How do we do this? Well, you calculate excuse me, some kind of network metric. Oftentimes we use cohesion, right? The inverse of the average path length. Delete a node, recalculate the metric, calculate the difference, and those with the largest difference are the most important. This is referred to as vitality in the network literature. The other thing to do, of course, is to change links, right? So again, calculate a network metric, delete a link, recalculate the metric, and then calculate the difference. The links with the largest differences are the most important. And then what you can do, of course, is delete existing links or add new links, and you get this change matrix, right? Which is a measure of how much cohesion changes when you delete or add links. And now you can do stuff with that change matrix as a way to understand the structures in the network. And again, we have implementation issues for that. Do we know which structural metric to maximize? If we make one change, do we need to make another? You know, is it a zero-sum game? And then, of course, we've got all kinds of network dynamics to worry about here when we're trying to do this actually in the field, and so it could be challenging. And then the other thing I like to observe, of course, is rewiring networks is really difficult. People have affiliations and affinities with others for a whole bunch of reasons that are somewhat complicated and may even be hard to measure. And so I'm not sure we haven't done much of this in the real world, but we will see. Now then, of course, the other idea is to rewire networks, right? So we can take an existing network and rewire it to be a different kind of network. Now, organizations do this a lot by architecturally changing the way the organization is structured. All right, if they want to, they want to put the water cooler in the middle of the office space, they want to have open plans or closed plans or whatnot. And so they're basically trying to change the network structure in order to make it, to get some desirable outcomes. And then I also like to point out, for a long time, in the early days of network analysis, we were always strutting our stuff saying, yeah, everybody ignores networks, we care about relations, we know they're more important. But then, of course, we oftentimes ignore the attributes of those people, right? We think of our network as nodes, but I like to say nodes are people, so they have characteristics. Let's make sure we incorporate that. And then this is one of the few studies I found that's published that actually tried this sort of rewiring approach in an elementary school classroom. They measured kids who they liked and didn't like, and then they rearranged the seating to have kids who said that they didn't like others sit next to one another, and then they found out at the post-test, of course, that now they liked them or disliked them a lot less. So we go back to our table, here it is, and this has been extended by a couple of people in a couple of different publications. Which I'll share with you. And then I just like to say, well, I like the graphics. Here is the graphical display of all these different network interventions. And then I like to keep that box down there in the lower right-hand corner because there are people introducing new ideas that are beyond the scope of that table up here in the upper left-hand corner. So I think, there's a lot more that we can do with network interventions. And just as an aside, we do have an R script to calculate all of these things. It's not very pretty at this stage because, again, I'm a pretty terrible programmer. So how do you select a network intervention? Well, there are considerations. What kind of network data do you have? What does that structure look like? Where are we in terms of prevalence of that behavior? Is it brand new? Is it old? What are its perceived characteristics? In particular, cultural compatibility, which turns out to be critically important. Is it a behavior or an idea that will be readily endorsed or accepted by the community? And one of the reasons I do that, what are the structural influences on behaviors? Because really in an ideal world, we could use theory to decide what kind of intervention to choose, right? If we know the mechanism that's driving the behavior, that does suggest certain kinds of strategies and tactics to employ to do the intervention. Right, now back to Snappy. We've done our program design. What about implementation? And so a number of years ago, my colleague Sabina Giselle came up with this idea of creating network diagnostics, right? Let's use network data while we're implementing a program in order to make midterm changes. We published a paper on this thing. And basically in this proposal, what we did is said, what are some of the key network metrics that you're all familiar with? What should they look like if we're doing an intervention with a group of people? And so we put this table in, we send the paper off to a journal, and I knew what was going to happen. The reviewers are going to be, where in God's name did you get these threshold numbers from? All three reviewers were critical about that. And I wrote them back and I said, yeah, I don't know. I just made it up, frankly, because nobody's ever done this before. And lo and behold, they're like, yeah, that sounds about right. Shocked the heck out of me. If NIH would behave like that, I'd be a lot happier. And then one of the last things to discuss is what kind, I'm talking about networks in general, and in fact, we have different kinds of networks and they serve different functions, right? And in particular, when we're doing interventions in organizations, there are two kinds of networks we typically measure. And this goes all the way back to Coleman, Katz, and Menzel in the mid-1950s, right? Who do you go to for advice, and who do you discuss matters with? The one taps into expertise, the other trust, And again, going back to communication theory, all the way back to 40s and 50s, those tend to be the two things that enable people to convince others, right? And depending on the behavior, depending on the setting, you may want to work with advice networks or discussion networks. And I like to say that they really have two different dimensions, right? And you can find people that are low and high in either expertise or trust. And of course, ideally, we find opinion leaders down here, right? They're high in expertise and they're high in trust. And I like to think about them as sort of hierarchical, vertical versus horizontal. Okay, and then when the barrier is technical, right? You don't know how to do something, expertise is important. But when the barrier to change is cultural, you don't know what to do, trust becomes important. So in conclusion, network methods, I think, are great for interventions. They capitalize on existing interpersonal relationships. They use community input, and they let the community become a learning organization, right? And it feeds right into this notion of social capital. And when people are contributing their network data, excuse me, then they're actually involved and empowered in the process. And we can replicate them, right? We have fidelity. How well did our matching algorithm work? And it really does create a lot of options for us in the public health context. And so that wraps it up for what I have to say. And if there are any quick questions, I think we have a minute or two for that. So thank you all very much for your attention.
How about some any quick clarifying questions on the particulars, and then we will, while we switch over, and then we can come back together at the end for a joint discussion.
I must have been crystal clear. Yes?
There was a slide that said WOM on it. What is that?
Word of mouth.
Thank you.
Old advertising campaign.
This should work. There we go. Awesome. All right, folks, I'm really pleased to have Yami with us today. She was in your seats many, many years ago. I don't remember what year was your first year. It might have been the first year we did it. Back over in Irwin Mill, right?
I was just talking about the college, yeah.
In this beautiful old building that we don't use as much anymore as we should. And you know, it's. I would like to take credit for her level of success,
You should.
but not even close. I mean, she said the amount of work on networks and health on both the intervention space and the community engagement space has just been remarkable. And I think that her publication list that we're able to append to our grant brief submission might single-handedly carry us forward. So it really has just been a remarkable journey to watch you succeed. So thanks for sharing your work with us now.
Thank you. Buenos días todo el mundo. Estoy muy agradecida hoy de chismear, charlar con ustedes y hacer lo demás, okay? Hi, I'm going to talk in English, I promise. I'm going to start where I come from. So Yamina, please feel free to connect with me over coffee later on. I'm going to try to be as quick and as efficient as possible, but those terms and adjectives are never really applied to me, so just for reference on that. So what I'm going to do is just give a quick connection in terms of why community engagement and network science is an easy partnership. I'm really excited to be here today porque I will tell you most of my life is spent talking to interventionists about why network methods are important, and now I get to talk about how network methods are awesome with people who know that they're awesome. So it'll be a real quick overview. Then I'm going to give you a couple examples of some of the work I've done over the last 8 years or so with Latina and Black populations, and we'll go from there. So here are the 3 things I want you to come away with. 1, community partners value, and as we already heard, already do network interventions. So that's already happening, so it's easy buy-in. They are already doing it. They're using different languages. They get it. They get the value. Number 2, communities value and actually want network-based evaluation because it actually aligns with what they see in real life, the complexity that they see in real life settings as they are doing the work. Network methods match it, so they're all in. 3, community perspective has added value to our network science. That goes from agent-based modeling to other simulation models to very complex work on empirical data. They're here for it, they can give advice, and really it's about inclusive communication and really ensuring that we're on the same page first and setting that forward. So con eso, like I said before, and as was mentioned by this big jefe here, which is always very scary when you're like, I've cited you 1,000,000 times, no, look at me. With that in mind, community interventions more often than not are at least network-esque, and that's important to note. There are often opinion leaders, they can call them promotores, volunteers, advocates, patient champions, citizen scientists, navigators, you name it, they're there. Oftentimes, they're self-identified, self-nominated leaders who are well connected in the community, and part of their job description is their ability to connect and interface with a number of community partners, right? And so the idea is often that they are out there serving as hubs and really getting that word out there. So they get it. They love the idea of network interventions. They love the idea of adding complexity and doing some intentionality of that work. Number two, like I said before, oftentimes community programming, and here I'm not talking about public health in the context of in a university setting. I'm talking about the grassroots organizations that exist. I'm talking about public health departments, churches in rural settings, and the like. They are already doing this work where they have their interventionists, their team, right, who is working and touching base. What they also know is that that's not the easy picture, that our standard public health evaluation methods don't capture the fact that, for example, participants know each other and brought other people to the table, and that needs to be incorporated and added to it. They also know that beyond the program settings, each of these participants is potentially reaching out to other community members. So I say this to just throw out there that community engagement and network methods are very easy, because once you bring in exactly what you're hoping to do and what you think is going on, oftentimes we're like, yeah, that's exactly right. I'll give you an example, which is the first time I did this in 2013. I was in California working with some promotoras, and they were talking to me about, I was telling them about network interventions and really understanding those positive ripple effects. And they were like, oh yeah, I'll talk to Fulanita at noon. I'll have her mother-in-law at the table calling me at 9 at night, which also, by the way, speaks to the fact that we need to invest in community, because community health workers are always on call, right? So with that being said, they believe the methods, they want the methods, they want that critical, comprehensive, and precise data. In addition to that, they believe and argue and actually have advocated and pushed me into a different space in terms of not only showing how much more they're actually reaching the community, but the value of that, so really incorporating cost data and really thinking about the fact that adding network effects really helps us have a more comprehensive and precise estimate of how much value these community interventions that have positive effects, usually how much value actually is associated with them and how much we are actually gaining. So the final piece, I'm going to focus on my first 2 points primarily, but I'm just going to throw out there over cafe if we want to hang out at any point. Happy to talk about my experiences with how to do community engaged work in terms of secondary analysis, primary analysis, computational models, you name it. Happy to talk about it, best tips. What I will tell you is how many people love complex modeling? All over, right? You know who loves complexity? Community, because they're always saying it's harder than you think. So they get it. You know how many people understand in community that we love complexity, but we gotta actually do the thing, and it has to be feasible. Community gets it. You know who else gets it? Modelers, who are like, yeah, I get the world is completely complex. We gotta prioritize where we're gonna put complexity in this for this model to run. Community gets that, right? Finally, community gets being creative. They get the idea and the notion that we have to shift and move, right? So I would just provide some support, and I'm happy to talk through strategies for engaging, because they want to be with the data with us. They want to give input, and they have value, because their lived experience and their vantage point sometimes aligns with our theory and sometimes can expand on our theory and our models. So con eso, I'm going to start off and I'll give you a couple of real life examples. I'll go through it as quick as I can. I talk pretty quickly, but todo bien, we're all good? Dale. Okay, so con eso, I want to just first recognize my community of folks who have been in this project for a long time. A critical part for me of community engagement and effective cancer health equity work is inclusive leadership and elevating community as academics, as well as community leaders and representing that. So this is a community of Latina investigators. Some of them are now doctors, some of them are now PhD students, some of them are now public health practitioners. Y todas have been in the fight. So si se puede, and it already has been done. So con eso, when I focus in on the projects, I focus primarily in breast cancer. That's the majority of my work. You're gonna see me talk a little bit about a couple of outcomes. A lot of times what we see is communities who've been historically excluded from care, so not underserved, but historically excluded from care opportunities, really and truly have had challenges with adhering to the guidelines that we give them, but do not give them access to the knowledge base as to when they should be doing it. We don't give them access to actually getting it, right? So with that in mind, the work that I've done is really focused on how do we get them access to the evidence, how do we get them access to the care in the ways that it's done. So with that in mind, I'm just gonna throw out there that a lot of these cancer disparities have been around for decades with the advancements of new treatments. And so oftentimes, for example, when I talk about breast cancer disparities among Latinas, which is relatively, I would say, less known. What people don't understand is that there are 3 meta-analyses today that show that Latinas have worse quality of life relative to non-Hispanic whites and other ethnic groups post-diagnosis. 3 meta-analyses, not 3 studies. So I just want to throw that out there. We know the problem. We also have been trying solutions. So going into this, there have been a number of community interventions focusing on different health topics. I focus again on cancer, but I'm just going to highlight 3 of the common strategies that we see in behavioral interventions for health equity work. So with that in mind, we have first, systematic or organizational change. So specifically, patient navigation or case management to getting people to free and low-cost care, right? And so that is at the systematic level in terms of ensuring that care is affordable and accessible, and that someone is there to provide you with supports to deal with the barriers that you have. Next, we have the train the trainer models, or community leadership models, opinion leader models, if you will, wherein we invest in community leaders who are already present, give them access to the knowledge base with the understanding that they're going to disseminate that. And the final thing is that those individuals who have been provided enhancements in terms of their capacity and given the content to leverage their skills, then do that with patient education. Usually with community, clinical, academic partnerships, what we see is a mixture of the following. We have clinical facilities who have navigators, if you will, social worker aides and the like. We're providing that care, that free care, that high quality care in a low cost setting. We have community partners who have a lot of training, potentially from academic settings, in terms of what information is available, how to build their capacity, help with their message and disseminate it. And then simultaneously, we have those individuals who are out there in the community doing. Now, with all that said, here's what's most interesting. More often than not in the context of breast cancer, as we would expect, the number 1 most consistently effective strategy, free care. You want to know the one that works the best anytime, every time? Oh, it's free care, right? So I'll just leave comments there, I won't get political. Free care, that's why I've been political enough. But 2, with that said, free care is only available to whom? The people who know the free care is there, right? So what we've also seen consistently across the literature with different systematic reviews is the importance and the value of community interventions of those opinion leaders, as was mentioned before. So with that in mind, what is the best strategy to get that information out there, to get information about those resources that already exist, that are structurally present? About 8 years ago, my community partners and I really focused on an aged new type of model. We were calling it the Empower model. And part of this idea is really understanding that the people who we consider the most vulnerable, the most threatened, the most historically marginalized, haven't been waiting around for us. They're actually doing things on their own. Miracle, right? We all believe it, right? So with that in mind, people who are most and utterly disenfranchised have the capacity to make their testimony the most important testimony. They have the ability to really change minds in ways that no one else can, right? And so with that in mind, we came up with this idea, which is really emerging with the different types of network interventions that were mentioned before, which is we have an opinion leader, we have a central node, and the understanding that we should be modeling every individual's then dissemination and engagement with their network members. So really thinking about and training our participants to then pass the word. We think about this as training the trainer, if you will, or understanding that when we give knowledge, the expectation should be not only that the people are receiving it for themselves, but that they're going to be passing it on to others. So with that in mind, why would we do that, right? How many people have talked before or given a presentation before? How many people feel like the first time you learned something was when you had to teach it and a lot of people were staring at you terrified? You were terrified, they weren't terrified, they were blank-faced, right? So con eso, right? Part of the network intervention and part of training and understanding and engaging patients, participants, clients, as people who are going to be sharing that information, assuming that they are going to be the leaders in that set, puts them on the pressure line, actually. It's not a great feeling, as we all know. Because now we're being told, here's the message, you got to spread it to the 3 people that you care about the most. You know what's going to happen? You're going to really remember that. Because those people you care about the most, you care about what? More than you care about yourself, right? So now the pressure is on to own and retain health knowledge. And we have some preliminary data to suggest that network interventions lead to greater consolidated knowledge information. It also leads to greater pressure to be a healthy role model. Como puede ser that I will tell you to get a mammogram if I haven't done a mammogram myself. So that social pressure is there, right? And then simultaneously, you get exposed potentially to a shift in your network, and potentially you get to see the model in action. So when you are referring other people, your family and your friends, to that space, you not only are getting your personal experience, but you're watching the system, you're watching the networks, you're seeing what's going on. And that greater exposure, that hands-on experience, right, will facilitate personal health behavior change as much as it is associated with network level effects. So how do we do this? How do we do the actual intervention? The programs that we have developed are really a mixture of first, social navigation using the social determinants of health framework, right, to free and low cost screening and essentially free and low cost breast health care across the board, right? And so with that in mind, in the context of free care and facilitated care and support for any other systematic or structural barriers, we've been comparing and contrasting the best practices or the standard care, which is something. The standard care today is really access to education, so information about breast cancer 101, the risks, the screening methods that are available, methods of prevention like diet and exercise. And then with that information, if you want to, you can get navigated to the screening as you've been told. So that's our control. That's a really hard, high control yes. Our intervention, or the network intervention that I'd introduce you to, is the Empower Navigate intervention, or just Empower for events. What we do with this is we turn it around. We do the first same session, Breast Cancer 101, your risks through the screening methods. The second session we say, okay, you learned it for you, now learn it for someone else. We do an action plan, we do tailored information around, pick up to 3 new people that you want to talk to about that. Here's the thing, about 70% of participants who don't know what's coming, by the way, at that second session are like, oh yeah, I already talked to my daughter about this. Recognizing that the people we consider to be most marginalized are doing something, and our acting is our critical resource. It requires us to do a paradigm shift. We're working with communities because communities are getting it done. They need the investment, right? So I'll stop preaching for now, 1 minute. But with that in mind, our second session, so first you learn it for you, second you learn it for your family and friends at an interpersonal section. The third session that we do is we offer 2 options. Option 1 is participants can bring a family or a friend if they're not really necessarily comfortable with sharing that information. They can do it under the support of the community health worker who's giving it, or they can get connected to different opportunities to volunteer and work with other community health workers and become part of the team in whatever sense feels comfortable. What I'm going to tell you now, something that will potentially come to your mind is, okay, this is great, but what about the people who don't want to volunteer and don't want to share this information? What about the introverts, which PS I am? I just don't look like it. So with that in mind, just throwing that out and giving you the key thing, this works in particular very well with the people who would not otherwise disseminate the information. Why? Because how we section this is really tailoring and understanding that what leadership looks like depends on a different person. For some women, it's getting on the mic. For a lot of women, it's passing out flyers outside of the church, or leaving flyers on a bus seat, for example. And that counts. That dissemination matters and is valuable because it changes community norms and values, right? So recognizing and appreciating that actually leads us to have particularly high success with people who even don't share the information. And these are usually the people who have been due or non-adherent to guidelines for many years. So their personal behavior change matters particularly to us. So here's our conceptual framework. I know I'm going too long, so I'm going to go over it really quickly. And with that in mind, just note that relative to education of that standard care, the primary goal is that empowerment or a leadership perspective leads to greater knowledge retention, greater pressure to be a leader, and therefore do the behavior. And that's going to lead to different health behaviors or improved health behaviors. It's going to lead to individuals who are particularly effective, not because they were central to the networks that they were in, but because they have a story of how they were challenged and how they changed it around. So with that in mind, that leads to network members diffusion, and that leads to more of an intentional diffusion in the community, if you will, of high quality message. Why? Because we're not assuming that only the community health worker needs to be trained as an active messenger, but everyone needs to be trained as a solid, intentional, and strategic messenger. So here are the 3 grants that we've gotten to test the way around it. I'll talk first primarily about the K01, which is a quasi-experimental design, and then I'll touch base on one of the RCTs, the randomized control trials we've been doing for the last 2 years. This one, the R01, we just got last August. We got 40 people enrolled. Woo! So, next time. Pero con eso, let me tell you a little bit about the K01 and the initial study that was in 2016. So I'm from Chicago. The actual Chicago person in the room is like, I dare you to do that one more time. Sort of hilarious. So I am from Cook County. Currently, I love it. And so the work that I have done has really focused on the west and the south sides of Chicagoland, the Chicagoland area, focusing on predominantly Latino communities wherein over a third of residents are impoverished or below the federal poverty line. We focused for this initial study on partners and community agencies who already had those strong assets. So the thing you'll hear me say over and over again is community is doing this. It's about us becoming informed, not informing them, understanding what they are doing and moving our methods towards that. So with that in mind, we picked interventionists who were already doing leadership or train the trainer models, people who were already doing that in education and navigation, and we asked them to continue doing that work and get paid by the government. Woo, right? So with that in mind, we also focused on priority participants. Something I want to highlight to you is that in order to participate in the study, you could not want to get a mammogram. You could not want to get a breast cancer screening. So actually, at that point in time, if we approached them, they were like, yeah, I need a mammogram and I want to be in the study, we refer them to get the mammogram. Because they didn't necessarily need that information. We're trying to get the people who are most vulnerable in terms of not sure that they want to do this for various reasons, a number of reasons. So these were individuals who had not had a mammogram at least in 2 years, were 52 to 74 years old, had no intention of getting it when offered explicitly a warm handoff to a mammogram program, and lived in the two neighborhoods that I'm talking about, the west and the south side, and had no experience with volunteerism, which is also, of course, important if we're saying that leadership works. We don't want you already to have had that training. So I'm going to go through this really quickly. Essentially, we had the standard covariates mammography use, which was our outcome of interest for breast cancer screening. We picked their baseline, the intention, even after they said they did not want it now, what they expected to do over the next year, and then whether they actually got a mammogram based on a medical record / self-report. And then we use the general social surrogate instrument, or just that basic egocentric measure, to really assess network effects. We got about 145 individuals. We assigned them again by program. So the west side got the leadership model, the south side got the education and navigation model. The reason why we focused on neighborhood effects is because we were worried about contamination or spillover effects. So just as an aside, we are doing the RC because we didn't see as much challenge in terms of contamination once we quantified it, but that was an initial concern, so that's why we wanted to pause it first. So with that in mind, I'll just highlight the majority of women were between 52 to 64 years old, primarily of Mexican descent. About 61 to 54% had had less than a 9th grade education. And something I like to point out often is 2/3 an annual household income of less than $15,000 a year in the freaking United States. Take out the word freaking. Less than $15,000 for your family, not for you alone. So I just want to highlight this. When we invest in communities, and that's really the policy implication that I'm happy to talk about later, we should invest in those individuals who are most impoverished and most in need. Because $15,000 as a household income is something that is a public health priority as much as breast cancer. So with that in mind, in terms of the different arms, going back to the science, what we see is that our control arm actually was more likely to have insurance. Our intervention arm was more likely to say they wanted a mammogram, though they had rejected that warm handoff. So what did we find in terms of the data? Here's what I want to highlight and remind you all of. Everyone had access to free care. Everyone had access to need and navigation in terms of housing needs, telephone needs, what you will. That was the same across arms. The only difference was recognize somebody as a leader, thinking through the participants, and letting them know that we believe that they were going to share that information and working with them on the message. Is the only difference. With that in mind, we see 72% of individuals who were treated as leaders got mammograms relative to 48% of individuals who were treated as passive recipients. I want to highlight that when we actually look at this among people who didn't talk to any of their network members, we still see about this amount of difference, or about a 20% difference. So it doesn't necessarily mean that you have to do network members. This is where network interventions we don't talk about often. Network interventions in and of themselves can benefit the agents who are doing it. So why not do network interventions with the people whose behavior we want to support? Because they can be, one, good leaders, but two, even if they're not out there in the community, they're out here in the community because they represent the community. So with that said, like I mentioned before, we have an RCT. We've changed it up a little bit. Now we're working with FQHC, or Federally Qualified Health Center participants. Federally Qualified Health Centers being community centers in impoverished area communities who are that safety net. We are now focusing specifically on genetic counseling and testing, which is a slightly different bird, with the idea that actually if you know your risk, and if you are identified as having high or elevated genetic risk, you can get a free or covered breast MRI twice a year, covered by the state, covered by the CDC funds for it. And so moving into the space that risk-based care is becoming more and more accessible. Does this in-network intervention actually lead to better behavior for women who are, or patients I should say, who are Latina, don't have health-related volunteerism, and have either had breast cancer or ovarian cancer, or have a first-degree family member that had not gone genetic testing? So the only difference in terms of metrics is the outcome itself. We've assessed whether they would be interested in doing an assessment to figure out what their risk is, and then doing genetic counseling and testing to determine and confirm high risk of the, having a mutation, if you will. So relatively small, we just started, yes. But we've got about 78 randomly assigned, which is about 2/3 of the sample that we want to get. And just to note here, we have essentially a very similar population. What I want to highlight with the RCT that we didn't do previously is we have confirmed or documented information around their risks. So even though most people are insured, funnily enough, about 83% or about 80% overall have financial hardship that does not allow them to access health care and is a daily challenge in their minds. With that in mind, we also have 1/3 or over 1/3 who are exposed to domestic violence, have unstable housing, have travel instability, and the like. With that in mind, what's the impact of treating individuals like leaders? Just assuming that they are going to do it and entailing a leadership plan. What we see here is with an outcome that is primarily access to phone-based care, we have relatively comparable uptake. Everyone's requested these services in terms of assessment and all of that. But when you actually look at who gets assessment, we see the numbers slightly change. And then when you look at among the individuals who've been identified to be potentially at high risk, we have 60% in the Empower arm who have gone on and gotten the genetic counseling and testing relative to 19% of education. What I want to highlight here again is everything is the same in terms of navigation and addressing structural barriers. The major difference is treating and respecting patients and clients as our leaders and our partners in this. So with that in mind, hopefully I've given you a preliminary information. There's a mess of study design limitations. We can talk all about them and you can rag me on them. It's great, I'm good with it. But hopefully I've given you some evidence to suggest that network interventions may benefit the most vulnerable and resilient when we incorporate them as the leaders in these interventions, not only as the recipients. Just really quickly, because everyone's like, yeah, but we talked about networks. Give me a network, please. Okay, so with that in mind, what were the network outcomes that we saw? Just to throw out there, when we treat people and engage them and give them action plans to do it, it turns out they reach more people. We're surprised, fully surprised on this, right? So 41% reaching more than 7 network members across 6 months relative to 20% when you're giving the information. Simultaneously, there's also greater depth in terms of message quality and a focus on mammography recommendations or mammography guidelines, because what you talk about matters as well. What I want to highlight here is these ain't 0%, right? So just highlighting this is a message that has been published by many people in this room often before, not staring, right? Networking methods are particularly important for all behavioral interventions. So that's to say it doesn't have to be a network intervention for network metrics to matter. So that's the quick thing I'm going to mention really quickly now, is that network methods are a way to measure all community event interventions, just in general. Because more often than not, especially in marginalized and resilient communities, those positive spillover effects are going to happen and are going to be particularly strong. Here, I just want to acknowledge the great team that I have for the project called OASIS, which was an R21 I was doing concurrently with the work with Latinas. I want to recognize Nayan Bergeron, who's in the room here today, and I want to just say that all this work was 100% elevated by her. She did everything, and she's currently doing a network intervention looking at weight management and how to do network interventions, not weight management, and is doing this work and has adapted it, and it's phenomenal. So you should talk to Nayan, we're very good. She doesn't want to do that. Okay, that's fine. So I want to also recognize Aditya Khanna, John Schneider, Kareem Watson. Aditya and Kareem were MPIs on this. And this is, again, just investment in excellence and recognizing that excellence is happening and saying that as much as is possible. So with that in mind, our R21, really quickly, we were doing a 2-level egocentric analysis. We essentially engage individuals who were navigated versus not navigated. And navigation was not network-based. It was just giving information and getting them to the care that they wanted. And we looked at African-American women who had previously been randomly assigned to either get that navigation, get that extra support, or get standard care. We engaged them, about 100 of them, and then we engaged about 142 of their network members, family, friends, and the like. And we assessed how their breast health screening behaviors might be different, or what was that quantitative difference between the quantitative difference in terms of network effects. of navigation. Today I'm going to talk really quickly about the cost analyses. I'll be real fast, I promise. And just highlight the benefit of network methods when incorporated and integrated into cost models. I would also throw out there, if you want to talk about agent-based models, Aditya was the master of this, but I can talk a little bit about it later. So here were really quickly the two scenarios that we compared. Number one was baseline, number two was network. Baseline is standard cost interventions. How much money does it cost to help every additional person get a breast cancer screening, for example? So pretty standard. The network one was, how much are we paying for all the people who are getting mammograms? Not only the participants, but the network members that they touch. So a slight difference. In terms of cost data, the main difference is that in the standard care arm, we incorporated the costs of getting people mammograms, which is costly still. So we would have a number of individuals times how much it costs to get a mammogram. For navigation, we incorporated the costs of counseling and doing the arrangements, any mailings and cards like that, the time of the navigator's salary, and then the medical mammograms themselves. With the network scenario, here's where I will throw out there, it was really interesting. Like I said before, this was not a network intervention. So the navigators never touched base, never trained them, never gave any information around spreading the word. So with that in mind, we kept some navigation costs exactly the same. What we saw from our network data is that most of the diffusion of information, the mammography promotion, was happening in natural family encounters. So there was no additional time spent that we needed to account for in our cost analyses. With that in mind also, there wasn't any training, there was no touch point between the navigator and the network member. It was purely through the navigated patient who was doing the work. The only costs or added costs that we had were that we incorporated the additional screening mammogram costs for patients and network members. That was the fundamental difference in terms of costs, just accounting for the amount of money it takes for more people to get mammograms. And we did it to 2,000 patients. In terms of the baseline effects, we got screening mammogram data from the electronic health record and just did a simple equation on there. So we saw that about 45% of navigated patients were getting regular screenings relative to non-navigated patients. What we did in terms of the network effects is we did a fun process, if you will. We took the patient data and then for the network members, what we did is we took the average number of network members who obtained mammograms through self-report for navigated and non-navigated members, and then we adjusted it and said essentially half of those don't count because they wouldn't be able to be confirmed in terms of medical records. So we took a conservative approach to that and really tried to make sure that we were taking as conservative an approach in terms of those extra mammograms as is possible. So here's what we found. When you include only patients, you only assume that navigation only works with patients, that patients are not doing anything with the information that's given to them. What we see is that it's about almost $4,000 for every additional mammogram. So think about this as a politician, think about this as a civic leader, think about this as a hospital administrator. It's about $4,000 per additional one. And the actual difference was about 60 people. So we get about 60 extra people when we navigate and provide that support. So think about that. Now think about when you have network information. So when we incorporate and understand and collect data and incorporate the fact that patients who are navigated, patients who are not navigated are spreading the word, are potentially having these spillover positive network effects, what we see is that there are 273 extra mammograms for navigation relative to not giving navigation. And actually we see the reduction where it's about $1,000 for every additional mammogram. So network data matter. They can help us make better investments, better resource allocation, and we should be doing it. Also, we can talk more about this, but we did a bunch of network estimations in terms of how we control the network effect and who was doing network navigation and all of that. So con eso, network methods work. They should be used. Community interventions are already having spillover effects, whether or not they're talking through train-the-trainer models. We're not capturing that. They are doing it, and they want us to do it. They want us to partner with us, and NCI should fund us because it's being recorded. So with that in mind, my conclusions were, which were the very beginning. Hopefully I've convinced you. Community engagement and network science, hand in hand. We are talking different languages sometimes. Sometimes we're talking the same language, and we should just foster that. Number two, understanding that network interventions are most helpful for those who are most vulnerable, who are also the next resource leaders, right? And that network methods can be helpful just in general, regardless of whether you're doing a network intervention or not, can actually give you a more comprehensive effect and a more comprehensive cost effectiveness data. Con eso, gracias. I'm sorry I went over, I know I did. Sorry, there's a camera, that's why I did this.
Awesome. If there's any quick follow-up questions, and then we do the flip over here.
Primero quería decirle que placer oír mi idioma en este espacio. My question for you is, I'm really thrilled to hear about the cost effectiveness data, and I know that there's a lot more investment in these kinds of natural interventions at the public health level, including a lot more sort of formalization and certification. And I'm wondering what your thoughts are about the sort of pros and cons of that approach.
Yeah, I think that right now, as we're moving towards certification, especially those opinion leaders and all of that, it's completely critical that we really accurately estimate how many people they're reaching, which is not only the people that they don't mention, right? And so for those students, opinion leaders, they try to be minimal. They don't tell you all that they're doing. They don't brag, right, in that way. And so I think that it'll be really critical to incorporate network methods in statewide and like state health department models. We've done a little bit of work that's already in the Chicago Department of Public Health, really showcasing them, look at how many people we're actually reaching when we think we commit people to it. And they're liking that. I think in the context of the cost data, there are, of course, a number of ways to go. The good news and what I've been really advocating for to the cost folks as well as the health departments is when you use those standard egocentric network measures, as simple as they are, you can get a pretty good estimate, right? So you don't have to go fully deep if you are nervous or if you want to pilot test it. And that's gotten me a lot of phone numbers. So, okay,
Last but not least, for the final presentation in this panel is Nina Llamas. Nina has been also an alumni of this program and has been doing work in two sort of remarkable areas, one on Tanzania and one on HIV prevention in the US, the DC area, and both just remarkable projects. And I first got to know her through the Tanzanian project. I don't know if you're going to get a chance to talk about her a little bit today, maybe. But yes, awesome.
Yes.
Awesome. Yes. So, there's just, I'm not going to take her down. I'm going to let her tell you about it. There's awesome data.
Thank you. Thank you, Jim. I just want to say what an honor it is to be on this panel. Dr. Molina, you were fantastic, and Dr. Valente, of course, we both use your work, so thank you for setting the course for us, and to Jim for being my postdoc mentor and also inviting me to this group. So I am Nina Llamas, or my real name is Despina. I'm Greek American. I'm an associate professor at the School of International Service in Washington, D.C. I also am the associate director of the Social and Behavioral Sciences Core of the D.C. Center for AIDS Research. And as Jim mentioned, I do work both with Latino, Latina, Latinx in the D.C. area, and also with youth in Tanzania. Today I'm mostly going to talk about my work in Tanzania, just to kind of go in depth on one particular intervention. Since this was, Jim asked me to do like nuts and bolts of intervention work, so I thought that would be helpful. I want to acknowledge my partners, particularly at the Muhimbili University of Health and Allied Sciences in Dar es Salaam, which is the National Hospital, and National School of Public Health in Tanzania. And this R01 that I'm mainly going to talk about, which was PI was Dr. Suzanne Maman, who's at UNC, who was my dissertation advisor. And I can just tell you, for those who are, early stage investigators, we started this work as my dissertation. And when I was a postdoc, and then an R01 my first year of being a junior faculty member. So like the work that you do in your dissertation can really take you far. Now I have an R21 of my own, so I think, you can see the trajectory. I also want to acknowledge Dr. Molina's to the work. When you find good partners, stick with them, because that's how you get things done. And also listen to your partners. Mm-hmm. So don't just come in with this idea that I'm going to do a network intervention and we're going to get it done. They are the ones who know the communities, live in community, be there with them. That's really the best. And this is just Dr. Pajula and I in Zambia 2 weeks ago at a Fogarty meeting. So we still see each other regularly. She'll be here next year at UNC as a Fulbright. So if you want to get to know her. So just to give you a bit of context, I work Eastern and Southern Africa is the area of the world with 53% of the global population of people living with HIV. 60% of adolescents living with HIV live in this region, and in 12 of the countries in this region, HIV is the leading cause of death for adolescents. Women have higher rates of HIV compared to men, and it really is characterized by a heterosexual epidemic. So women are the ones that we focus on because they have 2 to 3 times the rates of HIV compared to men, and heterosexual transmission is what's occurring here. So I've really been driven by this work for a number of reasons, but I think Harling and Tsai's paper kind of encapsulates a lot of what drives me as well. And that, those who are most in need of interventions are not able to access or use them. We need scalable interventions for people living in this region, in Eastern and Southern Africa. They have to be implemented at scale and have to be cost effective. At the same time, we know that social support and social networks social norms flow through networks, and norms are really, I think, the biggest, stickiest challenge in Eastern and Southern Africa. Like, we're 40 years into an epidemic and people are still not using condoms, still not HIV testing regularly, still intimate partner violence is a risk factor for HIV. So we have to do network analysis and network interventions because we need to change those norms. And they argue that SNA-informed interventions can be more effective and less unequal in their effects, both because they help us penetrate key populations that are hard to reach, but also because they can improve efficiency by maximizing spillovers, as Dr. Molina was also talking about, to at-risk individuals through their social ties. I'm also driven by work on peer and popular opinion leaders, which you'll see me talk about in this intervention. And just that peers can serve as a role model for behavior change. They can help their peers evaluate and make a decision to adopt. So we focus on this particular intervention on men, even though I told you that women have higher HIV rates, but men are really important in the epidemic because they actually control decisions that are made about sexual relationships. They often, make decisions about condom use, and violence against women is also a risk factor for HIV in women. But not only that, norms are, men are important for women's HIV risk, but men also are important for their own HIV risk. So young men in particular, tend not to go to the doctor as readily as young women. And in Africa, really, most of our HIV interventions are driven by prenatal care. So women get HIV tested when they go to the doctor, and men don't have that same entry point. So they have low rates of HIV testing, and this makes the consequences they have premature mortality as well from HIV. So they get diagnosed later with HIV later in the course, and then die younger. So there's been really a call to engage men in HIV prevention efforts, but obviously finding them in a generalized epidemic is a bit of a challenge. And we're working in an area where Dar es Salaam, where it's the commercial capital of Tanzania. It's very populous, 4 million people, 70% of them live in informal settlements. It has the highest rate of unemployment in Tanzania and a very large concentration of youth. In Dar es Salaam itself, there's about a 9% HIV prevalence rate. So how do we find men in this context? Well, we used a methodology called PLACE, which was adapted by Sharon Weir at UNC. And it's really about finding venues where people socialize and meet new sexual partners. So the idea is that you're looking for places where risk behavior is occurring, not people. So it's really the idea that you're destigmatizing HIV by looking for a venue or a place rather than a person. So you first select an area where there's a high likelihood of transmission, then you go around and ask all the people in that area, where do people meet new sexual partners? And then you get a list. And from that list, you go and then visit those venues and you sort of verify that HIV risk is happening there, and then you can randomize those venues as well. So from that work, we found that there were places where young men socialize. They called them camps. And this is the Swahili word. That's what they call them. I do speak Swahili, but there's no translation. They call them camps. And these are actually sociometric social networks. So we were very surprised by this. We didn't know that camps existed in this context. A camp is kind of a cross between a club and a gang. So you have to imagine an informal settlement or a slum where youth don't really have a place to play. And so they decide find a spot, like under a mango tree next to a house, where they can hang out with each other every day, and then they call that their camp. And they give their camp a name, so like one camp called themselves Al-Qaeda Camp. And this is Al-Qaeda Camp right here. They have no affiliation with Al-Qaeda, they just think that name sounds very powerful. And this camp is actually relatively well off because they have chairs and they have a roof, but not every camp does. The other thing about camps is members visit every day. They have an elected leadership, so they have a secretary, a treasurer, a chairperson. They have even a constitution. So like Dr. Molina was saying, you know, communities already are doing things in some ways that we want them to do. They were quite large, so an average of 32 members, 85% of whom were male, and they had both risk and protective features for HIV. So what we ended up doing with the camps over several studies was just thinking about how we wanted to understand more about how their networks influence their HIV risk behaviors. So from each of the leaders of each of the camps, we got a camp roster. And that roster included each person's name in the camp, their last name, first name, nickname, their age. And then during our surveys, each name would be read aloud by the interviewer. This was before Network Canvas, by the way. So we actually programmed this with a partner in India who programmed it. And the respondent is asked if they know the person, if that person is a friend, an acquaintance, or someone they don't get along with. We also asked for 3 closest friends, and then nominations to individuals who did not respond to the survey were removed from the analysis. And then we also, for the network dynamics studies, we calculated network dynamics using mean imputation measure for missing data. So we published a number of studies on how the social network, just in a cross-sectional sense, has influenced HIV risk behaviors, on concurrency, on HIV testing, and then on multiple behaviors, including IPV with Marna Mulawa, who's here at Duke. And we've looked at like the close friends reports versus the actual reports. People don't actually know what their close friends do. They misperceive their close friends' behavior. And so there's an opportunity there to correct the misperception as well. So talking about the nuts and bolts of interventions, that's what I'm really going to focus on. So there were many opportunities for interventions in these camps. One is we know that they influence each other socially, and particularly for HIV risk behavior. We've shown that in multiple studies. They're stable venues. They have a natural leadership structure, and importantly, they also engage in business activities in which they support each other. So they help each other find work. Some of them actually have businesses themselves, like this tailor right here. So the R01 was a microfinance and health intervention to determine whether camps who randomized to microfinance and health had a lower incidence of STI and IPV perpetration compared to men in control camps. Our secondary outcome was HIV testing, and so it was a randomized clustered design with network as the cluster, with 59 camps who comprised 1,249 men and 242 women. This is a conceptual summary of the intervention. So you can see that we hope that both microfinance and the peer leadership would give men more hope and future orientation so that they would be more likely to engage in HIV protective behaviors. We know that for many men in this setting, they don't have work, so microfinance was an opportunity for them to develop their entrepreneurship and business skills and actually try to have hope for the future. And we hope that that would then help them engage in less HIV risk behavior. But we also gave them peer leaders who would educate them on HIV prevention and talk to them about gender-based violence, which was another component of our intervention that ended up being more difficult for them, talking about gender-based violence versus talking about HIV testing and condom use. So one thing that you have to think about when you do network interventions is how are you going to control for contamination? So we had 205 eligible camps. They were in 4 different wards of the Dar es Salaam. So we ended up clustering them contiguously, and then each cluster became a unit. And then we randomly picked the cluster, and then one camp within the cluster was selected for intervention or control, and they were spread apart. That's how we spread them apart geographically, and that's also described in this paper here. We did baseline and network assessments at 3 different waves. So we have longitudinal sociometric network data at 3 waves. And we have both biological assessments at baseline and endline. So because we talked a lot about popular opinion leaders, I thought I'd focus on that. I can talk about microfinance, but that's probably not as much of interest to this audience. But anyway, we had 170 health leaders who were nominated by their peers. So this is one area in which I diverged from Dr. Valente's recommendation, but my community partner really wanted us to go through this process of the camps themselves nominating the peers who would then get trained to deliver health education. So we couldn't do like a betweenness centrality or in degree centrality, although we did look at it later, and those with higher betweenness centrality ended up having more conversations about gender-based violence. So there was something there. But they nominated them. Those leaders were trained for 1 week, and then they received 2 boosters, and they received an extensive training on HIV and on how to talk to their peers about HIV prevention. So just as important is their confidence in talking to their peers, right? And like how to deliver those messages, especially about things like gender-based violence, which are so normative in society and kind of taboo in that society. The other thing we did, which we wrote a paper on, was how do we talked about retention strategies for these leaders. So this was a 2-year intervention. It was a long time for them to stay engaged in being a peer leader. So we offered them, for example, the opportunity to participate in the CAB meetings. We did a hip hop session with them from a professor here at UNC and then another professor at Duke whose expertise is in hip hop. They developed prevention t-shirts and slogans. And then we also gave them booster training to deal with challenging conversations. So for example, this young man, Osama, he was trying to get his cousin to HIV test before she got married, and they had a community meeting about it, and everybody started yelling at him when he said you should HIV test. And he was kind of ostracized from the meeting, and then later the man she was gonna marry actually took off. He wouldn't test. He talked to his cousin privately, and later it turned out that that man was HIV positive, and she avoided actually getting married to and his former wife had died. So in the end, everybody was saying, Osama, you're a savior, like how did you know? Whereas in the first instance, they had sort of ostracized him. So dealing with those kinds of challenges are really important, and staying in touch with peer leaders and understanding what they're going through during the process is an important part of intervention implementation. We also asked them some things like, we were talking about yesterday, like how do you measure or how do you understand sort of the ethics of intervention? So we asked the leaders, do people believe in you? Do you think you're more skilled, and do members of your camp respect you? And so most of them said they strongly agree, but just even measuring things like that can help you with understanding what's happening. We also asked them, you can look at network measures, but you can also ask them, in the past 12 months, how close have you become? Have you become closer? And they said, most of them said, yes, we've become more close, 87%. And then, was this because of the study? Or yes, 87%, yes, this was because of the study. So just showing that they appreciated the study. So in terms of results, men in the intervention, so this is the paper, but we didn't actually see a positive result on our primary outcome, which was STI incidence. We didn't reduce STI incidence. We also did not see a positive result on perpetration of gender-based violence. Unfortunately, we did see an increase in HIV testing in the intervention arm and a decrease in gender inequitable norms. So they became more equitable in their norms towards women, and that is a precursor to IPV perpetration, so you can think of it that way. Obviously, changing these norms takes a long time and investment, and the leaders felt less confident at sharing messages around gender-based violence, so perhaps that just didn't work as well. The other thing that I'll just mention quickly is that the microfinance piece did not work very well. Only 26% of the intervention participants actually took up microfinance, and so what we had hypothesized to happen really didn't happen. And we tried everything. We tried so many different things with microfinance, and young men need longer time periods, they need more mentoring in microfinance, they need better skills training in this setting. Those were the conclusions that we came up with. But just to round this out, I wanted to talk a little bit about how we use the network data. And this was really to understand mediation and what happened, particularly with respect to HIV testing. And just a few of these studies have been done in Africa to understand really network effects during an intervention, so we thought it was an important opportunity. And we used stochastic actor-oriented models to simultaneously estimate the evolution of the network dynamics and the behavior dynamics during the intervention. And these are amazing models. David's going to talk about them tomorrow, because they can control for any endogenous network mechanisms that may be happening during the intervention that would induce similarity on friends' behaviors, and then they can also estimate the peer influences that's happening. So this is work with Brian Aronson and Jim Moody. Brian I met through this workshop, who was amazing, we also presented at SAMC a couple years ago. The paper's not out yet. So we used RCIANA. The only thing about RCIANA is that it's highly sensitive to heterogeneity across network contexts, missingness, network instability, and overly small network size. So sometimes really hard to use depending on your networks. We did look at both wave 1 and wave 2. We found density, reciprocity, and transitivity were pretty similar across the waves, so we felt okay about this. And then these are just some sociograms of our camps, and you can see that they're pretty diffuse, they're non-hierarchical, there's no one node that has all the nominations, and then the darker dots are HIV testing. So these are the steps, which I'm not going to go over, but basically you have to go through the selection side of the model and then the friendship side, and then make sure the model of the converges, and estimate goodness of fit statistics to make sure it fits the data. And so this was our final model, which just showed that there was a significant effect of the behavior dynamics, the social influence on HIV testing. So individuals did change their testing behavior to align with their friends' behavior. We also found an effect of health leader in wave 1, just suggesting that health leaders were more likely to change their testing behavior at wave 1. So it kind of shows that the intervention likely waned over time. So shorter interventions may be better. So finally, our results demonstrated that social network influence was responsible for the trial's efficacious effect on HIV testing. In other words, peer influence did mediate the effect. But the camp health leaders demonstrated change earlier in the intervention, as I said. Just to end with the fact that I'm taking this work and translating it to out-of-school adolescent girls and young women. So one thing that you may not know, but is that there's a huge program called PEPFAR, President's AIDS Program for AIDS Relief. It's done a lot of work with the DREAMS intervention in Southern and Eastern Africa, which is a huge intervention, but it mostly reaches in-school girls. And in fact, several studies have shown that it kind of does not do very well for out-of-school girls. So we're using the networked approach to try to find out-of-school adolescent girls and young women. They actually have networks too. They don't call them camps. They're smaller. They're only about 13 people instead of 35 people. They don't give them powerful names like Al-Qaeda. But the baseline HIV self-reported positivity rates among our sample were 12%. So these are girls in high need of PrEP and high need of HIV prevention interventions. And I'm happy to talk about that with anyone. Future directions, network analysis can help us understand mediating social mechanisms through intervention, so I highly encourage you to use it. Using peer networks is great for reaching underserved populations, like several that have been talked about today. But I want to just caution you, that's something that I've come up in review panels at NIH, thinking about scalability, that reviewers really want to know, is this a scalable method? And one thing that I've said in my work, or have had to say, is networks are being used to recruit and retain participants, but network analysis is not necessary for the scale up of this intervention. So network analysis can help us understand what's happening, can help us understand the effects. As researchers, we're interested in network analysis. But if USAID wants to take up this intervention and scale it up, they don't need to do network analysis. We're going to prove those things for them first. So just some more things for you to think about. Asante sana. Thank you. Gracias.
All right, that was fantastic. Thank you. Now what we were sort of hoping would happen would, we have these 3 leading experts in the world on health interventions. And so we know that many of you have burning questions on how to do this well. And so we're going to just open the floor and see where folks are at. So I probably should have put a table up here with some chairs or some such. I don't know if you want to stand up here in the firing line or. But I'll let you field your own questions, or I'll field them and we'll just directly, please.
Actually, I have a question for Nina. So I know in Vietnam, they've found that with HIV, they're reduced adherence to medication as well as having home visits because of stigma and shame.
Yeah.
I don't know what the actual post-diagnosis treatment looks like.
In Tanzania? Yeah, they have access
Any
to.
of that, like, how did they conceptualize HIV status? Like, was there like that heavy shame? Were they like not seeking diagnoses? Because I know, like, at least in the United States, I've seen this a lot with like STI diagnoses and whatnot, or even cancer sometimes where it's like, well, if I don't get diagnosed, I don't have it, or I don't have to deal with it. Did you have any experiences with how they conceptualize HIV?
No, we were actually really surprised at the HIV rates, and we finished data collection right before COVID, and then Tanzania had a denialist president, and it's been a long, complicated way back. But, he died of COVID. So, yeah, the new president accepted vaccines and so on, which I've written about as well. But anyway, so I haven't done as much work to understand the young women in our cohort, their perception of HIV, but it is very normalized to some extent, and people do have access to medications because of PEPFAR. So I think like 76% of people are on ART in Tanzania who need it, which is pretty high. I think for like many of the communities that we work with, for them the more important thing is having a job, having a hope for the future, and so on. But yeah, we'd like to do more work on that in the future to kind of better understand their perceptions. Yeah. The other thing I should say though is that women are highly stigmatized around HIV. So in the sense that women are the ones blamed for bringing HIV to the family. And there have been some reports in Kenya that women won't go for antenatal care because they're afraid to get an HIV test, and they're afraid that it'll be positive, and then the family will ostracize them. So,
Right.
yeah.
Please, sorry.
I have a question about sustainment of this awesome work. So I really appreciate the partnership with the community, and I assume that that's going to help with sustainment. But once the funding is gone, what do you guys, like, what happens to, like, in a lot of cases, the sustainment of this awesome work can end, and do you have any potential solutions for that or ideas?
I mean, I can start.
Go and pass the mic around. That's useful for us for the recording.
I'm a monster. I'm sorry. I forgot the recording. I think part of what I've been advocating for the Empower model is that these network effects are sustainable, because what we're doing is trying to shift what we tell patients, right? And using that work, but then the network effects and what they propagate, we're not necessarily paying patients to then engage their family and friends. We're giving them the tools to do so, which helps. The thing that I advocate for at a policy level is, as we know, a number of payers have started to do reimbursements for preventative health, right? So sometimes your insurance company will pay you a little bit for a certain amount of physical activity or for certain weight management, things like that. And something I want to advocate for is that we expand that model, right, of incentivizing health in terms of doing health coaching and things like that. But yeah, I will end there. But I think I will also just throw out there, the programs that we have, a lot of them are already in place. So when I came in, that leadership model was already there. We just changed the community, like the population that was there, right? So I think for me, it's build a partnership and recognize that all of your work should be built on what has already been there, and you're expanding on it. You're not asking them to do something totally different. You're building on that in a way that they can sustain without you, right? If you're gone as an academic partner.
Yeah, I'll just add that, like, finding funding wherever you can. You know, so like I've received some funding from Fogarty, like small grants, because I'm part of the Alliance for Implementation Science in Fogarty in Africa. And then I'm part of the CFAR, so work with La Clinica that I do in locally in DC. We have like a community research scientific interest group and we got like a supplement grant last year to do a little bit of work. So just trying to sustain when the big grants don't come through, I think is important. But just also sustaining the partnership in whatever way you can, I think is important as well. And then disseminating your work so that right now with the adolescent girls, we're looking at the Tanzania's National Social Protection Program and trying to emulate their model so that they might take up whatever we find and scale it up.
And I'll just add that generally network interventions are quite sustainable because you've already empowered people to do things. And we may be gone and we may no longer be documenting it, but those folks are still there, right? And they're still doing it.
Yeah.
Please.
You guys used to talk a little bit about ethics and
Yeah.
network interventions. Could you talk a little bit more about that? I guess I'm trying to wrap my head around it being unethical because interventions are supposed to change people. They're supposed to like change or whatever. Like they're supposed to change networks. I guess. Yeah.
Right, I know.
Could you repeat
Yeah.
the-
For those
could you
that
repeat the question?
Didn't hear the question. The question is, you know, can you talk a little bit about the ethics of these kinds of network interventions? Because we are making changes to networks, so we're intervening on them.
Yeah, you can also. I mean, so the work that I presented a little bit on beneficence and was funded by the Fordham Ethics Training Fellowship, which is just so fabulous, and like they helped me, push me to think about it. So we also asked them questions like, you know, did you feel the intervention changed you or your friend changed you? And a lot of them said like, my friend changed me, you know, so for the better. So asking those kinds of questions, I think helps get to the ethics. We did have like a camp that totally dissolved where the leadership collapsed, you know, and we think it probably had something to do with our intervention, like that, you know, we were working with one leader who then people didn't trust, and so there are some ethical, you know, that camp dissolved. Essentially, we dissolved the network. But whether that would have happened anyway, we don't know, you know, and I think it's just important to monitor these things. And then we're still in touch with a lot of these camps, so they tell us what's happening, and they ended up, half of them ended up forming a new camp, going to another camp. So I would just say monitor it, but Dr. Valenti probably has other ideas because he's written on it.
No, I think you have more experience than I do in this, and I do think we have ethical responsibilities to monitor this stuff, but we also have an ethical responsibility to use our tools to do good. You know, instead of always focusing on, well, maybe we did something bad. Well, bad things are happening all over the place all the time, and we have an ethical responsibility to do good by our communities. And I think not doing these interventions is ethically and morally irresponsible.
Yeah, I want to just add to that. I think that when doing these trainings, always offering an opt-out option and then also doing continuous assessment, like how did it go, what's going on, is really helpful. Something we do a lot with the programs of the community partners that I work with is really emphasizing this is a labor of love, you know, like being an agent of change is not something that's going to be easy all the time, and just providing some resilience and some supports and ideas, and then being empathetic. People choose to take a break and all of that, and I think that opt-out and that compassion in terms of whatever behavior they provide, being okay with that and being a trustworthy source, so they can trust you and maybe resume the manual, maybe do what was good for them and then move on. But I think just being accepting and understanding of that.
Yeah. So this is kind of maybe a more ethical question or just like a situation, but like kind of going back to the diffusion of innovations, what if there's something like you're doing a group intervention among participants? What is the ethicality of inserting actors that talk about like implementing these interventions and having positive successes in that, and using those positive successes as like the early adopters to put basically gasoline on the fire to spread like I guess that's a terrible analogy, right? But to spread you know, your messages and like say empower them to do that.
Yeah, I mean, I think public health does that all the time. I mean, you know.
Yeah, I can talk a little bit, and Nyan can also talk about it through the intervention that she's leading in terms of Bridging Friends. I think what we've seen and what we start, our community health workers oftentimes start with the success stories, right? So a lot of those phone sessions start off with, here's what happened when I was diagnosed with breast cancer, which is why mammography is important, but then here's how I started talking to my family and friends. I was really scared and all this positive work happened, right? I think what has worked equally well with the success stories is acknowledgement of the not great success stories. Kind of turning back, being fully honest and creating a space where we can be like, my neighbor just did and did ignore me. I was left on red on this text message, and providing that space wherein like there's successes, there's also challenges. I think in some ways is truly impactful. It's just being authentic, right? That it's not always going to be a success. We treasure the successes and we sit with not successes in that way.
I'll just also add that we typically implicitly think about diffusion theory as the mechanism by which all of this is working, but we oftentimes don't measure that explicitly, right? And so, you know, I'm a huge fan of diffusion models. I love the precision that we can get from them, but we don't oftentimes record that kind of information, and we don't trace it in a purely diffusion model. And that has frustrated me for decades, because I thought with the advent of social media, we're going to have network diffusion models like crazy. I am still going to be famous. But it hasn't happened yet. Yes?
Sorry, I guess more for you talking about the spillover effects, and especially if you have an egocentric network, how are you capturing, is it them reporting on who I talked to, do I think they got a mammogram, or is there any other way to get at the spillover effects?
Yeah, that's a great question. So what we did in the K was definitely do kind of just self-report of the network member. Then what we did for the R21 is we engaged a sample of the family and friends and did a concordance score around it. And we compared and contrast, like, you know, you would assume, right, if they're reporting more, is there more social desirability bias, right, among navigated participants versus not? There's no significant difference. There's I would say about a 48% concordance rate in some cases, which is not a great rate, right? But we can account for that, and that works. I think the other thing that we're now working with, or an idea that we're spilling over, is kind of leveraging the ecological momentary assessment techniques that exist around, because, you know, a lot of times I will tell you, it's not necessarily that people are trying to over-report on network mammography, they just not know about the network mammography, right? And so how do we do a tool that they can report on the spot when they did when they engaged the network member, and then when the network member can say, yes, and here's where I did it. I think the other thing that has worked really well in terms of network instruments that I've used is environmental strategies, just to align people back into that space as to what that conversation was like. So we often say, you know, how many people, of course, name a few of them, but then tell us where you were. You know, were you on the phone, were you not? Tell us what you said. And I think bringing that in helps a lot with the recall challenge with it, and doing that with the network member as well, so that we can really get some accuracy, right? So where did you get your mammogram? If you don't remember the date, what's the bus line you took in doing that work?
I think we had a question in the back, maybe. I'm not sure. Did you have a question?
Hi. So you all kind of alluded to this, but I was wondering, you know, networks are fluid. And so a lot of times the folks who we recruit as opinion leaders or as interventionists might leave the networks. They might be ostracized from the network, as you've all pointed out. And I'm wondering if you can talk a little bit more about how you sort of maintain the effectiveness of the interventions with the recognition of the fluidity and the ways in which being an actor in the network might then lead you to not be in the network anymore.
Sure, I can start the ball on that. I think that a lot of what we've seen, and I'll give you the positive and then I'll give you the negative. A lot of what we've been seeing, what we're hypothesizing to really quantify the RO1, is that the individuals who start out relatively isolated, then because they have that strong relationship with the community health worker, they start volunteering, and their network actually expands, right, in some ways. Is it temporary? We'll find out in the RO1, we're gonna do some longitudinal tracking, we'll see how it goes, right? So I'm gonna throw that one out there. I think for me, and this is my bias, right, in terms of collecting primarily egocentric data, is that network shifts don't necessarily impact the ineffectiveness for me as much, right? And so the idea is you might shift the network, but if you have that recognition and that training of being a leader and promoting that, even if you shift your family and friends, you are still an active change agent in that. And I think that's just something for us to think through, right? Because we constantly talk about bidirectionality. Networks affect us, we affect networks, but oftentimes we're modeling network affects us, but we're not talking about our impacts on others, right? So.
Yeah, I mean, I think it can be very challenging with using longitudinal data. And if your networks are changing, I mean, you may not be able to run those. And I don't know, David's going to update us on the David Schaefer on the RCM tomorrow. But yeah, I think monitoring it and then choosing your networks wisely. Like, have they been, are they pretty stable? Like collecting that kind of preliminary data in the beginning to know, how long have they been network members? Are they we also ask questions like, are you planning to leave in the next year? And then they would be excluded based on that. And then really making sure that you're tracking people and like we hire a whole full-time tracer, to go after people and making sure that we have all the data to contact them in the future so we can find out why they left, or if it was an ethical violation, for example.
And I also, in a lot of my work, don't see a ton of network change, right? I mean, people are relatively stable in their relationships, particularly in underserved and resilient communities. And then we also know that actually, and David again will help us on this, but according to Tom, you can have a fair amount of network turnover and still estimate Siena models. Like you can have 50% network turnover and still, as long as you capture the whole network. Yeah.
Right.
Yes.
That was wonderful. Thank you so much for your expertise. One of the things that jumps out at me when we talk about network interventions is that typically we're talking about going in and doing some exploration and designing an intervention and implementing it and seeing what happens. But in my field of telecommunication and policy, there's a saying that practice runs ahead of academia. And so out there, as Yame said in her presentation, there are a ton of folks who are already doing network interventions. Do you know, is there a literature on actual experiments in network interventions, seeing what happens if you do those types of changes? Personally, for me, that's been my experience working with network interventions is kind of following what a program or what a state has decided to do and seeing what happens later. So there's much less control over the outcome.
So the question is that practice oftentimes precedes policy, and that there are things going on out in the field that are ahead of what we're doing, and they're not necessarily running an randomized controlled trial in order to test those effects, but they're just doing them. And I actually have an apocryphal story around that very issue. In the mid-90s, I started working on network interventions, particularly the peer opinion leader model, and I was visiting my brother who was running 15 restaurants in Atlanta. And he goes, whoa, that's a great idea, this opinion leader thing. I'm going to use that because they're constantly, the wine list, and all these are high-end restaurants, the wine list is always turning over, and so they have to constantly train the staff on the wine list, on the offerings and whatnot. And so he would just go in and start asking all of his staff, so who's the best person that's going to teach everybody, right? Now, did he do a randomized controlled trial? No. Did he collect data for me? No. Did I get a cut of the proceeds? No. Nothing, right? But it's all out there in the field happening. And in business, this happens all the time. Pharmaceutical companies are using network data to find peer opinion leaders to push their drugs and therapies all the time. I mean, to the tune of billions of dollars, right? So there's a lot that's happening out in the field that is not being documented by us in the academy, unfortunately or fortunately. So when we talk about this in business settings, it resonates really, really well. They're like, we do that, but not quite as, rigorously as you do, but they don't have to accumulate evidence and publish it in the journals. They just worry about the bottom line and doing what they need to do.
I also think of your work on the FCTC, the Framework Convention on Tobacco. I mean, that was sort of a natural, following a policy on tobacco.
Yeah, I think global spread.
Yep.
And just building on that, I think using different words, right? So the word network, right? I don't know that most practice people who are doing network interventions are using the word network, right? So a lot of this is leadership models, leadership trainings, a lot of workforce investment in practice in hospital and healthcare settings where they're doing exactly what Dr. Belinda said, right, in terms of how they identify the network, the opinion leaders and groups, and kind of build on that way. So we could maybe talk offline, but I just feel like there are keywords that are network-esque, and we just got to get that language in there.
Elizabeth.
Do you guys know of academics who are like taking that next step and like creating tools, network intervention tools and then testing them using rigorous, study and then launching companies based on these tools and having like this hybrid situation in the academy where you're a scholar and also like a business person? Like, is that a viable path, or do you guys think that's a risky path, or do you know people who are doing it?
So I try to state the question, are there people out there that are on the cutting edge of this stuff and creating tools and implementing them in the field and sort of bridging that academic industry partnership gap? And I would say the people that are doing this to some extent are the Ron Burts in the world who and the Paul Leonardis who embed themselves in organizations and do a lot of work with them and understand what they're doing. But I will tell you, I've done a bit of consulting to both industry and organizations and for pharmaceutical companies. And they love this idea, right? And we'll present the data to them, and then they'll just continue doing things the way they've always done them, It's very hard to get the adoption of, say, an opinion leader intervention, even when you're going to the opinion leaders. And so, when we published our paper, what year was that? I think it was 2010 or 2011. We did an analysis of physician networks in 3 cities: San Francisco, LA, and New York, right? And we had collected network data. We'd worked with the pharmaceutical company, so we had a trace on exactly when the physicians adopted this new therapy that had come out. And we published the paper, and our industry partners goes, "Wow, this is really cool, man. It's amazing how quickly this happened." And I said, "Yeah, when I finished my PhD in '91, my goal and intention was to replicate the Coleman, Katz, and Menzel data that had been collected in 1955, right? So yes, it only took 20 years, right, for that replication to happen. So these things move at a glacial pace, unfortunately.
One thing I would add is that there is a dedicated funding mechanism for researchers to work with small business folks. So this is not like there's the NIH and NSF both want, because Congress wants to start businesses, so they both want to fund this kind of work. So if you're out in the world and would like to do this, there's opportunities.
Yeah, the SBIR mechanism,
Okay.
right? Yeah, and I've worked with MD Logic to do this. We've got a tool that's out in schools to combat bullying and victimization. Yep.
I would just, I would just add, and this gets back to the earlier comment around certification for community health workers and navigators, which to me I identify, right, as opinion leaders are naturally in there. So we now have over 10 states that are doing statewide implementation of these opinion leader interventions where they're relying on grassroots organizations. I think there's a lot happening in nonprofit and government interactions in the programs and adopting it. Here are the challenges. They're not collecting the network data. They're implementing the interventions. They're not collecting the network data to actually demonstrate how great and how much better their reach is because of that. So that's part one. And part two, I think, as was mentioned before, the private sector is interested and excited, but kind of looking in my mind as to what CMS is going to do, to be like really honest. And we're talking about health, right? For like reimbursements and things like that. So I guess I would just throw out there, I think there is the scaling that is happening right now and it is sustainable. The challenge, I think, is the different languages that are happening around that. They're just sparking these missed opportunities, right, in that space.
All right, I think in the interest of keeping this not too far behind schedule, let's take a quick break. Thank our panelists for the work on this. Seek them out if you're interested in this work over the course of the rest of the workshop. Take 10 minutes or so and grab some coffee and use the facility for the panel on. a field experiment or kind of, RCT, sometimes formally training, but it turns out that that's a hard project to do. And so we thought it would be really great, and I don't know about the fields you're writing in, but the field I'm writing in, you can't write a paper anymore without explicitly addressing the causal inference question. And the best way to do that is with experiments. And so we're really pleased today to have Sharik Hassan, who's from the business school here at Duke. He's worked on a number of large-scale network interventions, and I don't know if any of them specifically in the health context. But
none of them in the health
none
context.
of them in the health context, but he has plenty of experience in understanding the causal modeling and the experimental implementation side in the field. And then we have Ashley Harold, who's an assistant professor of sociology here at Duke, and who's worked a lot with network exchange experiments and other kinds of lab-based experiments with using networks. And that's a really, I think, underutilized treatment within the social networks and health field. And so I'm really thankful that she can be here to share that with us. So Sharik, you can take it off, and we'll start there.
All right. Thanks, Jim. Pleasure to be here. So I'm going to do something different, I guess. I'm not going to talk about one project or delve deeply into any bit of my own research. I'm just going to talk about some papers that I really liked, and maybe of these papers as part of experiments we've been run. The reason I think that's kind of useful is I think we're all networks people, and we like thinking about network experiments as a series of patterns may be useful. And the examples I'm going to give are not in health, so I'm not a health researcher, but hopefully some of these ideas may be useful in your own work. So field experiment, 2 words. I think the field part is real people. The network intervention stuff that was presented right before this is really inspiring. As a graduate student, I was very inspired by this work. It's just very cool. It's always cool, as a field researcher myself, there's nothing more invigorating than being out in the field with real people. It's by far the coolest part of the field experiment phrase, field part. Real people, real meaningful outcomes for them and hopefully for society. And then the experiment part, I've been thinking about why I got into doing experiments. I think as a graduate student, I realized people want to answer causal questions. I think that's why we're in science, either to describe or to make causal statements about X causing Y. That way we understand the way the world works. I realized I was not good enough to do this with observational data. And there was no way I was going to write some likelihood function that was going to solve this problem with observational. So I thought, hey, what's easier than flipping a coin? I'll flip coins. That's for a living. So randomization into conditions done by experimenter or naturally in a field setting, and this is to basically get at more causality than you would be in other contexts. And so there are hundreds of questions that we can try to answer about networks using field experiments. I'm going to try to talk about papers that do 4 types. Peer effects, talk about a little bit of this context. Does person J influence the behavior or outcomes of person I? Lots of different ways that this can be done. Network formation. In fact, actually, this area has been publicly experimented on the least. And we actually have a set of very early facts. This is the stuff by Thomas Allen at MIT on propinquity, and then a series of other studies on propinquity. What affects whether I hold the network. And the diffusion, so how do you leverage that information to actually design interventions, and then using the information inside networks to make policy choices. So that's what I'm going to be talking about in terms of papers. So let's talk about peer effects. Before I do that, I just want to frame the inference problem for field experiments or just networks in general, and just understanding the basic dyadic influence process sometimes we're interested in kind of Alice, A affecting B, influencing B. And, you know, we can basically run a model, I'm sorry, this is all the way at the bottom, looking at the outcomes of Bob as a function of the characteristics of Alice. You have, let's say in the educational context, grades. How does Alice's academic background or experience affect Bob's? So you might run a regression of the form y equals beta 0 plus beta 1 times you know, Alice's score plus epsilon. And the problem is that it's really hard to tell whether this is causal or not. There's lots of different reasons why we may not believe that this is a network effect. So there's a reflection problem. The regression specifies the influence of A on B, but we may be actually picking up the influence of B on A. We can't tell these two apart. So important to figure that out. Selection. Similar people are more likely to interact. If Alice and Bob are both really, really smart and they decide to interact with each other and form a tie, you're not really measuring the influence of one on the other. You're just measuring the fact that smart people like interacting with each other. So we're picking up homophily, not influence. There may be common shocks. People who are interacting have common context and common experiences. So maybe Alice and Bob are actually in a group of friends together, and their friends are actually making both of them better, and they're not observed in the regression. Or they have a great teacher that may be teaching them tons of interesting stuff that may make them both smart, and we're not understanding the effect of A on B. So what we might be picking up is the effect of common experiences, maybe noisy hallways, extra coffee on the dorm floor, good teachers, all of these things. In essence, we have no idea what the heck is going on, right? And as a result, we can't really make policy recommendations based on this analysis. We don't know what we're picking up. And so in a sense, this changes what we can say theoretically, but we can also say practically about what policymakers can do. So in essence, there's an imbalance between the treatment and control groups because there's some external factor that may be causing this correlation that has nothing to do with the network effect. And so the identification problem, if we think about it just visually, is actually an uncertainty problem. It's a problem about how much of beta 1, the effect of A on B, is actually the effect that you care about. Can I identify the effect? That's all identification is. Is it all peer influence? Is it entirely something else? Or is it somewhere in between? And this uncertainty about the extent to which you're saying something about the thing you care about causes a real problem. So how do we deal with it? Simple ways to deal with the reflection. Just lag the independent variable. Use Alice's grades or scores before she ever met Bob. Easy. Easier. Selection. You could you include controls that account for dimensions on which people may decide to form a connection. But as we all know, there's lots of reasons why idiosyncratic reasons why people might want to be with each other that the researcher just never will be able to observe. And then common shocks include characteristics, controls, for the context that may influence the performance of both A and B. So basically, the model then changes to Y. Now it has got a time index to it because of the lagging. Beta 0 plus beta 1 lagged. If anyone wants these slides, I'm happy to share them as a function of all these controls. Now, this could still be problematic because there is an infinite possibility of other things that may be going on that as researchers we just can't observe. And so how many other factors can you actually account for in your controls, especially with small sample sizes like the ones we work with? So why do you have randomization? It creates balance between the treatment and control groups. All that means is that basically it breaks the correlation between the characteristics of the treatment and the person being treated. right? In the network context, the treatment is always another person or some part of the network structure. And the worry, for instance, is that the treatment, being in a network structure, maybe connected to this person, is correlated with your unobservables. It reduces the likelihood that unobserved factors of selection, it doesn't eliminate it, but in expectation, it reduces the probability of it. There's nothing ever that randomization solves perfectly, but you know that in expectation, basically there should be zero correlation. So it reduces the likelihood that unobserved factors of selection or context are causing these effects. Now imagine if I flip a coin and I say you're in, you're out, you're in, you're out, you're in, you're out. That coin flip, 1 or 0, heads or tails, should be completely uncorrelated with anything about you, right? Who your friends are, who your parents are, what you ate for breakfast today, your thought last night about how, what you were going to wear to the session is completely uncorrelated to it, because the only thing that's correlated to it is the physics of that flipping of a coin. And that means I can basically ignore all those other factors. And that ignorability is the power of randomization. In the end, this is because the treatment condition, whether you're connected to that person or not, in this case, and the characteristics of the pairs are now completely uncorrelated because of this ignorability that comes from the mechanism through which you are assigned the treatment, that flip of the coin, that has nothing to do except for the flip of the coin. Okay, so I think one of the coolest papers on this is a paper by Bruce Sacerdote at Dartmouth, where this paper I read as a graduate student and thought, wow, he basically gave us a framework to really think about how do we actually estimate network effects. So he studies Dartmouth students, and there was an interesting quirk that for many years, probably still happening today, maybe not less so, Dartmouth students were completely randomly assigned to dormitory rooms conditional on gender. And that means that there's no correlation between any characteristics of the roommates and their backgrounds. Now, you can run a regression where you look at the high school grades of your roommate and see whether it has an effect on your academic performance. Interestingly, that effect was basically very, very tiny. He found other effects, basically whether you decided to join a fraternity, other social dimensions, where your roommate's choices, interesting, those factors still have the reverse causality problem because of a reflection, because the choice you make to join a fraternity is occurring at the same time as your roommate's choice, and so there may be kind of who affects whom is still entangled. But it gave you a very, very clear framework. You randomly assign roommates, and then you can look at the roommates' pre-treatment characteristics before they ever interacted with each other on your future outcomes. He actually found that there was no evidence for a causal peer effect, and there was actually kind of a cottage industry of randomized roommate studies in economics, which in expectation found very little effect of network characteristic peer influence on academic performance. And so that was really, I think, a little bit shocking for me, because I was raised in an environment, my advisor was a network scholar, where networks affect everything, they're everywhere. And I'm like, oh my God, when you actually have a clean design, there's no effect of the network. What the heck? And so it was like, a real motivating thing for me to think about, okay, well, can we actually do the Sacerdote study better? So what I did, here's a paper I wrote, it's in the ASR, with actually better data than Sacerdote. With random assignment, we went in, actually randomized roommates working with the university, and then we also measured social networks, something that they didn't measure. They just had randomized roommates. And so what we were really trying to figure out is, why aren't these studies actually finding any effects? And what we found is that a couple of other things. They had dependent variable problems. Everyone was in a different major. Lots of, like, there's how much variation is there even in people's SAT scores when they go to Dartmouth? I would imagine it's very little. So we got lots and lots of variation, and then everyone took the same exams at the end of the term, because in India, everyone takes the same exams. So you actually have very, very consistent measures. And then you find actually pretty strikingly large peer effects, even with the same design as SACER. But what's also most interesting in this is that we found that basically friends have no influence on your academic performance because we measured who people connected to. What we found out was essentially the people that you study with regularly, they're the ones that influence you. And some more interesting stuff, we had data for 4 years afterwards, so we could actually track the dynamics of whether people formed a tie with their roommate, how long the roommate ended up having an effect. And what we found is if you get, so remember these peer effects are bidirectional. You can have a crappy roommate, your performance declines. You can have a good roommate and your performance increases. And what we found in this paper is that there's a lot of selection going on. If you get assigned a crappy roommate in the first year that isn't really academically oriented, your performance does drop. But you don't study with them after the first year. And so their effect declines over time. On the other hand, if you get assigned to a really smart roommate that boosts your performance, you continue to have that performance boost over time. And so people aren't automatons. They're like, you're bad for me. I don't want to talk to you anymore. Whereas I'm actually getting great performance benefits, and so there's a selection going on that we can observe because of this randomized shock over time. And so this network experiment allowed us to both get treatment effects, but also selection effects, right? There's adding and dropping of ties over time. People have done this in lots of other contexts. Now, in my context, where we randomize people that didn't know each other, people often use big networks where network structures already exist. So there's a very famous, now infamous experiment where people on Facebook were sent messages about going out to vote. And they found that the people that were randomized messages to say, hey, go out and vote, went out and voted. That's not interesting. There's nothing networky about it. But what's interesting is that the people that they were connected to were also more likely to go out and vote. Obviously, this has led to lots and lots of problems of election manipulation and everything. But here's another network experiment. The network exists. How do you use it? You leverage it as an existing structure and then randomize information across that structure. Here's another one. A very, very similar structure to it. A network exists. You have online friends. You're connected to them. You give a free product to one of those people, are you more likely to buy that product? I once heard Chuck Mansky at a conference, one of the kind of econometricians who framed the network inference problem very early on, said something really interesting. He said, it's so interesting that a lot of people are using all of this exciting econometrics and technology to get people to click on ads. So, all right, so here's another experiment that I did where we took it out of the educational context. So this is 100 high-growth technology startups with venture capital funding, and we were trying to understand how much of the knowledge that's associated with building a business is coming from social relationships, tacit knowledge, kind of a Polanyi kind of idea of the tacit knowledge affecting businesses. And so what we did is we basically created our own little boot camp with 100 startups, and we randomized them to get advice from other businesses. And these businesses had pre-existing practices inside their firm. Did they talk to their employees regularly? Did they set goals? And we measured this before the intervention. And then we randomized them. And what we found is that the people who got advice randomly from a randomized peer who had formal management practices in their organization adopted those practices, and then we tracked their outcomes over 2 years. They grew 28% larger and were 10% less likely to die. So it's the same exact framework as the peer academic study, but with businesses, and 3 of these companies are billion-dollar businesses now. It was pretty exciting. We had everything to do with it. All right, network formation. How how do you form a tie with somebody else? So lots of papers here. Here's a cool paper that I really like, where they looked like at an online dating site, and they found out that basically if you made visible for certain people, like, so there's a whole bunch of people on a dating site, and if my browsing history, all the profiles that I'm like clicking on and looking at is visible to others, like that they can see that, you know, I'm seeing their site or their page, I'm actually not likely to search. And I'm also not able to send a signal to the person that I'm clicking on that I may be interested in them. So what they did is they randomized who was in the condition where their search behavior was visible to people who were being searched. And they found out that the people who had these one-way mirrors, they could browse and no one would know that they're browsing, actually ended up getting less dates than people who whose behavior, search behavior was actually visible because people got a signal that they were interested in them, and so that led to more network formation there. So I thought it was kind of a cool, clever intervention. Another really cool one done at Harvard Medical School was looking at, basically got scientists like this in a room together to share their research. And what they found out was most scientists who worked on the same topic, even at Harvard, didn't know the other person existed. And when you put them into a room together, they were more likely to write grants together and write papers together in the future. So there's a search friction. People who could benefit from interacting with each other don't even know they exist. And these randomized shocks could just basically provide awareness of people that allow them to form this connection. And the outcomes aren't like qualitative, like, oh, how do you feel about this person's research? It's basically, did you apply for a grant? Did you end up writing papers together that were measurable, like in concrete terms? I have another paper that basically shows, this is in Management Science, where we actually can look at not just the first order, do people who get put into the same room together form a tie, but whether people, what's her name? Angel. I connect to Angel randomly, but that's not what I'm interested in. I know that's going to happen because we're in the same room together, but the fact that triadic closure unfolds over time and that now people in Angel's network are now part of my network, and that those connections are durable. And what we find is that this first order connection happens, but most interestingly, that my network begins to change. So I get connected to Angel, and Angel is a person who's at a very distant part of the network. Basically, I end up becoming a bridge connecting them, myself, to other parts of the network. And this raises a really interesting question about peer effects, right? We've been basically, what's Angel's effect on me, right? But actually, now I'm showing that it's just not Angel that I'm connecting with, it's actually Angel's network. And so is it Angel that's affecting me or his broader network that's affecting me? And that opens up from this observation of the dynamic formation of networks over time. What we also found in another series of studies is basically, okay, you know, we believe that people that are in the same room together, they form a network. It does happen, but 90% of randomized interactions never produce a network tie. And we've shown this in a variety of data sets. And what that means is that people exercise a tremendous amount of agency over who they're connecting with. And that poses a fascinating challenge for network interventions. Because if 90% of the time what you're doing is not going to matter, that means your effects may be really small, and so you have to be really thoughtful in how you leverage the network information. Jim, how much time do I have?
Yeah, so you're about 6 minutes over.
Okay. Huh? I'm 4 minutes.
We'll give you 10 minutes, 5 to 10 minutes.
Okay, 5 minutes. I'll take 5 minutes. I don't have much more.
10 is
So,
interesting, 5 is not.
okay, let me skip this because that's a lab experiment. So another cool paper was done in Malawi. This paper just published last year, and it's really cool. So they go around, they have this farming technology, and they want to increase this diffusion. And it's very easy to adopt, but it's not being adopted. So they go to about 200 villages in Malawi, and they measure their networks before any intervention is done. And then what they do is they use ideas from network theory, so things like traditional diffusion models, or the Centola-like diffusion from kind of multiple angles. Influencers. I don't know now I'm blanking on the term, but lots of using like the chieftain, or using the person with the highest degree centrality, or the person with the highest brokerage to assign the interventions, who to seed in the network. And they basically simulate this out and figure out, okay, which different network theories predict different injection points of this farming technology in the network. And so they basically do a randomized control trial where they try these different seeding methods, and they find actually that diffusion differs dramatically depending on what targeting technology targeting mechanism you use. In their case, they found that the targeting from multiple angles, the Centola model, worked the best, but not in all networks. And so another example of like a network experiment that's interesting. Another cool experiment was done at the US Military Academy, where they said, okay, we can find out who is having peer effects. Can we optimally design how to design the network so that maximum diffusion happens? And they found out once you do that, basically people think they're being manipulated, and they don't interact with anyone that you assign them to. So, that endogenous creation of like backing out of the experiment is also really interesting. Okay, last one. Last paper just published earlier last year. They go into villages in India and are trying to figure out who to give money to as entrepreneurs to help them scale their business. And they have a whole bunch of like different things: how well your business has been doing in the past, et cetera, et cetera, et cetera. Whether you have education, what type of business it is. None of those things affect the rate of return on the investment into that business. But they found out that if you use community information, so information from within the network, other people in the community, and so they have an experiment, I won't go into the details of it, but it's beautiful, where the community is asked, who would you invest money in? What do you think the predicted rate of return is for your venture versus your venture, and then aggregate it, kind of like a wisdom of the crowds kind of thing. Basically, you can increase the rate of return by 4x, going from an average rate of return with no information to using network information. You get somewhere between 3x, 24 to 30% per month rate of return on the amount invested if you use network information. So I think there's a lot of exciting models out there of how people have used network interventions to solve real problems. And I think there's lots of opportunity to even build on these and answer deeper questions that may be relevant to your line of research. Thank you.
Questions for Shark while I switch this over here?
All right.
Sorry, I didn't mean to cut it short.
Awesome, there we go. All right, folks, we're have Ashley here from Assistant Professor of Sociology. I already said this already, but I won't take any more of your time. And Ashley, thank you. Take it away.
Hi, thank you so much. I'm here today to talk about lab experiments, and while I can't promise that I will have much, if anything, to say about health, I can certainly talk about my experiences conducting experiments on and within networks and in the lab, or as is becoming increasingly common as a result of the pandemic, the online lab. But before I start on the nitty-gritty of experiments and tell you why they're so fantastic and what you could do with them in your own work, I'll give you a brief overview of what exactly I mean by experiments, and then, like a good experimentalist, I will plug them and tell you why they're so great, and maybe take the opportunity to defend them a bit if there are any of my reviewers out there in the audience. You almost certainly know the basic idea, right? So what experiments are. So the researcher manipulates some explanatory variable, or it can be more than one variable, but usually just a few. It's best not to get too crazy. And then you're observing the effects in some other variable, the outcome of interest. One of the gold standard examples of this is actually in medical research. So it's the administration of either a drug with an active ingredient or like a placebo pill to observe whether the drug causes weight loss or cures some disease or prevents hospitalization from COVID, whatever it is. And when you do that, you also hold constant all of the other variables that could possibly be out there. So all participants get a pill. That's why you have a placebo. It's the same color and size and shape. It's given by a doctor. All of that stuff is the same. The only thing you've manipulated is what's inside. And experiments are a particularly useful method because one thing that can be a challenge for people that are studying networks or collecting observational or survey data is that when you conduct your work and you submit it or present it or publish it, some critic, some reviewer can come back and say, well, is this effect real? Or can you actually infer anything causally from what you're looking at here, or is what I'm looking at a correlation, right? And typically, like, the former is more exciting than the latter. We want to establish causality, typically, in our work. You might get feedback from the reviewer to go off some of the things that I think Sherrick mentioned too, that maybe actually what's happening is that, like, you're trying to say X causes Y. In reality, I, as your reviewer, think that Y is causing X, and things are reflecting back onto X. Or there might be some third variable Z floating out there in the world that's causing your X-Y relationship to look the way it does. You can address these issues, these critics, in other ways. So you can do longitudinal or lagged models were mentioned earlier. If you look at what happens on time 1 and then see how it predicts what happens at time 2, it's a bit more difficult to argue the reverse causality argument. You can throw ever more control terms into your models to get at all these third factor Z's that any reviewer could possibly come up with until eventually your critic comes up with some that you haven't captured. Or you can do an experiment to test that X-Y relationship in really a neat and clean way. And a classic example in regards to networks, which again Sherrick mentioned as well, so there's consistency, that's great, is this issue with cleanly assessing peer effects or influence effects, which can be confounded with other things, including homophily, as I have up here. So I study cooperation and pro-social behavior, basically what makes people be nice to each other. And one common theoretical explanation for how cooperative behavior might have evolved is that people can identify and selectively choose to interact with fellow cooperators, right? So the idea is that if you are a kind person and you go out there and you interact with people just purely at random, you'll get suckered, you will get screwed over because you'll be interacting with jerks, about half the time, or whatever proportion of jerks are out there in the world. Maybe depends on your point of view there. But whatever percent of jerks are out there in the world, that's how many times you'll get suckered. And that does not bode terribly well for cooperation and evolving. Instead, what might happen is you'll get influenced, and you might turn into a jerk yourself. You'll take on the dominant strategy there. But if people can selectively interact, or select and selectively interact with fellow like-minded cooperators, then what this ends up doing is allows cooperative clusters to form. They're kind of insulated, they're protected from the jerks out there in the world, and cooperation can flourish. Meanwhile, jerks kind of are left to go it alone or interact with fellow jerks. They're the only ones left to hang out with. So how do we test whether and how those processes play out? Well, if you want to know whether nice people hang out with nice people and jerks hang out with jerks, you can observe that easily enough. And past work suggests that indeed that's what you will observe, but what you will find it much more difficult to do is to untangle the causal direction here, the process by which this is happening. So is it because of your theory? Are people able to go out there and selectively interact with other people that are similar to them in terms of their cooperative behavior? Or are people forming ties and then influencing their ties to become more like they are? Or are both happening? And if so, how much of this is attributable to each factor? On the flip side, not as someone who studies cooperation and prosocial behavior, but as a parent of a 5-year-old in preschool, I'm very interested in this work on conformity and peer pressure and influence. So that part of the story, rather than the homophily part of the story, we all hear as parents, you don't want your kid to be hanging out with the bad crowd, the aggressive people, to take the language of the preschool study we heard about yesterday. True story, I have a kid who has a friend that I think is maybe not so great, and every time my kid comes home with like a new swear word in his repertoire, or I see this friend like throwing dirt at people at pickup, I worry because it's hard to disentangle. Is this kid going to influence my kid to do that? And that's of course what I think is happening. Or is this friend and my kid friends because my angel of a child engages in similar behavior? Or even worse, the reflection problem, right? So is my kid the bad kid and is actually causing the friend to be bad? Now, experiments can help us assess peer effects that we might be interested in as a researcher or as a parent. They can help us disentangle these things. And how they do it is these two hallmarks that make them special, not only because experiments have them more than other methods do, but because they're what help us establish causality. The first is random assignment of our participants to experimental conditions, or the level of the independent variable. Say you're interested in the ability for people to spread information to their network ties, to tell their ties about other people's cooperative or selfish behavior in networks that they didn't see firsthand, or gossip. That's a project that I'm working on right now with Tom Wolf back there. Hello, Tom. On the one hand, opportunities to spread information about what other people are doing in the network. So to tell Angel, sorry you were the guinea pig in the last one, you were the guinea pig again today, to tell Angel all of the bad things that Jim does, and you were not able to see Jim, and now you know that there's someone else out there in the network that's doing these horrible things. Sorry, Jim. It could be that this is very bad, right? So if I tell Angel about all these bad things I see in the network via gossip, this could cause selfish, jerky behavior to spread throughout the network, become contagious. On the other hand, it's possible that opportunities to spread information or gossip in networks could be really beneficial to networks because people don't like to be gossiped about. So they might be better as a result if they know that I can tell Angel about what you're doing. So in our study, we randomly assigned networks to be able to spread information about their ties, cooperative or selfish behaviors, or not. The reason we do this, I've even got the coin flip picture on here. We talked about coin flips last time. So we've covered it very well, but just to refresh your memory from a couple minutes ago, the reason that we randomly assign folks to experimental conditions is because participants have idiosyncrasies, and you want those to be distributed across your conditions about equally. It's not perfect. It's nowhere near as perfect as it is on this neat little image of a very small sample that I have on my slide here, but this is the basic idea. So going back to like the placebo versus medicine example, some people are older, some people are younger, some people are couch potatoes, some people exercise 5 times a week, some people are very, very sick with this illness that you're trying to treat, and other people are not so sick with this illness you're trying to treat. Likewise with my study on information spreading in networks, some people just baseline are nicer than other people. So that's another idiosyncrasy we can think of. And if we randomly assign people to conditions, you can be sure that these idiosyncrasies among people are about approximately equal across conditions, turning your conditions into identical twins of each other to the extent that you can. Now, if we use some other method, like in this image where we let people maybe like choose their groups, say we give the drug to like the sickest people in our study because we're nice and we want to help these people get better and they really need it. So we give all of them the drug. Or if in my study we had groups like vote to decide, hey, do you want to be in a group where people can gossip about other people, or do you want to be in a group where people are like prevented from talking about other people's behavior? Well, if we do something like that, then we won't know if our intervention worked or didn't work, because our intervention was good or bad, or because of the way that the treatment group and the control group were made up of different types of people. So our drug might not have worked, not because it doesn't work, but because we gave it to all the super sick people who were really advanced in their illness anyway. Maybe I get my next publication in Science that says information spreading works, but in reality it's because if we let people vote, the people that are going to be cool with gossip are the ones that are nice anyway and that were already inclined to be cooperative people. So random assignment is helpful for letting us make sure that we've kind of dispersed these idiosyncrasies in our participants across both of our groups. The second hallmark, the other big thing that experiments do really well, and lab experiments do in particular quite well, is procedural control. So this means that everything that the participants experience as we conduct our study is identical, except for the manipulation. So we're giving both of the groups a pill. It just differs what's inside it. Both groups are playing like an online experimental game that takes about 30 minutes. That's held constant. Oftentimes with interventions, like say trying like a program in a school or something like that, sometimes the control is just nothing. But it might be better to have like a control intervention that gives the folks in the control condition something to do, something where they interact with researchers, spend time invested in a study, or something to make sure that there's no differences in the procedure. The purpose of this is to hold constant, not these like idiosyncrasies within your participants, but the stuff out in the environment that helps us get rid of all the third factor Z's that could be affecting that XY relationship, both the ones inside the participants and the ones outside them, because all of this stuff is held constant across your conditions in your experiment. And these two hallmarks then, combining them together, these are what helps us parcel out all of the other variables except the two that you're interested in studying, which helps us establish that causal relationship, which is the biggest strength, as I see it, of experiments. They're the gold standard method that we have for establishing causality. But now let me get into lab experiments in particular, so my focus. Compared to field experiments, which are out in the wild, taking place in the natural setting, with people that are in this natural setting, lab experiments occur in a more heavily controlled environment, the lab. So one of the things that they do really well, that's great about that, is that they allow researchers to develop and test their scientific theories in a highly controlled way. And that is really their most appropriate and valuable use, if that's what you want to do. If you don't have good theory that you want to test, then it would probably be better to collect observational data in natural settings until you get to that point. Experiments, lab experiments in particular, can complement observational data quite nicely. So if your observational data uncovers some potential process that you then would like to test causally, or if you want to test mechanisms that explain the patterns that you observed, then experiments are a really, really good way to do that. Now, of course, like a very neat and clean way of testing an abstract theory in a highly controlled setting with precise measurement is great. But it's also very abstract, and some may even say, too highly controlled compared to our very messy social world. There are pros and cons to experiments, like there are pros and cons to any method, in the sense that they do work well as complements to each other. I'll come back to those at the end, but at the same time, we don't typically tell chemists, hey, leave your lab, get your test tubes, and roll them around in the dirt, because that is the way that chemical reactions work in the real world. We don't tell chemists that. We tell sociologists that a little bit more. So lab experiments, yes, they are highly controlled environment. They're sterile and they sound very sterile, and they do deserve that reputation a bit, but they're also changing. So for example, lab experiments used to look a lot like this. So like always conducted in some like basement of a university with odd, novel, or at least novel to these participants, like technology, I guess you would call. I don't know what study this is. I tried to figure it out, but I couldn't figure out what study it is. And they were usually conducted among like 20-year-old white all men, as you can see in my images, college students, especially beginning in the earlier days of lab experiments as these were. So the second image is from like the very famous ASH line conformity studies, for those of you out there who are familiar with those, where they brought one white college man into the basement of the college, and they were interested in studying peer pressure or conformity, and all these other guys are actors that are in on the experiment, and they say like a very obviously wrong answer to a very basic question. And the question is, will this guy, the guy in the middle here, the one who looks very confused, will he conform to what these other folks are doing and say like the obviously very wrong answer? The other people on the sides are the cool, calm, and collected actors. Now, obviously, these are not situations that we are often in. These do not look like the real world. And a situation where you're called into a basement and asked to say a very obvious trivia question in front of people who are actors is not something that would probably happen to you in real life. But the findings are relevant. They tell us about conformity, and they have replicated in a variety of settings, including fairly recently. I will also confess that it was hard to find, like there are many classic studies that have not replicated very well, but that's a topic for a whole other talk. That one is one that has. Experiments on networks in my field, so sociology, have long been used to test some of the like capital T theories in sociology, which is what they're great at, including the traditions of power dependence theory and social exchange theory. So this is this is one of many examples. It's a little small, sorry about that. But this one is images from networks studied by Cook and Emerson. They've done lots of great work demonstrating that power is a capacity embedded in a position in a network. It's not just some people have power and use power and other people don't. But the folks in these networks use power in predictable ways as a result of the structure that they're embedded in, not just because of the type of person that they are. Likewise, on this bottom image here, this is another classic work, I think, Yonghui and Cook, in the social exchange literature. This work is showing that holding constant like the cost and benefits of exchange and the number of participants in the exchange, structural features of exchange networks, so like the way that resources and benefits flow throughout networks, where they go in the network, predict the likelihood that people will engage in cooperative exchange and develop feelings of like attachment and cohesion and solidarity to their groups. While in the messy real world, groups of people do engage in exchange like this, so they do things like collaborative papers or teamwork projects where they're giving resources to this like common resource pool, and then the benefits from that resource pool flow back. And likewise, they do things in the real world like that on the right, where like I maybe do a favor for this colleague at work, and then they like maybe pay it forward to someone else, and it comes back around to me eventually. That's the one on the right here. It's difficult to study these things in an office if you want to test the propositions behind this theory. So these folks did it in a lab in the way that's shown here. And here are some examples from my own work, to plug my own work a bit. Some of the questions that I ask and test in lab experiments. The top one is also in the social exchange theory kind of realm. It asks how social identities, when we introduce social identities into exchange networks, which are shown with like the colors on here, again, sorry about the tiny font, affects the predicted patterns of cooperative exchange that we would typically see in the social exchange literature. So whether identities are present and whether they're diverse or homogeneous, how do these things matter for small networks that are engaging in cooperative exchange? And then another recent project on the bottom here, also with Tom, shout out again to Tom, looks at how different group sizes and network densities intersect to promote cooperation in networked collective action groups. Another thing that lab experiments are really good for, aside from allowing this controlled test of theory and complementing our observational data, is that they allow us to focus on things that may be difficult to observe or measure outside of the lab, as some things are. So people wielding power, to take the power dependence theory example. People engaging in pro-social behavior is difficult to observe or measure outside of the lab, or it can be clouded by other things like whether a researcher is watching you. And then lab experiments in particular, often focus on behaviors in particular, which is another benefit. Attitudes don't always predict behaviors. There is debate about this, and attitudes certainly can be good predictors of behaviors, but there are also past examples of work that have demonstrated that there's a gap there. For example, like one of the best examples of this that I know of is Deva Pager's work. She did audit experiments where she sent out resumes to employers looking for jobs, and she found that Black job seekers, holding totally constant the resume, the job history, the education history, all of that kind of stuff, holding constant that, Black job seekers were less likely to get a call back than white job seekers were, again with the same resume. Actually, this might be a bad example because it's not a lab experiment, but it is what it is. On the other hand, if they had given all those employers a call and said, hey, I'm just wondering, do you discriminate against people who are coming into your place of business to apply for a job? What are they going to say? Well, of course, they're going to say no. Right? So sometimes there is a gap between attitudes and behaviors, and lab experiments can allow us to pick up on behaviors in ways that it might be more difficult to do. We can use lab experiments to measure emotions, psychological states, decision making, actual generous behavior, rather than just, hey, do you remember how many times you donated to charity in the past year? People misremember that, we'll say, right? So that's another benefit, I think, to lab experiments. They are also now moving outside of the lab, outside of the black and white pictures I showed you earlier, to being online. So we by no means use representative samples like surveys do, but we have progressed a bit from moving outside of the lab space to online samples. I do get many of my participants from the IBRC here at Duke. They maintain a participant pool. So it is quite a lot of college students, but this pool in particular prides itself on consisting of not just the 20-year-old college student, or to go back a little bit, like the 20-year-old white man in college, but it actually consists of a much more diverse pool than I think we used to use, including this one, which uses not just students, but also employees and people in the surrounding Durham community. Online is another way to get participants. Amazon's Mechanical Turk is probably the most well-known. Prolific emerged as a competitor shortly after to kind of address some of the downsides of Mechanical Turk. I could give a whole other talk on that, but these are just some examples. And I also don't usually run studies in the lab anymore. I use, as a result of the pandemic, I use places like these, so platforms where I can run studies online, starting with your basic bread and butter Qualtrics to Breadboard, which is Christakis particularly designed for network experiments. ChatPlat allows you to let people chat in real time, and some of these other ones I've used as well. So things have moved outside of the lab to the online lab, which has some benefits as well. So for example, you saw the images that I have of conditions in the lab earlier. Well, those were very, very small networks. Moving to online can allow us to capture larger ones. So to wrap up, lab experiments have strengths and weaknesses. They do allow us to have that high degree of control over the variables under investigation. You can isolate, you can manipulate specific factors of interest while you're holding everything else constant. That control enhances your internal validity of your study, reducing the potential for these confounds, these third factor Z's, and allowing you to have what's really the strongest possible evidence for causality and insight into mechanisms, your moderators, your mediators. You can also use pretty precise measurement if you do a lab experiment in this highly controlled environment, and you can do it with relatively simple models. You don't have to keep throwing different control terms in there to get at the relationship that you want to get at. On the other hand, they also have weaknesses, right? And I've touched on these kind of throughout. The external validity of lab experiments is often criticized. The setting does not necessarily resemble the real world. And it's the same issue with the sample, right? So participants also don't look like the real world. They aren't representative of the population. We typically use convenience samples in the experiment. The college sophomore I mentioned, weird, so Western, educated, industrialized, rich, and democratic. That's where experiments tend to be conducted, and those are the participants that they use. And the question is, does this generalize to non-weird people? And small, I've mentioned that as well. So especially as a result of lab space, before we were able to move things to the online lab, I showed you an image from a study earlier that I did that looked at small and large groups. The small groups were size 4 and the large groups were size 8. That is not really that large of a group. I would argue that it was meaningful enough to my participants because people in groups of size 4 acted differently than groups of size 8, and I had to tell many reviewers that before the paper was out. And moving to the online space can help with that as well. The reason why my large groups were size 8 is because that was the last study I conducted in the lab before the pandemic shut things down. And what do you know, the lab space that I use has nine cubicles, so that played a role, right? On the other hand, as the experimental, I'll end on a positive note and say, if you think that the lab experiment needs to go into this different setting, great, let's test it there. We are trying to test, when we're doing a lab experiment, we're trying to test our theory. We're getting that clean causal test of it, and we're doing it with the convenience sample that we have, that is true. But we also are standing on the shoulders. We're building theory, and we're saying things that I think are important about the theories that we're trying to test, and I hope I can encourage you to maybe consider doing a lab experiment with your own work. I'm also happy to talk about it because lab experimenting is very, very hard and stressful. Thank you for listening. I'm happy to take questions. Thank you.
Awesome, thank you so much. All right, a bit like last time, I think we'd like to open it up for questions specific to either speaker or just general, like how do you do this work? I'm going to put a strong plug in and say that I do think that one of the things that's gotten into trouble, particularly for those of us that cycle around a lot with medical researchers, is that the other side of the school of medicine uses experiments, right? That's what they do all the time. And they give this placebo drug or not. And we both suffer from the lack of that power and the cost of all those concerns that they have for dealing with those consistently. So I think understanding the world that it comes from, of course, is good for all of us. But more than that, I think that there's a lot of power in these methods, either in field experiments or in lab experiments, that is recognized. And your audience in the health world is ripe to hear this kind of work. So anyway, that's just my shameless plug for why I think this is a very necessary part of what we do. And I'll open it up for questions.
I appreciate the shameless plug. Yeah.
Please.
So I do a lot of online experiments, and one of the criticisms that I have found has been the inability to control all those exogenous various factors, because especially like using chirp prime or the prime panels, versus mChirp itself, the sample that you get, at least what I've seen so far, is still like your mid, like the 30, 40 white woman, $45,000 a year income population, but there's a lot of like, you're taking it at home, you're taking the survey or the experiment
Yeah, so on the one hand, this is more of an issue for you as the experimenter, I think, and less for the critics and the reviewers, because if you do have people, yes, who are at home, and I've had that issue moving to online experiments where it's like, I do these repeated tasks that happen, multiple decisions over time, and you get these issues where someone just gets up from the group task and they go make a sandwich, or they go to the bathroom, and everybody's sitting there waiting, or they just disappear, they lose internet connection. I kind of miss that aspect of lab experiments where you could frankly control what they're doing. You know exactly where they are. You have tabs on them, right? You know they're in a quiet environment and all those things. That does become more of an issue for the experimenter. So how do I design my experiment to reduce the effects that is my experiment ridiculously long? Is it boring? Are there other things that I can do to try to make it so that these things play less of a role? How engaging is the task, for example? Other than that, yes, increasing your sample size to get at the fact that there will be noise. But if you find a difference between your conditions, then you can't say that this is due to one group of people having more children running around in the background than the other, because you would have randomly assigned that. I definitely also come across some folks that are, I don't know, I feel like there are probably less people than 4 years ago that would be very anti-online experiments anymore. Like, we didn't really have a choice but to switch to online experiments as a result of the pandemic if you wanted to continue data collection. So I do know that Shane is very against online experiments, though, to give you just a personal note. There are pros and cons to both methods. I guess is what I would say. Do you want to?
Yeah, I'll add something. Thank you. So it's a really interesting question, and I've been thinking about it like philosophically, and I'll give an example from the public health context that I think kind of relates to this question about the pros and cons of online experiments versus observational research versus maybe field experiments. And it's the research on BPA, which I think a lot of public health people would know about. And does BPA cause cancer? The early evidence was all from epidemiological studies. You had these large-scale, Deborah Davis, large-scale correlations between plastic use and cancer. But there's no causality there. There's no mechanism there. There's an interesting correlation. And then what do? You say, is there something going on? And so you have mice studies. You basically inject BPA into mice. And you say, oh, wow, these poor mice are, now kind of getting cancer. And then, someone would say, well, mice cells aren't human cells. Mice are built to last for a year, 2 years. That's what their cells are. Human beings live for 80 years. Like, there's no one-to-one. Human cells may be much more resilient to BPA. And obviously you can't inject BPA into humans. So then, people started developing ways to grow human cells, non-cancerous human cells, in petri dishes, so they can basically, think about whether, BPA actually causes cancer. You can't really tell because it's not a real human. It's a human in a petri dish, completely isolated from the rest of the body, rest of the immune system. But the first evidence of BPA actually causing the first set of chain reactions to causing cancer in human cells happened in 2013, long after we knew that BPA was dangerous. And so I think about the methods that we use as a community of researchers as a process of triangulation, right? So what things that can you get from online experiments? They're cheap, right? They're very, very cheap. So you can try out lots and lots of ideas. And so you now have a distribution of ideas where you have a lot more promising ones and less promising ones. You have observational research, which gives you correlations that say this is interesting. And field experiments are expensive. From my own experience, they can be hundreds of thousands of dollars. Like, my last experiment was 250 grand. And it was still a pain in the neck to publish. And compare that to other people who have sample sizes of 17 or 25
that are $1 million experiments, you're going to test the theories that have the highest probability of being true in a field experiment. I think this idea that this research is bad because of this method is a misunderstanding of the scientific enterprise. I think we have to think about this stuff as how do we all contribute to knowledge that in different ways. Is it generalizable? Can we test out a lot of different ideas, say something about mechanisms, and does this work in the real world? So that's what I wanted to add.
I love that. I love that emphasis on useful, contributing, and triangulating.
Next question. Please, yeah.
Just following on that, and I really love the example you gave earlier about how so many of us who work in the same space don't work or know each other, right? I think I'm reflecting on the 17-year gap between when we first struck these experiments and these trials and then implementation of policy practice. I would love to know from you all, what are recommendations or best practices for that active triangulation and that active collaboration with co-op networks, like people on these grants that are doing, maybe some doing field experiments, some doing lab experiments, and just thinking about a hybrid model so that we are not, for example, potentially just sort of working on lab experiments, feeling good about it, and then trying to do fields and taking a lot of time, but just being nimble. With that, I would love to hear from you.
So I too thought that paper was really interesting and honestly kind of relate to it in my own work. I don't know if this is working. And I'm reflecting on my own work as a result of it, and so much of my own work is pure lab experiments. I have a couple things out there that rely on other methods, but not nearly that much. So I honestly, I would just agree that I would be excited. And I mean, I think that's why this opportunity was so cool, and coming here and hearing about different methods, hearing about field experiments, lab experiments, and these other ways of doing it. Thinking about this as a triangulation problem, thinking about building networks. so that more of these kind of collaborations that use multi-methods, because that really is like, I think the true answer is that the best way to go about doing this is to use these multiple methods and rely on the strengths that they have and allow the weaknesses that they have to be addressed by one of the other methods. So the question is how do you do that? And I don't know that I'm the best person to answer that, because so much of my work is lab experiment.
What should we be demanding?
My work doesn't speak to health. So we, in the context of like field experiments and innovation or entrepreneurship, that's my area. We actually started a conference about 4 years ago, actually like 3 weeks before the pandemic started. So it was here at Duke, we held it here at Duke, and it was great. We got about 80 people in the room. We're now at our 4th year. We're holding it at Harvard. If anyone's interested, it's cfxs.org. So we basically get a bunch of people together in a room, people who do observational research, serve as discussants on papers, people do lab experiments, and so we are in the business of trying to create a conversation. I think that's a big idea. And we get policymakers, funders, and I think what I found is there's kind of a lot of collective. I think the publication process is a potential barrier to implementation. I think there's I'll speak to management research and a little bit to sociology. I don't know much about the public health context, but I think there's an overemphasis on theory, and I don't think people know what theory means. Often in that review process, it's kind of like, has anyone seen The Princess Bride? Inconceivable. I don't think that word means what you think it means. It's kind of like that with theory as well, and I think that can often get in the way because people have these words that they say that mean different things in different fields, and so part of it is just getting us on the same page in terms of language, and I think that's kind of what we're trying to do is, and then you can start getting breakthroughs because the policymakers speak a different language, the lab experiment people speak a different language, we speak a different language, and so getting kind of a shared language may be one way to break through that impasse.
So stepping out of my role as moderator, I have two substantive questions that I'd love to hear your reactions to, and other panelists as well. The first one is just really practical. Like, what do you do with your IRBs? What are the road signs that all of us that might want to jump into some of this kind of work? I mean, you and Chris make it look easy. It's like just fire a mechanical turban, off you go, or something. But I suspect that it's never that easy. And I'm just curious, if that, if you have any advice there for us as a group. And the second one is, I think there's this whole field that you alluded to, which is replication. And part of that comes from this idea that I think, at least the impression from the outside, is a lot of the procedures that go on in experimental work are very particular. And so you control everything, but there might be a lot of things that you control that are implicit to the understanding, knowledge, the practice of the community that does it. And someone new comes in, they don't know that, and they end up not being able to replicate it. And I don't know if that's actually a problem with them, just novices getting the field, don't know what they're doing or what. So I'm curious, my guess is that these two problems are linked because they're all about procedures, but I'm just curious if you could just help us understand those ideas a little bit.
So speaking of things we should be demanding, the IRB. The IRB, in my experience, it's painfully slow. It's so painfully slow. And it wasn't always like that at every previous institution. And I know that they're making some changes to improving it here, but filling out like a Word document and the wait is long. Is painful. I don't even know how it goes with field. I don't even know how it goes with field experiments. That I feel like that would be much even more slow and more painful. For me, it's probably nowhere near as slow as it is for you. I typically, one issue that comes up in lab experiments is the deception issue. Do or don't, do you need it, do you not? I certainly have done studies in the past that rely on deception. That requires a much more extensive IRB review. You're not like exempt if you're using deception process. I've stopped I don't use deception as much as I used to, partly because I tackle questions that don't really rely on deception, or I've figured out other ways to kind of get around the deception issue. Also because some feel like econ, if you want economists to like you, maybe you don't care. I don't care. Then you don't want to use deception because they're very against deception, not because of the potential harm to participants, but because it contaminates the pool of participants. They won't trust us as experimenters anymore. If you use deception. So I don't rely on deception, which shortens the IRB process quite a bit for me. And yes, it is a little bit more like, all right, I have this idea, I fire it up, I get it ready to go. It takes some time, but then I can fire it up. Field experiment, I don't know, do you want to talk about IRB stuff?
So I'm on the IRB, and I'll say the slow part is just because I think people are overwhelmed. There's not enough people to do the reviews.
They're very understaffed.
Yeah, they're extremely understaffed. So hopefully the technology problem will get solved soon. They're rolling out a new system. But I'll say in the how to write an IRB that will get through easily. Be clear. I think there's a problem sometimes that researchers write these like crazy omnibus IRBs where they like include literally every variable under the sun, and then it's like, whose interests are you serving? Are you serving the interests of the subject, and these are human beings and you're not paying them really much, and so you have to really think about. I think having been on the other side and now on this side, I definitely think a lot more from the perspective of the subject now than I did ever before. Where now I'm much more, even in my own work, like what are the 5 things that are most important to me as a researcher, and how do I balance that off with the interests of the subject? If I'm basically taking more than I'm giving, I think I rethink it. So sometimes when you see IRB applications where a researcher is asking 875 questions, like that's going to get rejected. Or it's not going to get rejected, it's going to be pushed back and it's going to take time. So be much more precise in what you want out of the study. Be clear about the intervention, what you're doing. Clarity is, I would say, clarity and simplicity are the ways to get things through. I think it makes it easier for the reviewer, and it also makes it clear that, you know, what is the IRB for? The only real reason is you're not harming human beings. And so I would say that that's probably it for field experiments. I think my experience as a researcher was the pushback, and I'm much more appreciative of it now, is it too much of a burden for the, so simplicity, I would say simplicity is a key thing. Just be simple and have a, and I think the other thing that helps nowadays is pre-registration. In my opinion, I think everyone should do pre-registration. I think it just makes it so much easier. Most of the stuff is never going to end up holding, but I think it just gets your ideas on paper, and that can be a great template for the IRB review process.
What is pre-registration?
What is pre-registration? Oh, geez. Okay. How many people know what pre-registration is? Okay. So, great. So about half the room, and so pre-registration is something that lots of different fields are beginning to demand with experiments now, which means that you have to pre-register essentially the whole protocol down to the data analysis and what you expect your effect sizes are going to be and why, so that when you actually analyze the data that comes out of the experiment, you are not violating, you know, a given p-value is a reflection of this one test being done in a statistical term. And so if you test like a million different, you know, things in your regression, those p-values make no sense whatsoever. And so pre-registration basically binds you to testing a specific set of predetermined hypotheses. Yes, things you may have discovered after you do the experiment are true or through exploratory data analysis, but it separates out things that you believed as a researcher to hold in the data before you did the study, and things that you found after the study was done, and it kind of creates this clean separation, so you're not making up random stories based on some random correlations you found afterwards. So that's the goal of pre-registration, is to kind of bind your you know, hands so that you don't make up stuff.
And there are now
Aspredicted.org is a user-friendly one.
Yeah, that's what we
is what I use. Yeah.
I talked over you.
I was just going to plug As Predicted. That's the site I use for pre-registration, and super easy and user-friendly. I also just want to touch on the thing you said about how you maybe see researchers shoving like 800 items in their experiments, quite possibly just to see, you know, what happens. I've worked with a couple like undergrad RAs on their honors thesis and things, and they are tempted to do stuff like that. Where, like, and then I'll throw in this like personality survey and like this like measure of their state anxiety and this, that, and the other, and items about their income. It's like, well, they're undergrads, and like you don't necessarily need these. You're doing a lab experiment, so why do we need these? We take them out. We don't need them, because I am on the side of like very simple, short and sweet, as we talked about. Like, you'll lose the online participants if you ask them 100 bubble items. So I'm very much on the side that you are with regards to that, because I mean, that again, like, we can rely on the power of the experiment. We don't need the control for all of these things. That's the whole point. We've used random assignment. We don't actually, you know, really care what their personality items are. We put them in their conditions.
I guess my one question or like kind of caveat to that is like, wouldn't you want to have more proximal outcomes or mechanisms that you're measuring that you might not capture the primary outcome of interest, but you may capture that first mechanism, because pre and post, you know, you weren't able to see the full effect of your intervention because you haven't been able to longitudinally follow them enough, but you can see that there may be changes in mechanisms that could in the future lead them to those outcomes.
Yeah, absolutely. I definitely think that, I think the point is more to think carefully about whether you need 800, 5 scales of this, that, and the other thing that you just want to put in your IRB just because, you think you might want them. But certainly, if you're thinking carefully and you think, in my talk, I alluded to the baseline proclivities to prosocial behavior. I often take a measure of that at the beginning of it should be there. But, you know, when we're thinking about, like, do we need their, you know, astrology sign and their, you know, all this stuff, it's like, we definitely don't need that, but we don't need everything under the sun. There is a temptation, I think, to capture as much as you can because you're paying these people, you know, $10, but there are downsides to that. And so, yeah, I would agree. I absolutely agree with that. The other issue was the replication. So we stuck on the first question.
Right, which is fair, but as I said, how much of the replication bit do you think is essentially, I mean, there's the pre-registration side and there's the p-hacking side and all this, but there's also, I think, unique to experiments that you are engaging in an actual procedural process. And some of those processes, you know, maybe you sort people to the left side of the lab or the right side of the lab, or like, and I don't know, like, which ones matter, which ones don't, and how do you know?
Yeah, so I mean, yeah, so there's kind of two reasons that you could have like a replication problem with a study. One is that the original study engaged in these questionable research practices that we use pre-registration now to try to avoid. So they just continue to collect data from subjects. That's why you pre-register your sample size. They continue to collect data from their subjects until the poor RA who was supposed to run the t-test or whatever, oh, it's P is 0.04 or whatever it is, and then you stop. Like, that is what pre-registration is intended, and that's a questionable research practice. That's one reason that replications have failed, is because people were doing these sample sizes of like 12 participants per cell, and they just kind of stopped when they saw some cool result that they could publish. But then, yeah, the other one is oftentimes if someone tries to replicate your study and it doesn't replicate, you can argue that it was a conceptual replication, but it wasn't a procedural replication. Where did you do it in the lab? Did you use my exact same questionnaire? Did you have like the exact same gender makeup or this, that, and the other of participant? It gets back to the same kind of game that we play with. What about this control variable? What about that control variable? I mean, I think there are probably, and I might argue that if one of my studies failed to replicate, but at the same time, I mean, that's valuable to know. That kind of replication helps us address one of those issues that critics have with experiments, which is that, well, what does this really tell us about the real world if it doesn't replicate unless you're doing it in the lab chairs on the left or this, that, and the other? So if it doesn't replicate, that's important. It suggests that we at least should do more research, because even though our experiments do rely on all this procedural control, it's not a good sign for our theories, even if it comes down to something so simple as like, where you're sitting in the lab or whether it's hot that day or something like that.
Yeah, so maybe I have like a couple of thoughts on replication. So let me start with like the simplest one. I think part of it is, what do you attribute to the lack of replicability? And it's not just a psychology problem, it's not a sociology, it's not economics, it's everywhere. You see this in medical studies, you see this in so many different studies. And so, I try to go with the simplest explanation for this, and I think I've come down to two for why we have a replication quote-unquote crisis. One is, I think people are just not well trained in statistics. And I think, most people get very, very extremely applied training, and they don't know how to think statistically. And so I think that's like one thing. So I bet if you were able to include a control variable in what studies get replicated or not, about how good this person's education was in statistics, I would imagine this would explain a ton of variation in what stuff replicates or not. That's my simple explanation. Number two is incentives. And I think the desire for novelty and volume creates a incentive problem for researchers and if you think about Mechanical Turk as a great example, what is Mechanical Turk doing? It is dramatically lowering the cost of running an experiment. And what happens if you put on your Econ 101 hat, when you lower the cost of something, more people do it. And so the next Mechanical Turk experiment is going to be lower quality, because the people who are going to do an experiment when it's hard are people who have higher ability. And so as soon as you lower the cost of something, the marginal experiment is going to be less good. Is kind of my thought. So I think the incentive issues and the training issues are, I would say, primary. And then I think at a more philosophical level, do I want less diversity in research where we're so strict about, I think the way that these replication police have taken, I think it's actually disruptive to research, in my opinion, mainly is because I think we should never take one study ever as truth. The truth comes from lots and lots of studies. That's great. I think that part of it I agree with, but then destroying people's careers because one of their studies didn't replicate, I just think that's foolish and kind of bad for the research enterprise. What you want is actually more diversity, people trying different things, and assume that some of this stuff's not going to work. That's how we get, we want more diversity, not less diversity. That's my philosophical take on it, yeah.
I mean, I just to follow, I agree completely. One of the things that we've argued in some of our work on the observational replication is that one of the disadvantages of the replication police model is all of your reputation on the line, right? But what you want is the incentives to be flipped. You want people to, get rewarded for finding mistakes in their work and for putting out a retraction if they need to or whatever. Yeah. So if
produce today.
Right.
So, right, we want diversity.
There's several RCTs that are being done, and it's a way in which some of these interventions that are being done in the field are tested, and there's a growing critique of RCT studies in autism, and one of the big critiques that people make is that if you invent an intervention, and then you run the RCT on your intervention, that it's not a good idea. Like, it reduces the quality of it, and they're even now seeing that when, a lot of times in autism you have to do a multi-site design because getting your sample is really, really hard. So they're seeing that the effect size is higher for the site where the PI developed the intervention and they're doing it, and so isn't that like evidence that it's because it's their intervention, like that's what's causing it, or is it the fidelity is just higher because they know how to do the intervention, or but I'm just wondering what your thoughts are.
So that's a great question. So there's a lot of stuff that's kind of inbuilt into that question. So let's start maybe indirectly answering it if it's okay. Hunt Alcott has a great paper looking at treatment effects in the field experiment on energy saving. And basically he finds that sites that select into participating in the experiment actually have a larger treatment effect than they would if they hadn't selected. So there's something about selecting into a willingness to actually do an experiment in this energy context. Actually, that information increases, there's like an invisible interaction effect, where the people who said yes to doing the study are actually the ones that are likely to get a higher treatment effect. So what you have in your context in autism is basically this invisible treatment, heterogeneous treatment effect, which is are people who are willing to participate in the study or have designed the study, do they have a larger treatment effect than would be in the general population of possible places where you could do this autism study? Am I framing that correctly? And so the reasons could be they follow the procedure better, or they have a lot of tacit knowledge about how to implement this that may not be reflected in the procedures. I think we don't know anything about that. That's the huge new frontier of the extent to which treatment effects actually vary based on site. So, and why? And lots of reasons exist. Tacit knowledge, following procedures, more interest with it, and to be honest, I think the research on this about why that's the case is super minimal. And it's interesting this is happening in autism research as well. So Hunt Alcott is the person you should check out the paper from that speaks to this issue of why are treatment effects larger in some places versus others.
I just wanted to reflect, I think implementation science is really focusing on that, right? And that's really that transition from research to practice and figuring out why we don't replicate when we're translating this into practice. So it's thoughtful of maybe practice informing research. Is there all of these frameworks, right, in terms of implementation drivers like knowledge, as well as contextual theoretical drivers that have nothing to do with the delivery and all of that. So it's exciting to see kind of multiple parallel trains of thought.
Yeah, I hadn't made that connection to the implementation science, but it's exactly right. Yeah.
All right, folks, I really appreciate our speakers. Thank you so much. A little bit early from the schedule for lunch, but the cash is good. We'll get a chance to lunch. Athletic side, he's studying peer influence, and so he's going to let us know a little more about that. So take it away, Craig.
Well, day 2 is much more the methodsy day, right? So yesterday I talked a little bit about linking up your theory with data, and today I want to talk about strategies for analyzing peer effects. And sorry I couldn't make it earlier today, so maybe you've gotten a little bit of snippets here. I'm sort of relying on the unity of knowledge itself, that we're going to start to fill in parts and you're going to see things that you've kind of seen again, and I'll try to touch on some things that I suspect that you've already heard a little bit from Tom and Sharik today. So first of all, what is peer influence? Certainly a lot of network research is concerned with the effect that relations have on attitudes and behaviors. That's clearly in the health world, one of the big issues here. So the idea is from everything from opinions to ideas to beliefs to tastes, that these things spread through interactions, and people negotiate and adjust to those people who are part of their peer networks. This can result in people coming together and forming greater agreements and more consensus, but it might not. It can also result in different kinds of clusters of behaviors and attitudes, opinions, beliefs, or even, as I talked about a little bit yesterday, balance theory would predict that it might just always devolve into 2 oppositional groups with very different beliefs and, in fact, opposite beliefs and opposite behaviors. So the divide here between sort of diffusion research is blurry. So diffusion tends to have much larger data sets, and the thing that is sort of spreading through the network tends to be more of a little bit of something, maybe a virus, or maybe just a meme or something like this, right? So peer influence tends to scale this down a little bit, and in doing so, it affords the ability to add a little bit more detail into the nodes, and maybe even the thing that is spreading, and maybe even the way that people change the thing as they spread it, or how they reject it and other things. So there's a little bit more. The trade-off here is we kind of scale down the generalizability oftentimes, and we get a little bit more validity and a little bit more detail. But again, the line is blurry. So the basic model then is that attitudes and behaviors are a function of 2 main sources. One is your just basic intro sociology or social science, which is individual characteristics, gender, race, ethnicity, age, education, that these are the workhorse of social science. And the idea is that these things get ingrained in people, maybe through socialization, maybe early in life, maybe become a kind of personality or disposition to the world, and that is indeed something that maybe impacts what people believe and how they behave throughout their life. But the second part is the interpersonal dynamics that can happen. That is that actors consciously or unconsciously may start to adopt the attitudes and behaviors of their peers, and they may end up, infecting their peers with their attitudes and behaviors. And so this tends to be among people who are, when we say peers, we mean people who are generally at the same level, colleagues, friends tend to be what we're talking about here. So taking just one big step back again, social network analysis really has 2 key research goals. One is very descriptive, to just get it right, to get the networks right, to see them and describe them accurately, and to represent those social structures as accurately as possible. The second is to really explain the causes and the consequences of those structures. So, once again, this remarkable hooking up network, romantic relations, if you want to call it, in a high school, and from the ad health data. If we were to just look at these sort of more local vision of students in the school who had each had 2 sexual partners in the last year, we would have a vision like this. And We could model that as, with individual level characteristics. We could say, are these all people who are of a similar background, things like that. But when we add the structure to it, we see a very different picture, the interconnections among them. Last time, I already described a little bit about one of the endogenous causes of this network structure, this chain, these long chains of affection, as the paper is called, seems to have this underlying logic of the avoidance of 4 cycles of this nature. That's one cause. But what are the consequences? Obviously, as health scholars, you're probably thinking, if not all of these people are the same. Having 2 sexual partners here may be very different than here. And you'd be right. This person is part of the main component of the network. And so the consequences for network flows, in this case of STIs, is very different, even though the same number of partners are there. So what's spreading through the network could be something as a kind of binary, you caught a disease or you did not, or quite often it could be kind of more shaded in terms of your shifting attitudes or shifting behavior. Maybe you're drinking a little bit more, maybe you're drinking a little less, maybe you're smoking a little more, you're smoking a little less. So the basic theme of peer influence is you are the company that you keep, and that a network like this of ties, just for illustration, at time 1, where there is a certain differentiation, let's say in a certain attitude or behavior, over time starts to spill out through those ties, and so you see the shading becomes more, instead of red and yellow, it just becomes more orange. Those of you who are colorblind, my apologies. So this is more of a spread and spilling over into things. So really, we need to move more from describing to prediction in this way. When we describe a network, a lot of the reason we're describing it is because there are important implications of those descriptive indicators for these kinds of flow processes. A very dense network has a lot more flow potential than a network that's divided into many components. The connectivity and the cohesion, this amount of centralization, all of those things have implications for flows of things. That's why we study them quite often. But measuring the actual flow, right, is something that in the history of networks, it came later because it's very difficult to do. It's hard enough to get network data and to visualize it and then to come up with these measures to describe it, but then to actually predict people's changes in attitudes and behaviors over time, and to be able to attribute that to a relational process, it blows my mind. It literally it's remarkable that we can even do anything like this. So you need to be able to, first of all, parse out a lot of the kinds of endogenous and exogenous alternative explanations that might be going on. Homophily, is it that people really are influencing each other, or people who just smoke a lot tend to hang out together, right? Is it really a peer influence process, or just things being exchanged and traded, right? And that you're not seeing the whole process. Triadic closure, preferential attachment, are people who are just more popular, are they the people who elicit a behavior more, right? It's not that it's spreading necessarily. So there are lots of alternate explanations that are also network explanations that aren't peer influence. So you can have all kinds of things that make it look like things are spreading, broadcast effects, right? That if all of the students in the classroom are watching the same shows that are outside, and then maybe they're picking up on a certain behavior, it may not be spreading because of them, it's spreading because they are all mutually oriented towards something outside of the network, and they're picking up on it, and it looks like it's spreading. That's messed up. You can even think about ways that exogenous things can really, really mess with your mind. John Levy Martin, the University of Chicago, used this example with me. I don't know if he wrote about it or not, but he said, look, he lived in Wisconsin for a while. He's in Chicago now, but he was saying, look, you could think about the diffusion of a new innovation in snowblowers as being something that is a peer influence process, right? If you really tracked out the network flows of things, you would see that the greatest new inventions in snowblowers clearly looks like it's spreading through peer influence. But actually, if you think about it, the people who are in the worst of the snow tend to be a little further north, right? We're gonna go like Duluth, right? And then those people actually are tied to people who are a little bit further south and a little bit further south and a little bit further south. So the innovation of the snowblower might be spreading geographically from the most snowy climates to the less snowy climates. And it looks, because that's correlated with who knows whom in that structure, it looks like it's a peer influence process. But it's actually just the weather. So, I suppose that Sharik Hassan talked a little bit about things like experiments today and how interventions, how you can go into the world, and if you can put in some sort of process, if you could look at this in certain kinds of ways where you could do field experiments, you may be able to parse out some of that through an experimental kind of condition. Difficult, but possible. There are sometimes natural experiments, things that occur in the world that make it so that it kind of mimics an experiment. You can sometimes see that. Today, what I want to focus on is other possible strategies that are there when those other kinds of experiments are not easy to do, right? When they're not even ethical to do. Like, I have an idea. We'll make this child who's very popular start smoking, right? So, how about that? There are ethical ways to do this. So people like Hannah Shepard and Elizabeth Bullock have done interventions with anti-bullying campaigns. So when it's the other way around, then you can get through the IRB. It's like, we'll make the popular kids be not against bullying, right? And see whether or not that actually changes the culture of the school, and it seems like it actually might. So the three I want to focus on today are dyadic models, right? Maybe you don't need an experiment, maybe you don't need something super fancy, but you can, especially in certain kinds of, knowing something about what you're studying is important here, but you always want to do robustness checks in that case. You always want to see whether or not what you're saying may not be right. The second is stochastic act-oriented models, also the Siena model. David Schaefer will be talking about these things a bit in the morning, tomorrow morning. Yes, David? Oh, afternoon. Okay, tomorrow afternoon. Tom, did you talk about Siena at all, or no? Okay, I'll touch upon it in a high-level way, right? So the purpose of this talk is more like strategizing around which of these alternatives might be good for you and your data. And I will linger a little bit more on this last one, which is social influence network theory, which was really developed by Noah Friedkin, who was one of my dissertation advisors. And I've used this model, and I think it has a lot of potential. Feel free to raise your hand, interrupt any time. I'll move fast, break things. Okay, so if the process is entirely dyadic, then you probably don't, you could do something simple, right? I've studied speed dating, and where basically you're just trying to see whether or not people click in a speed date, you have 4 minutes, and so there's nobody else there really in the date, so you can really use a kind of dyadic model there, in which case we're really trying to predict kind of tie formation, like when do people feel a sense of connection with the other person. You could do other things where if you're looking at the dyad level of it could be as simple as a dyadic regression. Mostly, network scholars want to build in a lot of structure around that dyad. Now these triads, I'm a big fan of the triad, right? Multiple triadic relations that could happen. Larger structural formations might be possible. Oftentimes, you know, you can estimate things as a dyad model, and then you can use your understanding, substantive understanding of the process to try to disprove yourself. Or you could estimate it in a bunch of different ways. So let's take the example of the Framingham Heart Study, which was then, you know, studied by Christakis and Fowler in terms of the spread of obesity through peer influence. And they had 30 years of data in this one town in Massachusetts, I believe, and looking at how over this period of time, looking at how some people's health, and in this case their weight, how much did it sort of have an autocorrelation with the weights of their peers and their spouses and others, which I'll go into. A kind of cute little movie that was made about it. I'll show you like a dynamic model of this. Where will I? Okay. Oh.
The lady is
Sorry. What's going on? It's not moving.
It will.
It will?
Yeah.
Oh, is this happening already today?
No, I know this video, it'll start.
Oh, you know this video.
I do, it takes a while.
Okay.
Yeah.
Strange. It's never done that before with me, but okay. Oh, there it goes. Very slow. The volume is down over here.
One another and forming ties in complex ways. The network gets more compact and dense as more ties appear. And the entire network gets heavier over time. Quantitative analyses demonstrate a tendency for obese people and non-obese people to form clusters within the network, so that by the end of the study, this clustering can be discerned as in the densely interconnected clusters of obese persons here and here, and the non-obese persons here. The prevalence of obesity appears lower at the periphery of the network as compared with the center.
I haven't watched that in a while. That's actually really interesting. I forgot the part about this, the real code, the sort of embeddedness in the network structure itself. I'm actually doing a very different study about people's changing beliefs around sexuality in the Bible that is actually remarkably similar, how much it depends on one's centrality in the network. So, as Jim mentioned in the very first introduction to the workshop, this study had a huge impact, and one of the impacts it had was to really piss off economists and to make people think they can't do that, they can't get away with that. And basically an entire cottage industry arose around trying to knock this study down, right? And I remember it well because I was like, I really love this study. I was a postdoc. I was like, I'm going to do that, but I'm going to do it, and I'll show you in a minute, with collaboration networks and people's ideas around and sort of thinking about the sociology of science. And I got taken down in the whole fray of this by many a reviewer. Well, that's not all that Christakis and Fowler did. They used their heads and they said, well, let's try to disprove ourselves, right? We're not just going to say this, but like if it is really about peer influence networks, then what about people who live next door to each other, right? If it's a broadcast effect, if it's the fact that they opened up like an In-N-Out burger, or they wouldn't have that in Framingham, but they opened up like a cookout, like we have here, next door, then you would expect that there would be these kind of like spillover effects into the whole community. So we'll just look at neighbors. Or if it's really not about peer influence, but it's about just like everybody's just, getting bigger portions at the grocery store, then you would think spouses would have the same effect, right? Use your head. This is what we do as social scientists. It's like, you know, nothing is going to be like, I just dropped the mic, that's it. I just proved it 100%. We deal with the reasonable alternate explanations, and then we try to knock them down. And if we can't, then we say that we might be wrong. That's called science. So I think that they did a very good job of thinking about social distance and geographic distance and showing that it is much more the case that the social distance matters a lot more than the geographic distance. And in fact, it found that basically people who had been friends but then moved to different states, right? That the effect was stronger among those than it was among neighbors. Well, what else is going on there if it's not something about peer influence? Well, we could think about lots of different things. So you could look at the different types of ties. You can see mutual friend is the strongest effect here. You can see that you know, something like opposite sex friend is not, right? So that this seems to be really operating through a kind of social comparison process. So what are some other possibilities here? Well, like I said, I tried to pick up on this with work I was doing as a postdoc at Stanford, and we were looking at networks, collaboration networks among Stanford faculty. And at that time, Stanford had invested about $1 billion in multidisciplinary research initiatives, building these huge buildings for genetics and environmental science. And we were looking at the networks of collaboration, right? And various ties of collaboration, and trying to see whether or not people were learning from each other. They were becoming, let's say, were influencing each other's ideas or influencing their behaviors. Like if I write a grant with Jim, who is an excellent grant writer, you know, and a very prolific one, right? Will that spill over to me and make me a little bit better grant writer, or will it just make me write more grants? Things like that. Right? Is there actually an effect of this? Or is it all selection? Or is it the fact that we're connected to the same kinds of external resources, and that the external resource, the trough is just getting bigger and we're just feeding from it together? There are all kinds of alternative possibilities. So one way to try to separate this out is if you have some reasonable way of looking at the behavior that happens with certain individuals over time, you might be able to parse out what we call the synergistic effect from the spillover effect. So in the sort of Framingham study, you might think of it as like, well, how much of it is that two people just start to eat together more, right? That would be a kind of synergy. Like, we're friends, we like to eat, the barbecue's amazing, we're into barbecue, let's just keep going and going and going. That would be a kind of synergy, right? That's still a kind of influence. Sounds good, right? It was amazing, wasn't it? So that would be a kind of influence, but it's a kind of influence that's really within the dyad, within the relationship of a synergy. But then imagine then that there's a kind of spillover where you take that behavior outside of the relationship to either other relationships or to just your individual behavior. Say that we were able to measure that. I imagine, as a health scholar, this is something that maybe data actually exists on, and or there are ways to collect it, to see like food diaries and things like that, see where people are eating, who they're eating with. I'm not a health scholar, but so you may be just saying like, yeah, well, it's been done, Rawlings. Okay, well, great. I think that's the point, is you might be able to map out these processes. So we try to do this with collaborations. In this case, 4 people collaborate on a research article together, so they all have a tie of that product. We published together, we wrote a grant together, and then over time, you could try to parse out like the synergy of us just coming together again in the future and doing it again, versus us, pairing off, versus us just doing things by ourselves, right? Seeing if if I wrote a grant by myself, am I better at that than I was before? And so we tried to parse this out, imperfectly, of course, but what we basically found was that certain types of ties seem to be better at generating that kind of spillover effect, right? So that there was a kind of elective affinity of the tie to the thing that's being transferred. In other words, if I'm on a dissertation committee with Jim, it's not going to make me a better grant writer. Not really. But if we write a grant together, then there's a possibility for that. So that's another strategy. Consider that you might not be able to have an experiment or a field experiment or something, but if you could actually parse the thing that you think is the influence and you have different kinds of relationships, then you can build into your model an awful lot of robustness checks to the dyadic model that you've put forward. So another possibility is the Siena model. Snyder's and others have developed, and this is really most appropriate when you're looking at when you have a certain kind of data set. Let's face it, right? A lot of these things are they're best for certain kinds of data. In this case, you need to have both networks and behaviors over time. And I think, David, correct me if I'm wrong, at least 3 period? 3? You need 2. You gotta have 2. You have to have networks and you have to have behaviors at least 2 time periods. Probably be more convincing to my colleague Steve Vasey and others if you had a 3rd, so you can see that and not so random. But it stays, a certain behavior stays, it doesn't just go back down or something like that. It also, the number of nodes that you have cannot be too huge. This is probably improved over time, but when I was trying to do these things, if you had 300-400 and 4 or 5 time periods, it started to slow down to a crawl, and then once you got to hundreds, you were done. It was just, and I don't know if it's much different there. Yeah.
Going back to the dyadic data
Yeah.
analysis, do you have any opinions about the active partner and True model to actually get a favorite dependencies between the dyad and the
I love that model.
It looks complicated, right?
No, it does, but it's not really. So actually, I was very tempted to put the speed dating study in here because we used that model, but the reason I didn't is because we were predicting a tie. And the peer influence is more about predicting behaviors and attitudes and changes and not ties. So tie prediction is more about ergoms and other things like that. But the actor-partner interaction stuff is so interesting, and we used it in the speed dating study because we were able to see that there are some things in a speed date that a man does that makes him think that the woman likes him. And it's not true. Right? There are some things that the woman does in a speed date that she thinks makes the man like her, and I believe she's more accurate, right? Partly because it's complicated because the men were kind of open to anybody in a lot of ways, but they were engineering graduate students at Stanford. It's like, okay, so the point is that's a great, I highly recommend the Kenny Cashian cookbook on dyadic models and estimating those as well. You can see that the cool thing about that model is you can do these cross interactions on things where you're basically saying, in this case, there are things that I do that maybe make you like me, but I don't think that they make you like me. Wow, that's really interesting, right? So it's a good one. Yeah.
Can I ask a follow-up question about the APIM?
Yes.
So if you were to ask someone to name 3 of their partners and then about sexual partners, and then you recruited those 3 partners into the study, would you still use an APIM for that, even though you have multiple individuals showing up with different dyads?
Yeah. Yeah. Oh yeah, sorry. So the question was, if in the speed date study, right? We had individual I and J, right? But we also had, it's a speed date, so actually, in this case, Jay was the man and was moving around and went on many, they all went on many speed dates, but there was multiple I's in different speed dates and multiple J's in speed dates, right? So I think that's your question is, what if you have a data structure where you have multiple dyads and some of them appear with others like multiple times, like I have 5 friends and you have 3 friends, right?
Like refer your friends into this study and things. So it's like there's like some nesting too.
Nesting, yes. It does account for nesting. I mean, and I'll talk. I thought I had it in one of my slides here, but it's yes. So the basic model of doing dyadic models can control for that kind of nesting in a number of different ways, with either fixed effects or random effects or some combination thereof, right? So that you're basically doing something like a hierarchical linear model, or they'll talk about it as multi-way clustering now, where the economists finally got on board with this actually, when Cameron, Gilbach, and Miller created a kind of way of doing these sort of like multi-level nestings of things, so that you can kind of parse out the errors and get a fairly clean estimate. Yeah, it's not a problem to have that. Yeah. Again, I'm happy to answer things on email or later if you want details on all of this. I'm hoping that it's like, my hope for this talk is to give you a kind of roadmap and a sense of confidence that just because you can't do an experiment, or just because there isn't a natural experiment, you don't have to quit, or you don't have to write a bigger grant, or there are these other strategies to get at peer influence, and no model is perfect. So the stochastic actor-oriented model, Siena, is great if you have data of a certain nature, which is in many ways really been designed, I would say, for the kind of research that a lot of you do. Like Josh, we were talking about his interest in seeing how health behaviors like vaping and drinking spread, especially through these kind of social gatherings, right? So if you could think about if you had the capacity to follow people and their friends over time, maybe even better as they enter into a new place and form ties for the first time, right? And you could ask in the beginning some of their health behaviors at time 1 before they form a friendship network. So one of the great things about being in a university, we have these constant flows of people coming in, and if you could do this in a high school too, right? Looking at how their networks form and then how their behaviors change as their networks change. So if you have changing networks and you have changing behaviors, at least 2 time periods, maybe preferably 3 or more, you don't have thousands of nodes, this might be your jam. So basically the way it works is it's able to simultaneously model the tie formation process that's going on and the behavioral process that's going on. It's really kind of 2 models for the price of 1, right? And it's kind of got an ergum built into it in the sense of like it's predicting the tie formation, but then it also has a capacity to see how much people will select based upon attitudes and behaviors, their friends. So are people forming friendships with people who are just more popular in the network, or people who drink more, or some combination thereof? Popular people who drink more. And then does that becoming friends with them then in turn translate into them drinking more? Or does it make the person who was drinking more drink less? I don't know. That doesn't seem to go that way. So this has been done in a number of contexts. I'll just give you like ones, since I study culture, I'll give you stuff about culture. One was by Kevin Lewis and others on cultural tastes and early Facebook data. When friends on Facebook were really more like friends, not just like random people. And also, this was really constrained to being just people at Harvard. Kevin was at Harvard as a graduate student during that period of the early Facebook days. So this is like Facebook days among of Harvard students as they form friendships on Facebook, but also then as they would post their preferences for books and movies and television shows and things like that, and then seeing how people would change, how the network changed and how their tastes changed over the same period of time. Back also when, if you like put on your Facebook page that you loved like Beyonce, it meant something and people would notice it. It was like really upfront more in terms of your profile back then. And so one of the things about the Siena model is it's kind of more like, and maybe this has also changed a bit, but it's generally one where it's like the behavior is more of a quantity of something. It's like the number of cigarettes you smoke, or the number of times you binge drink in a week. So it's a kind of not generally an ordinal level variable, and sometimes a higher level variable. I'm sure it's now extended to continuous variables as well, but at the time of this, it was really limited to being much more of a count. So how many of these kinds of taste clusters did each of the students invest in? So how many artists who were in the pop cluster did I like on my Facebook page? How many of the hip hop R&B artists did I like on my Facebook page? And then looking at how the network it might be the case that people who like the same kinds of music and shows and books and things are more likely to form friendships together. And then it may be that tastes might spread through those over time. So that's how they use this model, and they basically are able to pull apart this selection and from the influence component. So the selection component, and also they could control for the endogenous tie formation processes, the triad closure, homophily, racial homophily. So all of those stalwart kinds of sociological variables about race and gender, shared residence, right? Whether they lived in the same residence hall and were from the same region. And so that's part of the tie selection, right? And then in the influence part, you could see if over time people were becoming more invested in certain kinds of clusters of tastes. And interestingly, they did not find much influence at all, actually, in this case. And they did find it with classical music and jazz, but the others not so much. Interesting. At least they were intellectually honest about it. In my own work with McFarland as a postdoc, we also tried to do something like this, where we looked at new faculty as they came in. They were hired after 1993. So we were looking at the networks that formed among new faculty, just like entering class. We looked at their keywords in the articles that they published before and after they collaborated with one another. Before and after they wrote a grant, or they co-authored an article, or sat on the same dissertation committee, and we did the same kind of thing. So it's a kind of like an earlier version of me, less bearded, more haired, collaborating with Dan, a much younger version of Dan, over time, looking at the keywords in certain kinds of areas that we shared in common before and after, and then comparing that to kind of a counterfactual, which is someone who came in at the same time, but who I didn't collaborate with, to try to get at a little bit of that purchase of like, well, maybe these are just broadcast effects. Maybe these keywords are just, like Jim showed on the first day, like networks just started to boom at this time. And so if people are starting to put networks in their keywords in their publications, this doesn't necessarily mean at all that they've influenced each other, right? So if you can start to try to have some sort of counterfactual, and I suppose if you had thousands and thousands of people, you could do some kind of matching or something fancy like that beyond my knowledge at this point. But basically, we looked at selection effects, again, kind of in the same mode. We looked at ways that people would form ties with people who were intellectually similar to them, who and were productive in the same kinds of ways that they were. And then we looked at influence in terms of changes in the keyword domains that people in their publications before and after collaborating. So, and we found some very interesting effects of, again, we tried to net out the things that were driving the tie formation from the influence process, and we looked at the influence itself and found some interesting things. Only in medicine did we find that that there was, among people who had no collaboration, did we see evidence of a kind of influence process that was going on. In terms of co-authorship ties, we found very strong differences, and we found that the social sciences were the place where the most influence seemed to happen, and seemed to happen most strongly through co-authorship ties rather than other kinds of things. So again, it's kind of that Christakis and Fowler idea. It's like, well, if it's just a broadcast effect, then you would see this in dissertation ties, you'd see it in others. So again, it's critical thinking at the heart of a lot of this, right? So I think that I sort of rail against the idea that we can rest on a model or some kind of estimation or identification strategy, and that's going to do the work for us. The work is always analytical. And so that brings me to, I think, one of the great sort of resources, which is social influence network theory. And this tends to work really well when you have small groups that are relatively bounded, and that where you can make the argument based on a substantive understanding of the domain, that within that group, influence is likely to pool. And now, the way that this has been done traditionally is in a kind of laboratory setting. You would bring in groups of people, and they'd be like a mock jury. You would give them a case, they would have to deliberate about the case, and then you would see over time how they change, whether or not they come to a consensus on whether the person is guilty, what kinds of damages might be awarded to that person. Obviously, they're the 12 angry men, or whatever, from the movie, right? They're locked in the room together. So clearly, the influence process in these controlled environments is there. The general model, I won't belabor the math too much, but the general model is one in which I love it when a model models help us think critically. This model reflects exactly what I said from the beginning. There is the standard sociological explanation, which is equation 1. That is, some belief or behavior is a combination of certain kinds of, most likely, socio-demographic kinds of inputs, right? So that the X matrix here is a kind of set of characteristics of an individual, and that determines whether or not they smoke, whether or not they drink, whether or not they believe something, whether they like music. But then the equation 2 is really where we start to see the social influence process happening. And it says, look, people are not entirely dispositional. We're not robots. We're not just islands where we just think a certain way. I was socialized to believe this, and that's the way I am in the world for all time, right? And we're not entirely susceptible to influence necessarily, right? And we vary on that, on issues, and we vary on that as individuals. And so the model basically captures the influence process as a convex combination of all of the others who, in this case, I would say are the peers that are there that I attribute some kind of influence to. That if I listen to you, if I only listen to Jim, right, and nobody else, I don't even listen to myself. I just give Jim a 1, and everybody else is a 0 in the W matrix. My weight is on that person, right? And if everybody in our group had that, we would be a cult, right?
Pretty well now.
Yeah, I don't know. Cult leaders have a lot of problems, I can tell you. Because they have to keep that influence from happening among everybody else. So they talk about all of the problems of trying to keep all of your followers from actually listening to each other at all. Because the model suggests that anybody starts listening to anybody else except the cult leader, that then it could ultimately foster a kind of revolution, right? It could, through the indirect channels. Because the model really is, so here's the standard sort of model there. The model really says that over time, right, it's a combination of your sort of base dispositional, attitudinal position at time one. You keep that. You keep that with you. I believe, this is the way I am when I entered into this, right? Some people, that's all that matters, right? Some people, they only listen to themselves and they're not susceptible to influence. This part here, the other part of the model, is the weighting of the other people's opinions at time t-1, and those combination of that predicts a person's attitude, belief, behavior at the current time. So it's a dynamic, flowing, iterative kind of model. And it's really that weight matrix here, which has to sum to 1. That's why it's a convex combination. The idea is that I only have as much other weight as I don't have self-weight. It has to sum to 1, right? And so to the extent that I, actually in this case, there are other specifications. In this case, all of the other weights that I apply to other people have to fall in between 0 and 1 and can sum to 1, if I'm following that right. So the point here is that there are formal properties of this, which is if you have an alpha of 1, right, then the model basically reduces to the complete interpersonal influence model, which is that essentially you just don't listen to yourself. You're just completely new. You're like a blank slate. You enter into a new situation, and you just kind of completely go with the flow. It's completely situational. You'll just start smoking and drinking if other people are doing it. That's just what you do, right? Some people might be more like that. Some people might be less like that. The other part is when interpersonal influence is absent, the model reduces to just your initial opinion, right? But the point is that each one of the individuals in the group is doing this weighting process of their own initial opinions and others, and it's a emergent kind of process that unfolds in a network kind of environment. And the network here is a social influence network. So how much do you attribute influence to others really matters in this case. So you can think about a kind of underlying network topology in which social influence plays out. And in this case, you can see that there are kind of 3 clusters of people here that are loosely connected with one another. If they were completely disconnected from one another, they would never achieve consensus on anything. It would just, maybe you would achieve consensus within the clusters, but not between them. So if you just simulate the peer influence process over 7 iterations with 75 actors, 2 initial just random opinions, Y and X, just get a kind of random distribution. The nodes are colored according to the clusters that they belong to. You can see that the clusters, it's all just random. But as that influence process plays out through this network effect, you can start to see that over 7 iterations, it starts to converge. It never, even after 7 iterations, it doesn't entirely converge into a consensus, but it comes pretty close. So in extensions of this, Friedkin has made it so that each person has their own influence, it's more of a vector of influence, of self-influence and other influence. And if you basically, what this affords is that, as I said, some people may think very highly of themselves. They may think that everything they say is perfect, and it's just, it was always that way, and they don't listen to anybody, right? In that case, this person, the model predicts, will either hold the consensus hostage, right? They'll never get to consensus. Or if anybody really attributes any influence to that person, it may take 100 years, but eventually the group will converge to that person's initial opinions. So if you have opinion leaders within each one of these clusters, you can start to see a very different dynamic where the clusters actually start to array themselves in a much more clustered way over multiple iterations. I've used this model in naturalistic settings. So what I want to say is that even though this was developed in a more of an experimental laboratory way, I've done it. I've looked at how book clubs come to share agreements on interpretations of a novel, looking at the same novel, a newly released novel about the Reconstruction South, full of all sorts of interesting themes around gender and race and region and historical fiction. And with my colleague, we were asking this question about where does meaning come from? Is it really dispositional? Do people read this book and go like, oh, well, I'm a woman from the South, so I have a certain Southern female reading of this book, versus a man from the North might read the book differently. That's standard sociology. We tend to believe that that's true. We tend to believe that people watching the same television show are watching it with a different lens. It's like, how you watch Modern Family just depends on your sexuality and whether you live in the country. And it's a reasonable hypothesis around certain kinds of cultural objects. In terms of something like this book, it turned out to not be a reasonable hypothesis at all. That the meanings, what we would call the dispositional scaffolding of meaning, that people really structure their readings based on what they come to the book club with, well, we'll see is not true. So we hypothesized that it could very well be true. Age, gender, education, income, region. We would think that would really impact the time one. So before they ever discussed the book, we had them answer questions, in-depth questions about what the book was about and who was guilty and all of these things. So we got a really rich, did a factor analysis and really looked at were there differences in terms of people's initial opinions on the book. And the other is much more of this channeling, the way that peer influence could operate within this book club, within the book club. So we then, after we recorded all of the book club discussions, and I listened to at least 30 or 40 hours of people drinking wine and talking about this book and getting successfully drunk, and it was fun. And basically, the point is that we then asked them afterward, who influenced your opinion about this book? Like, who were the people in this? How much did you listen to yourself and your initial opinions on this book, and how much did you listen to person X, person Y, person Z in the book club in this? And we basically then estimated the Friedkin-Johnson peer influence model, and as a way of trying to come to this view that actually influence and dispositions can be catalysts for each other. That is, that the interactional thing that goes on, the influence can help to bring out sort of dispositional qualities about people. And because these book clubs are highly homophilous, that is, that they tend to be groups of people who are of similar age, similar gender, same region, right? That a lot of the things that we think of as being more dispositional are probably the artifacts of ongoing interactional relational processes that are happening in small groups like this group. And so indeed that's what we found. We found that ultimately ultimately we found that there was no consensus at time one, that there were emerging consensuses that emerged at time two along the gender lines and along region lines. So we started to see a Southern reading of the book that started to emerge, and we started to see a more female-male version of the book. And the book is about this woman who kills her husband or fiance, and has a lot to do with race in the South, and etc. So in other words, through interaction with this object, people were able to resonate with it. The interaction, the peer influence process actually helped to bring out of them similar kinds of experiences. And then ultimately we cross-validated that with a lot of the contextual details of listening to this. So So here's one exchange from a woman in the DC area. She says, do you remember a couple years ago, a Fairfax County teacher? I remember this. I was teaching, what year was it? Probably, she killed her husband. What? 3 months, not even 3 weeks after giving birth, she kills her husband. And so oh my God, really? I do remember. She got off, didn't she? I was going to say she got off for postpartum depression. Yes, she sure did. In other words, so they're starting to pull experiences out of their lives, right? And to make sense of this book. And it's dispositional in the sense that the women are recalling certain kinds of events that were salient to them as women and applying it to the events that happen in the book. And most of the conversations in a book club, if you haven't been in a book club, are not about the book at all. Yeah, they're about your lives, they're about things that are going on, but the books are good for figuring out, you figure out the meaning of the book by talking about your own experiences in your life. I think Martha, had postpartum and she just lost it. I think she was just sick of everybody treating her like crap and took matters into her own hands. I think she was just miserable, poor thing. Can we go home and make our husbands read this book? I think she really loved him. And in her mind, he never came to the marriage. Even though he did, she didn't know that. He was such an ass, right? He was such a dumbass at that point. He was so stupid about it. That was the dumbest moment in the whole book. We have all loved cowards. Let's be honest. We have all liked men who were not the greatest. So, with that, don't despair. There's lots of data out there. There's lots of strategies. I am no econometric whiz, but I've been beaten up by them for years, and I've still been able, I think, to put forward a body of work, and I think a lot of us face a lot of criticism when we try to do peer influence work, that it's not good enough, that there's always all this other thing out there, that it could be this, that, or the other thing. But I would just say, how is that really different than any other science, right? Except that a lot of times we're trying to do things that are really hard. That you just cannot randomly assign smoking to people, right? You can't necessarily, not everything can be a natural experiment. It's just not out there. Do we give up? No, I think we go forward and we realize that science is a team sport. All right. And I think I just have maybe 5 minutes for more questions. It was called Jarrettsville. It was by Cornelia Nixon. She is a fairly well-known author, and my co-author, Clayton, got in touch with the publisher and said, is there somebody out there who's almost done with a book, right? Almost done, getting in the process of, getting through things that might be, or maybe it wasn't even almost done, it was maybe in the middle of the process, right? He wrote a remarkable book about this called Under the Cover, where he follows the creation of Jarrettsville from the publisher to the publication to the reception of the book. And it won the Best Culture Book Award in the American Sociological Association. And we've gotten a couple interesting publications out of it as well. So it's not a great book.
Oh no. Under the cover or Jarrettsville?
Under the Cover is a great book. Jarrettsville is one of the things about Jarrettsville that's interesting is it's even from its point in with the publishers, everybody was worried that it was going to be misread as a romance, and so they tried to change the book so that it wouldn't be misread as a romance, and people still misread it as a romance because it's a very messed up romance where somebody kills their fiance in the first chapter. So if you're expecting that genre and that's what happens, you're not going to really love this book.
I think anyone who reads it from this point forward is expecting murder to be the main plot.
All right. Yes.
Sorry,
No.
do you have any documents or any kind of material that could show us different analytic methods that we could use for each of the different types of peer influence models?
Can you be a little more specific about what you mean by?
Yeah, so like for the dyadic data, like you use APIM, and then for the stochastic factoids models, you use CNN. Are there any other ways that we can approach this, or any other analyses that could be used?
So dyadic models, it may be, I would recommend Kenny Cashin Cook for a number of different kind of dyadic frameworks for this. Then for the Siena models or the stochastic actor-oriented models, that is really mostly Snyder's work, and is there's a kind of whole industry around that. And again, Dr. Schaefer will be talking more about that tomorrow. And then for the peer influence stuff, the social influence network theory, you can follow up on, there's several really good sources for thinking about estimating it, different models. If you email me, I can send you some of those references. But also, if you just look to the work of Friedkin and Johnson, and they wrote a book called Social Influence Network Theory. It came out about 10 years ago, and that's a great place to start as well. Yeah, of course. No. Yes.
So this last slide that you had was, the portion was like so cool, just capturing how people were talking to each other.
Yeah.
And it kind of made me think about how people's ideas may change based on, so you talked about kind of how people are aligned based on their characteristics, and how they adapt attitudes to their behaviors as characteristics. But did you capture any changes in opinions or ideas around sexual growth from people who maybe weren't similar?
Oh yeah, for sure. So that's a great question. So the in many ways, the influence process happens within the book clubs, right? And it's not actually so much that people within the book clubs were only listening to people like themselves. So I could have made that a little clearer. So within the book clubs, the influence process is pretty spread out, right? So, and they listen to people based on their sort of what we would call status and expectations around what they know about this kind of book. So in this case, in some of the book clubs, they're like, well, that weren't in the South, they'd say something like, well, this person grew up in the South, right? So I'm gonna listen to them, right? So they attribute influence to them. So people who, so the reason though that you see the effects pool like this is a combination of things. One, the book clubs are highly segregated along, we didn't have racial heterogeneity in these book clubs because we couldn't find book clubs in African American communities or Latino communities where it felt like through our connections that they would have read a book like this, right? Like you wouldn't want it, that would be an unnatural setting. So we, like, here, read a book about the white people in the South killing each other, and like, and I think, Clayton approached one book like, we just kind of, that's not our thing, right? So I think that the book clubs being these naturally occurring foci, right, in which people, that's the issue. The issue isn't that people are not listening to people who are different than them, it's that they're not interacting with people who are different than them. Oh, yes?
Could you tell us a little bit more about that recruitment process for the book club?
It was really just a snowball sample, right? Just referring people, through friends, through friendship networks, through social media, trying to find people who would read this sort of book, right? And so, and then at some point it just got to be like, well, that's a lot of book, and trying to get it in different regions, right? But also facing the limitations, which is that we only could find like one book club that was more men than women, right? So most of these are, it's just the nature of the clubs, right? Yeah.
Thanks, Craig.
Thank you. Thank you so much.
All right, we're going to switch over now to a little bit of work on that I'll present on structural equivalence and block modeling. On the schedule, we're supposed to have coffee, I believe. We're a little bit behind, but so if you want to get up and get coffee, there's some over there. That's great. Just help yourself. I won't be offended. And we'll go from there.
Sorry.
Thanks, man. the biometrics on Apple devices seem to be working pretty well. So. All right. So today I want to talk a little bit about positional analyses, and this is the distinction. If you remember, I think I actually probably still have the slide. Yeah, here we go. This distinction that we make in our book, and that we've been trying to sort of get people to sort of frame their thinking about networks around, is that networks aren't just one big thing. There's lots of different ways to use networks. And the way we traditionally use networks is this networks as pipes model, but there's this whole sort of literature that sort of, in many ways, sort of sucked a lot of sociologists into networks in the first place. That we want to think about networks as systems of relations, and that people occupy different positions in the systems of relations. And that there's oftentimes at the social level a logic to the organization of these positions, and that the social system itself is organized in a particular way, and the traces of that come out as roles and role systems. And so these ideas of a role and role system fit deeply with the notion of networks. This is part of the reason that many sociologists got interested in it, besides the fact that it has the diffusion side. The diffusion side, I'm just going to tell you straight up, is, like I said the first day, the diffusion side is, the connection side is more well developed. The tools there have, because of their obvious use in disease diffusion and other kinds of peer influence and so forth, there's just been a lot of money and interest put in it, whereas the positional models have been developed largely by poor anthropologists on a shoestring without a whole lot of money behind them, and so you haven't got a lot of the same kind of interest. I think that's too bad in many ways, because as I hope to convey to you anyway, I think these kinds of models can be really powerful and really tell us something about the world that we don't otherwise get. The archetypical example of a positional model is kinship systems, which is why I put Ashton and I next to each other. And so this will be the general case, and then Ashton will take you on to the specific case. But the way we want to think about positional models is a little bit of sort of this idea of a coherence of roles. So social life can be described through these social roles, and to the extent the roles can be characterized by regular interaction patterns, then we can summarize roles through these common relational patterns. And what I mean by that is that almost any time you imagine your interactions with somebody else, you can characterize them, if that other person has a title, you can characterize your relation with them by a specific type of thing you exchange. So the classic example I always give is that teachers exchange assignments with students, and parents exchange discipline with kids, and lovers exchange affection with each other, right? And so there's this effect in which when we have an ID, some kind of a characteristic, that there's an exchange process that goes with it. And anything that you can exchange with someone, you typically exchange because you're complementary, right? So there's this classic line from Adam Smith that no one's ever seen a dog exchange a bone for a bone, right? That's because dogs are substitutable. It doesn't make any sense. I already have my bone, I don't need your bone, right? But if I'm selling cars, right, I need buyers that give me cash. And so there's a sense in which there's a complementarity that comes through social exchange. And that's the foundation of role systems. That when you live in a large differentiated society, we don't all do everything the same all the time. We do different activities with respect to each other, and we have a division of labor. And that division of labor creates a necessary exchange. And that's obvious in the economic world. That's the world that we're, especially in the West, that we're so used to thinking. But it turns out, and this is whether structural anthropology is so beautiful, it's true in the symbolic world as well. So we exchange meanings, and there are types of people who are experts in producing meanings, and other people who come to them in order to consume those meanings. We call them shamans and priests and so forth. And so their job is to help shape meaning for us so that we can interpret the world around us that is otherwise a mess. And so there's this exchange process that's engaged in all of social systems, and we understand each other by virtue of the fact that what you do fits into a box based on your role and my role. Now, what was really interesting about this idea, now this idea is like it's an old idea. So Nadel's The Coherence of Role Systems posits that the fact that we can get along in society is that we implicitly learn these. And part of what it means to grow up in a society is that we understand the implicit meanings of social exchange systems in a way that allows us to be competent navigators of the social landscape. So we can move around and it makes sense. And anybody, that's part of the brilliance of travel. The reason it's so fun to go to another country, particularly a country where you don't read the language, is that you've othered yourself, and you get to experience that immediately. So as soon as you step off the sidewalk and realize that the rules here are a little bit different, that's that example, that you're no longer fitting into the system that's set up there. The role system idea, it comes out, like I said, out of structural anthropology. The brilliance of White, Borman, and Breiger, the original social structure for multiple networks papers, is that they flipped this around. And they said what traditional role theory has done is said, you give me a set of roles, I will enumerate from that the set of exchange patterns. But there's no reason you need to go from roles to exchange. You can flip it around and go from exchanges to roles. And that's brilliant, because what it allows you to do is to uncover a set of roles that don't otherwise have names. And so there are a whole series of regularized interaction patterns that we engage in that don't have names, right? Informal leaders and brokers and other kinds of things in families, the person who you always put next to your drunk uncle at Thanksgiving to sort of keep them in check, right? That person doesn't have a role. They probably have a name in your family, but I think everybody in every family has one of those characters that fills that position, right? It's sort of the referee of some sort, right? And so these notions of have a role is what we would like as sociologists and anthropologists to be able to have a tool set that lets us identify them, because clearly they matter. They're engaging in the way that people, they're activating the way that people engage the world. And so if we can find them, right, that makes it possible for us to study them and explain them and do all the things that sociologists do. And so what White, Borman, and Breiger did is they took the logic of kinship models and this notion of compounding relations and used that to describe all kinds of social relations. And so what I mean by the logic of kinship relations, I don't know if I brought this slide with me, is that there's a certain set of roles that fit together in a way. And some of them are these necessary roles, right? And so if you could imagine that, the kinship example just comes to mind because it's easy, that my mother's brother's son, right, is my male cousin. My mother's brother's daughter is a female cousin. My mother's brother's son is probably me, right? And so you can imagine thinking about the way these orders of relations go. And my father's 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 father is my great-great-great-grandfather, and so forth. And so we have these compound relations. Well, you can compound other kinds of relations. So it doesn't just have to be biology and descent, like my husband and my children. It could be, the relation could be informal. It could be a friend of a friend. So a friend of a friend also has a conjunction. We call a friend of a friend an acquaintance, if not a friend. My enemy's enemy is probably an ally, right? My lover's lover better be me, right? So that's the kind of model that we think about, right? And so this notion of compounding relations has a chance to sort of fill out the kind of things we expect to come out of those systems. And just like we expect ants to behave in certain ways, we expect our lover's lover to behave in certain ways, right? So this is the way that this is the kind of idea that they have. Now the biology versions, the kinship versions, are necessary. They're built into the grammar of the relationship themselves, or in the biology of the relationship, or the formal law of the system, right? The one thing that most sociologists care about are these coincidental roles. These are roles that pop up out of the feature, not because they have to, but because of either some creative social action on the part of the actors, or capitalizing on a random sort of series of events that made a position particularly meaningful, that then gets reinforced and renamed. So this is the example that I gave on the first day, right? If I have 5 actors, I describe their social relations. We have romantic exchange, we have feeding, we have bickering. This is the classic, comic family. And the fact that part of the reason I use this example is that it has a set of characteristics that I think are nice about sort of the general illustration of roles in social networks. The first is that it's a combination of different types of relations. So you can do block modeling, you can do relational analysis on single relations, and I'll show you an example of that. Excuse me. But it really shines when there are these different kinds of relations, right? Because that's where you get the opportunity to see the intersections of sort of the spread of an exchange process across a single dyad. So a single dyad will exchange one thing. So lovers exchange one thing, right? But lovers and their kids exchange necessarily something different. But the romantic relation sort of investment gets invested through the feeding of the kids into the parents' investment of the kids. And so this kind of joint sharing carries some meaning through it by the fact that these relations have a conjunctive nature to them, which I think is nice. The other thing, just from a practical standpoint, is you'll notice is that we have some symmetric relations, some asymmetric relations. Feeding, in this case, is actually anti-symmetric. Kids don't provide for parents, parents provide for children. And so you have this kind of mix of different kinds of relations. Lots of different kinds of these relationships. I've kind of already said that, so I won't say it again. I think that we want to think about this. One bit I would point out is that it's easy for us in the West, in particular, to think of these labels as attributes of nodes. When Nadel wanted us to think about, what the classic work in structural anthropology wanted us to think about it, is that roles are actually a collective property of the social system. So aunts have a meaning, right? And so if you've ever got hooked on Indian matchmaking, auntie is a word, right? And auntie means something in the Indian context that is not just my mother's brother, right? Or my parents' mother, sister. Excuse me, I'm getting you through, right? And so this idea that we have a collective understanding of these roles should be true not just for formal roles like deans, but also for informal roles like broker or fixer, right? Those kinds of things. Yeah, I'm going to skip that part. All right, so there are, in general, in network analysis, that's the sort of the big theory, and I would love to sit down over a little bourbon with you at the end of the day and think about this sort of wax philosophically. But my pedagogical moment now is to move to work like, what do we do with this? Like, how do we actually do this kind of analysis? And there are two ways that traditionally that sociologists have done this. One has been a sort of micro way, and the other is a collective way. The micro way is through centrality analysis. And there's a whole bunch of work with centrality. I talked about that briefly in the set. Centrality has, again, sadly been co-opted largely by the connectionist folks, particularly thinking about the ways in which centralities are thought of as path compoundings. And so you can either be a radial or central or medial and so forth. But in the interest of time, I'm not going to talk about the centrality version of positional analysis today, other than to say you can do a lot of positional analysis using centrality scores in a way that is really easy to do. You just don't think about them as by virtue of their property of having collected something and passed it through. You think of it as something that uniquely identifies a place in the network that a person lives. So if you just shift your interpretation of why it matters, you can do it with centrality scores as well. But I want to talk about the collective version of this right now. So the collective version, the idea here is that, so I'm going to skip over the centrality. The collective version is that we have some set of relations, and so now what we want to do is identify a partition on these relations, a coloring of the nodes that says that this set of nodes differs from this set of nodes. And so the way we do this is called block modeling, and I've deliberately in the title of this slide referred to as relational block modeling, because in the statistics world now, this has been co-opted to mean stochastic block modeling, which is just a different word for community detection. And stochastic block modeling is a type of community detection. Relational block modeling is finding roles in networks. So first you have to identify a notion of equivalence, and this is something that makes two actors the same in the network. Once you have that, you need to measure the degree to which pairs are equivalent, develop a representation of that equivalence, and then assess the adequacy of the fit. So these last two are largely what you would do for any kind of descriptive analysis. These first two are what part that makes it unique for social network analysis. In general, the broad class of equivalence that we're dealing with is this thing called structural equivalence. The structural equivalence says that two people are the same in the network by virtue of their pattern of ties. Now, there's a whole lexicon of special terms: structural equivalence, regular equivalence, automorphic equivalence, isomorphic equivalence. I'm not going to go into detail on what each of those are, because frankly, at the end of the day, it rarely matters. Right? There's specific algorithms for one over the other, but I want you to get the intuition for why this matters, and then I'll point out the different cases you can use. So a structurally equivalent node, right? Two structurally equivalent nodes should be indistinguishable in the network. They have the same pattern of ties to the same set of alters in the network. Now, perfect structural equivalence means they're truly substitutable, that if I'm tied to Craig, then my structural equivalent is also tied to Craig. If you've ever taken a new boyfriend or girlfriend back to your hometown and had them mistaken by your friends for your ex-boyfriend or girlfriend, you know what structural equivalence means. Right? That kind of awkward moment, that's structural equivalence. And you don't want that, right? That's a case where it induces a set of problems. But from a standpoint, from our standpoint, from a methodological standpoint, you want to find a way to take these separate relations and figure out how a pair of nodes is the same across all of these relations. And the intuitive, simple way to do this is to stack the relationships. So you take your romance network, you put it up here, you take your feeding network, you put the direct network there, and the transpose there, and the bickering network there, right? You can do this for as many relations as you want. Now you might ask yourself, why did I transpose and double count the feeding network? It's because I want to distinguish not just that I feed Craig, but Craig receives feeding from me, right? So this notion that there is both a sent and receive ties helps you figure out whether or not there's an internal reciprocity that is meaningful in this setting. And so usually, a lot of the routines in the R right now will automatically transpose all the relations. And so they actually double count these necessarily symmetric ones. I think practically you're better off if you just double count the ones that are asymmetric, because then you're not overly weighting those ties. But there's not a whole lot of simulation work on this to know how these matter. Then all you do, once you've stacked the relations, by virtue of this trick, now really the columns is where all the information is. You don't really care so much about the rows. And so what you want to do is say, is this column the same as this column the same as that column? And you can do that with whatever your favorite the same statistic is. Traditionally, it's been correlation. So we ask, how often does this column correlate with this column? And in this little toy example, and the reason we recognize it so well, is you have perfect correlations within position and zero correlations, probably actually negative, actually calculated. So we can see that these guys are actually the same. So they match on every one of these dyads, they're the same, and every one of the dyads, those three are the same. And that's your similarity score. Now there's a bunch of different similarity measures. In the R package that Carter Butts wrote that I'll show you today, there's the common ones are counting distances. So you have Hamming distances, you have Jacquard distances, and there's versions of the correlations. You have the regular correlations or a regular equivalence version of correlations. Excuse me. Now I'm going to spend a little, so the structural equivalence is the version that we always hear people talking about. It's part of the White-Forman and Bragger paper. In that version, it's the same two people are tied to the same nodes. And to the extent that these operational relations matter, one of the problems of that same set of ties to the same set of nodes does for us is it ends up conflating equivalent types of positions with clusters. And so structural equivalence will have a bias towards finding communities. And so the distinction between roles and communities gets a little bit blurry when you're getting the structural equivalence because of this reliance on the same side of others. Automorphic and regular equivalence says that are a little more general. So what they're saying with automorphic equivalence, you have the same pattern of ties to all other of the networks. And so nodes are indistinguishable on any summary statistic. So keep that in mind. So what you're really saying is that if I were to have the number of ties, your betweenness centrality, the size of the number of groups you can reach in 2 steps, your inverse score on the Laplacian matrix, right? You can find me any crazy score you can invent on a network. If the nodes are automorphically equivalent, then they should have the exact same score. Now, a slightly more generalized version of that is regular equivalence. In regular equivalence, we say that I have similar types of ties to similar types of others. If automorphic equivalence is co-word in a network, a regular equivalence is co-meaning in a network. And so this is what old style co-word analysis would do. This is what GPT would do, right? And so I can say, the cat got chased by the dog, and the squirrel got chased by the coyote. Those two things have no words in common, but they mean effectively the same thing, right? And so regular equivalence is an attempt to try to figure that process out. Again, a lot of times these distinctions don't make a whole lot of difference, except that when you try to look up the algorithms for them in the literature, you're going to find slightly different algorithms for all 3 of these. This tends to be done with Concore in correlations. This is done with clustering on observed statistics, and this is done with a specialized algorithm called RegA, RDGE, which is regular equivalence generation something. I forget what the last E stands for. To give you an intuitive sense of what this looks like, as a viewer, you can look at this and you can probably tell me which of these nodes are the same, right? So you can say, well, look, there's somebody at the top of a hierarchy, some vice presidents, and some graduate students, right? And so you have this kind of model sort of fitting in the world. And if you run Concore on this, what you can do is you can say, to do that, what you would do is you would take this adjacency matrix that we've observed in the network. It's a symmetric matrix, so I don't have to worry about flipping it in any way. And I would just take each column and I'd correlate it with every other column and generate a square correlation matrix. Now, your perfectly structurally equivalent nodes are going to have a correlation of 1. All right, and so this is the intuition behind why you would use correlation to capture structural equivalence. But the beauty of the Concore algorithm is that if you now say, well, there's some information embedded in this, and I know that this position is, this person is structurally equivalent to this person, but what I'd like to know is how similar are these two to each other, and I don't know how to interpret a -0.2 correlation. I don't know what that means. But what Bragger, Borman, and Wright figured out is that if you take this correlation matrix and correlate it with itself, and you do that again and again and again, the thing breaks up into these two beautiful parts, right? One block of all ones and another block of all minus ones. And my lines got messed up here at some point, but the line's actually right there. And so, and this is a feature of correlation matrices. The power sequence of correlation matrices will always converge onto two sets, one with all positive sets and one with all negative sets. And that then becomes the basis of your divisive algorithm, to use the language we used last time. And so for any given network we see, we can run that little process, we can split it into two, and we get a split between us's and them's, and then within the us's, we can split them between the holy and the heterodox. And we can just keep doing this splitting on and on and on as we go. This notion of the way that Concore works is both a feature and a bug. By virtue of a binary split, each time you do this, sort of if you just apply this in a rote way, you're either going to get 2, 4, or 8 clusters if you go for 1, 2, or 3 splits. Of course, you don't have to do that. The smart thing to do is to split it at 2, evaluate it. If it looks like it needs to be split again, split each branch separately, and then you can get as many splits as you want. And that's intuitively what we do in our software. Give you an example of how this works. This is the co-voting network in the Senate, and so here you see that each person is tied if they voted the same on a bill, and you can go ahead and sort of sort those into people who are exactly the same number of ties they voted together. That's what we have there. And then we can run that through Concore, and when you run it through Concore, what you find is that these are sets of nodes that are all structurally equivalent. And so you have, this is 2 different versions of the Senate, but in this case, in the 103rd Senate, we have 2 largely fall in line kind of Democratic clusters, 2 largely fall in line Republican positions, and then a set of smaller positions where people aren't exactly towing the line. And then by the time you get to the 104th Senate, there's only 3 people who occupy that. So the fact that you have the loyalist position has taken over in both sets is a structural equivalence mapping. And that's what this image that Peter showed you yesterday is that we went through and ran Concore on every version of the Senate. And so each of these nodes are structurally equivalent. So this is the loyalist position, but there's individuals who occupy positions that aren't quite the same. And so you can find sometimes there's multiple, so in this case there's 2 senators, here there's 3 or 4. But by and large, what happened sometimes in the late 90s is the ability to occupy a position within the center of the network that fell out of the grammatical sequence of whatever it is that made being a senator possible in the late 80s, or the late 90s. This is one of my favorite results, is that you said that even the loyal opposition split in this case, right? So it's happened, but that's the beauty of a positional analysis, is that it allows you to see this isn't just a cluster of nodes that happens to vote together. but they also, when they voted together, or didn't vote together, they voted differently with others in the network. And so that there was some issue that split them apart. Now the other way of doing this, right? So that was so Concor is the traditional. It's the first thing that people did. It's the thing that got this whole thing started. It turns out that regular equivalence is a slightly different critter, and I like it better, if I'm honest, for at least for many of the kinds of problems that I think that are uniquely role positional kind of models. And so what you're trying to do is you're trying to find nodes that fundamentally just have the same pattern of ties, irrespective of who they're tied to. So it's all about pattern as opposed to about contact. So in that sense, it's just a pure version of this. And the nice thing we discovered here is that the problem with automorphic and regular equivalence is that they're really hard to calculate the regular equivalent metrics directly. Because what you're doing is you're saying this node, you have its row and column, you have to somehow enumerate the path structure around each node relative to the path structure around every other node in order to figure out how similar they are. And it's just a pain in the ass. And so the classic version of doing this is the Reg-A algorithm, which recursively defines the degree of equivalence between each pair. So if you imagine intuitively what this does, it says, do we match on degree? Do we match on a two-step degree? Do we match on some other function of our step degree? And you keep doing this over and over and over again, and who do I match with? And so it's an iterative algorithm. It's slow. It doesn't always converge. There are a bunch of fine-tuned settings you have to fit, and so it can be relatively fussy. So Ron Burt came up with this idea in 1990, who said, if you and I are the same, then necessarily we should have the same pattern of ties to every other type of third possible tie we could have in the network, right? And so we might be able to exploit the fact that triads already enumerate every possible combination of a person to every other pair of person in the networks, and use that as a shortcut to get this. And so that's what he did. And so the way you do this is you take the periodic table of social elements, which is known as this triad census, and you figure out from this whether or not people are in the same spot. And so the beauty of this is that triads are a nice way of locally enumerating social rules. And so if you imagine what a rule that says a friend of a friend is a friend looks like, well, it looks like a friend of a friend is my friend, right? Or a friend of a friend is my friend. And so you can go through each of these triads and say, a friend, well, there's not a friend there, so that doesn't fit. This one is a friend of a friend is empty, that doesn't fit. This is a friend is a friend, this doesn't fit, right? So you can identify where does a friend of a friend fit. Or you can figure out where two people that are agree on a third party agree with each other. So this is hierarchical agreement, we have reciprocity. Most of your social processes, if you can state them as a pattern of ties, you can map them back to triads. And so that's the nice feature. And there's good rules for counting on networks where triads exist. And so if I know that every triad in the network looks like this, I know that the structure, the global structure, has to look like this. Just like if I know that every verb in a sentence is in the present tense, then that says something about the kind of document that I'm in, right? So this is the idea. So if I've restricted my sentence structure to being this really simple kind of sentence, you can only have one kind of story. And it turns out that there's lots of difference of these. There's a whole sort of great literature that Eugene Johnson put together on the triadic structures, microstructures leading to necessary macrostructures. I love that work. It's also another side of work that's been abandoned, so if any of you want to take it up, come and talk to me later. But you can then take all of this work at the macro level, which essentially is about the role system, and say which roles do people occupy within that role system. In order to see that, we look inside each of these triads and we identify that there's a slightly different pattern within some and others. And so we can see here, for example, in the 102D triad, you have one reciprocated dyad and a third that they're disconnected from. So these two are equivalent. They're substitutable, you can't tell them apart. So within this triad, there's two positions. Within this triad, you could be either the end, the bridge, or the starting point, the bridge, or the end. And so there's a different position depending on where you fit in this pattern. And the beauty of this is that this is also pretty simple to enumerate. It's just sorting and counting, like everything else in numbers. Once I have that, I can say, of these 36 different triad types, which are the rows in this case, I can ask how often does node A occupy that all empty set, or the dyad position there, or that position there. And you'll notice that there's no identities attached to any of these. It's just which piece of the pattern you belong to. So I can tell you how often you occupy a particular element of the pattern structure. And it turns out that regularly equivalent nodes will have the same pattern. And so what's beautiful about that is that in this case, we can see that nodes A and B have the exact same patterns. Nodes C, D, E, and F have the exact same patterns, and all of these have the exact same patterns. They're not tied to the exact same people, so they're not structurally equivalent, but they're pattern equivalent. And this is a nice way to get that set. Now, we've applied this model in lots of different places, and I have a whole discussion here about how you can go through a sort of example of how we did this in the Prosper data. And I'm just, in the interest of time, I'm not going to go through it completely. But what you do when you do this is you essentially generate this distribution of triads for everybody in your network. And so you'll have a column for each respondent in your network, a row for each one, and then you calculate whatever favorite similarity score it is. And in our case, we just used a hierarchical distance score. I think we ended up using a Euclidean distance, if I remember correctly. And then once you have a Euclidean distance matrix amongst all your sets, you have a hierarchical clustering problem. And so I can go through and say, well, if we cut this network here, this clustering tree at this spot, that gives me some number of positions that all fall under each branch. And those are the positions of my network. So that's the way the process works. It's a classic cluster analysis. Now, we had to do this across 360 or some odd Prosper networks, all of the classes and all the waves and all the settings. And so I wasn't going to do that by hand, right? And so what we did is we took this matrix, where'd it go? This similarity matrix, and we said, well, what if we just treated the similarity matrix as if it were a community detection problem, and we calculated modularity on each of the solutions that we could get and picked the highest one, and that's what we're seeing here. So in this particular case, it turns out that 7 clusters is the highest modularity return when we play that little trick. Completely ad hoc. I have no formal theory. Peter hates this solution, but it works, so that's fine. So you do it, you get a system that looks something like this. You have a popular core within the school, so you have school networks, and you'll notice that this popular kids, they're popular because every other position sends to them, and they recognize themselves. So that's a classic, this is the way you represent the block model, is the self loops now are meaningful, so the people in the 7th position think that they're the shit, and they nominate themselves. They tolerate another group, the 6, that are really like them. So these are the little hangers-on that they're willing to sort of feed a few crumbs to. They think they're cool too, but not as cool as these guys. Then you have an outside clique that is sort of on the bridge set, where these guys, they kind of want to be friends with the popular groups who then don't respond back. They recognize each other. But there's this group of outsiders here who are sort of, like, why are you bothering? And so you'll hear the story I'm telling here, right? We have different types of isolated groups. In this case, we have a small group of folks that they actually have some ties in group 2 to each other. They just aren't enough to make it to come across our threshold. And so this is sort of a weakly connected outsider group, and this is a true isolated group, right? And so what's beautiful about this kind of model, and what I hope you picked up in seeing me do this, so this is done in a single relation, so it's not a multi-relational block model, it's a single relational block model. But most of the story comes not just from the fact that 3 is tied to 7 and 6 is tied to 7, but that 7 doesn't tie back to 3. So the zeros, the non-connections from one group to the next, often tell you as much about the setting as the connections do. And that's why it's different from a connectionist standpoint. We're not asking where does something flow through this network. We're asking what does it mean to be the kind of position where everyone wants to be part of you, but you are really stingy with who you're part of. Now we do this across a bunch of different schools, and so there's a whole story we have in here on how we figure out this for all of these networks simultaneously. But when we do it, we see that across all of these settings, we end up with about 7 different types of clusters in each across all of these schools. And this is what they look like. So I'm going to skip the details on what they're there. But it ends up being the case that we have a set of really what we call sort of popular loners. So these are folks that others like them, but they never reciprocate. And so these they're high on a hierarchy dimension, they're low on a volume dimension, so they're not engaged in much, and they're, how did I end up over here? Yes, they're low on the volume dimension, and they're low on the reciprocity dimension. So those are the 3 dimensions. And it's kind of nice that it works out that these things all map up that way, but you end up with these, what the whole reason we started this project in Prosper was that Coleman had this idea that every school had a leading crowd, some set of groups that were really tightly knit to each other, that other people wanted to be part of, and that's what we ended up finding. These positions are unsettled when you're in 6th grade, so when you first start in these schools, all these kids sort of show up in a junior high or in the middle school, and you can see that the structure is sort of roughly there, but there's a lot of noise between it, and so people will move from wave 1 to wave 2. You might have started in the leading crowd position where you're likely to end up in one of these others. If you stay in the sort of middle ranks, you kind of move around there, and the loners kind of move around. Every once in a while, you're going to move strong between ranks, but not much. By the time you reach seniors, these things are really pretty well solidified. So your options for moving, changing position over time in high schools, really low. So if you're on the outs, you sort of stay on the outs. If you're on the in, you stay on the in. Now there's a bunch of things that are correlated with this, which I'm going to skip today to talk about, but it's really kind of fun to think about. Let's talk about that. Now, if you think about it for a minute, this notion of automorphic or regular equivalence, if the defining characteristic is that nodes are indistinguishable on a summary statistic of a network, then why not just cluster summary statistics of a network, right? And it turns out that that's a really fast way to find structurally or regularly equivalent nodes in really big networks, because what you can do is pick, a dozen cheap to calculate summary statistics on the node, and then cluster those, and all the nodes have to be the same. And so we've done this on networks with millions of nodes in GitHub in this case, and so you end up finding that there are sets of nodes that occupy a lot of different positions that distinguish between sort of members and bridges. All right, so that's the sort of big picture forward way to look at this. Now, I promise to give a little bit of practical advice. If you want to know what I really think, I think that it takes a lot of time. So you should allow yourself the time and energy to go in and do this by hand for a little while, and make sure that you understand your setting well enough that you can make sense of the kinds of patterns you find. So once you've done that, then you can jump into one of about 4 different tools. One is the IdeaNet tools. Tom here? Tom put together a module in IdeaNet that will do both the clustering version and the Concore version of structural equivalence on multi-relational networks and pick out the best solution by modularity automatically for you. So it's a one button, push it, and get structural equivalence out. And so that's what I really recommend you use. I don't have a slide shot for it yet, but that's we designed it for this exact purpose. And so the whole purpose was that you can take in a multi-relational network, push the block model button, specify a couple options, and get a reasonable solution. And it really does work nicely. Kieran used it in his his undergraduate thesis. There's also a great set of tools that Carter Butts put together for calculating regular equivalence and structural equivalence using the standard default metrics from the community. And so if you just use the Samson data, for example, this is really all it takes to generate a block model, right? So you say that I'm going to take the network, I'm going to get the Hamming distance of similarity for structural equivalence, that's what the SE is, that creates the distance matrix. I can then explore that in some ways, and I can cluster it in the way that you would an equivalence clustering, and you do there's a handful of options that go with this that are going to bore you today. I dislike the default clustering method. I like Ward's minimum variance. That's just the way that I played with a lot of these, and I found that it works the best. And then you can sort of plot what you get. I'll just show you what the results of this looks like. So when you do this first distance matrix thing, and then ask to plot what it looks like, its default object is a hierarchical clustering tree. So the distance matrix you get out of the structural equivalence says, well, look, nodes 13 and 15 were really similar, nodes 1 and 2 are really similar, and they're pretty distant from node 3. But there are 2 big branches, maybe 3, depending on how you count this split. So I just arbitrarily picked 4 is what I don't know. Yeah, so there's 4, so these 2 are off on their side. So I say cut it here, 4, and that's going to put nodes 1 and 2, these nodes together, and these nodes together. R has some nice heat map functions built in, so again, you can see that 1 and 2 are pretty similar to each other, 12 and 13 are very similar to each other, and these guys are very distant from everyone else. And this is what the network ends up looking like. And so you get one cluster of very popular nodes, they're sized by degree, you get another sort of closed cluster of middling nodes, and then a set of peripheral nodes. Now, you can do this with regular equivalence, and one of the things that I would just point out is that if you look at each of these clusters based on structural equivalence, you'll notice that all the clusters are connected to each other. So this core node is connected to each other, this middling node is, and the 2 different peripheral nodes are all linked to each other. So it's both equivalent and communities. Whereas when you go to regular equivalence, note that this exact same network, note that the hierarchy tree looks very different. It's a much less complex tree, and there really is only 3 different sort of branches here. There's this one way off in the set. Everyone's really equivalent in one position here, and then another set on the side. And what you're getting are effectively a core group of people who have some kind of betweenness ties, so people are nominating them, but they're not nominating others with the same degree. That's the green set. Notice that they're never nominating each other. And the red nodes are peripheral. These 7 nodes are just really nominating others, but notice they're not tied to each other in one block. And so that's the beauty of a regularly equivalent position. That this position is capturing people that have the same pattern, even though they're not tied to each other. Now, I don't know if this actually means anything for the Samson Monastery data. I haven't put it to a dependent variable, but that's the pattern that keeps coming out of it. And of course, the beauty is you can easily do this with as many different relations as you want. So I can say the business relation and the marriage relation in the Medici data. I'm going to say let's do that as an equivalence class, and structural equivalence is the one I use in this case, and I'm going to use the Hamming distance measure. I do it, I looked at the tree and thought, well, there's one group out here that's one node that's clearly an outlier, and then a couple of others that look different. Let's just go ahead and ask for 4 just to have a look. And when I do that, turns out that the Medici are in a class by themselves, which that's what 6 is, right? And if you read the 100-page long Paget and Ansel paper, you will know why the Medici are by themselves, but that's what you should find. And in this case, you can see that we've plotted this both by marriage and by co-business relations, and you get a pretty canonical set of nodes that are linked just to the Medici or largely dependent on the Medici, and a group that's sort of not dependent on the Medici, which are these guys over here. Makes sense. The other package that you can use is called Concore R. It's a nice package. It works well. It implements the classic Concore methods, and the nice thing about it is this works well with iGraph. So if your favorite R package to use is iGraph, not StatNet, then the Concore package works well. There's another package called Block Model. It does stochastic block models, so don't get confused for what's that doing. It does a really good job of stochastic block models. It's one of the few that does them well. It's really slow, but you get the right answer. All right. So, positional approaches I think are still underdone, and there are promising ways to do it. The simplest ways to do it is by these node clustering methods. I think the thing that I do want to highlight out is that unlike community detection, we don't have a lot of implicit knowledge and a bunch of theory built around it yet. It's still a little ad hoc, and it's still a lot of work on the investigator side to do interpretive meaning. I tend to think that's a good thing. I think that this sort of helps us as investigators be creative and get to know your settings, and sort of brings a little bit of that digital ethnography sort of flavor back into sociology, so I think it's well worth doing. And once you spend a bit of time, especially with a lot of these collections of networks, or Prosper or AdHealth or whatever, you can learn what you're doing and then apply it uniformly and systematically across the rest of your set. So that makes it a nice way to do that. And I'll stop there. I've used more time than I was supposed to, and take questions. So thank you. Questions or ideas? Craig, please.
Has anybody validated the 2 two different approaches to regular equivalents and seeing if they basically go the same sort of positions?
Not to my knowledge. Someone should. I know that Bert in the original 1990 paper did some very simple versions of that and showed that he could get similar results, and also that he could feed it networks that he knew the structure for and recover those. But I haven't seen a lot of other. Please.
What happens when you have, like, what you showed us was a bunch of students who have the same role, right? And then how they have these other kinds of roles. But what if you have a network where you have multiple roles, like the parent-child network, you know, it gets pretty complicated, right? Like, I guess you could, theoretically, could you say, would you just sort of see where the parents land in the thing and then?
Yeah, exactly. What you would like to do is take a bunch of family networks, and there's actually a data set in the ergom.multi set, which is a bunch of family interaction data. So they have 360 separate families, and they record the amount of time that each family type spent with every other type. So you know if kids go with parents and such. And if I hadn't been rushing to get the catering done for this gig, I was going to use that as my example to see if my little toy example ever came up, but I never got to it. But what you would hope is that, you know, I drew the picture as the way we might expect it to, sort of intuitively, ideally. But I suspect there's a lot of fathers that look like children, right? That the mother is feeding them, right? And that, you know, they're essentially just a special child, right? And so if that's the case, right, that should pop up. And I think there are many families where the dog looks a lot like the kids relationally. The amount of time you spend with the dog, the amount of care the dog gets, the amount of money you spend on the dog, right? And so there are families in which pets look like children. The fact that, you know, companies have exploited this is exactly, you know, why we end up spending so much money on our dogs when my parents never would have done that. And so this is so that's a short way of saying yes. What I would do in situations where we have these kinds of formal sort of nominal roles is ask, how often do people actually comport to the role that they're given? How often are nurses actually acting like doctors? How often are patients actually or, you know, the spouses of patients actually acting like nurses? And so you could figure that out by saying, what kind of interactions are they having with others around them? And it ought to be the case if you're asking your questions right, and then the data set that we have that comes with the software for these families is just time spent. But time spent in a family is a pretty good indicator of what you're doing with them. Probably. You don't know if you're fighting with them or you're laughing with them in the data set, but you do know that there are other time use areas where you can get that. But I think those kinds of things, if you collect data about caring and talking and time spent, those kinds of things should give you a lot of information about whether or not doctors, nurses, patients are acting like doctors, nurses, and patients, or whether or not they're taking on somebody else's role. Please.
So I know that you kind of touched on this yesterday, but I'm wondering about whether there are any special considerations that we should take into account for missing data when we're doing this type of model.
No. Right now, all of the models that have been done using this kind of model, the only information that I know of on missing data and evaluations with this work has been the work that we've done. So I'll take that with a big grain of salt because I might not be the best authority. But at least in all the work we've done, your partition of the nodes observed wouldn't differ with and without missing data up until huge levels of missing data. Certainly if the data is missing at random, if the data are missing disproportionately from the central nodes, you will get a slightly different contour position, but it'll still be pretty similar. Which is surprising, right? So we did not expect that. We thought it would be more sensitive, but how lucky. Please. So the question is, what's the relevance to egocentric network analysis? And there are two answers to that question. One is there's a wonderful paper called Local Block Models by Mandel. Mandel and, was White on that paper or Borman? Mandel, Borman, I don't remember. It was one of the folks at Harvard. And Mendel was an undergraduate, a math major, when he started this paper. He was working with, I know he was working with Borman when he first started at Memory Serves Right. And so he wrote this one brilliant paper for how to block model ego networks. And then he went and became a banker or something. I mean, we just never heard from him again. And so there's that work out there. And so the local block modeling approach is a formal treatment of this dedicated to local networks. So there is some move on that. The sad part is that paper was written in the 70s, right? And so we haven't done a lot since. That said, if you're collecting ego network data where you collect, oftentimes one of the nice things about ego network data is you typically collect relational enumerators. You're more likely to collect multiple relations on ego networks than you are on global networks because you have them there and it's relatively easy to say, do you do X, Y, Z, and K with this person once they've been named? So you can often get pretty rich multi-relational data on each of those ego networks. And so then what you can do is you can effectively construct a pattern matrix for each of those ego networks and say, does this ego network look like that ego network? So the ability to do cross-network similarity is pretty straightforward there. Please. Amy.
Oh, yeah. I'm just wondering, so as you were mentioning, a lot of the papers that we're presenting in this presentation are several decades old. I'm just wondering what are the contexts in which this kind of additional analysis is result?
Yeah, so the kind of work where this work has come up, and they're not all been the old papers, but if you're to contrast, like the age distribution has been like it's heavily left skewed. All right, and so the glib answer is that these are University of Chicago press papers, right? So these are AJS papers, which means something to the sociologists in the room. So these tend to be the kinds of papers that are not hypothesis testing papers. These tend to be papers that are sort of theory generation papers, and they have this flavor of quantitative ethnography, where you tend a lot of historical papers, a lot of work where people are doing interpretive sociology, trying to make sense of a setting, and the relational block model helps them with it. There's two exceptions to that I'm currently aware of anyway. One is a great paper on Brashears, one of the South Carolina guys, that was looking at equivalence in Formula One racing. And what they were doing here is Roger Gould has this wonderful hypothesis that says you don't fight with your unequals, you fight with the people who are like you. You fight with the people who you have some chance when you beat them of establishing a dominance relation, right? So I'm not going to fight with Roger Gould, but he's dead, but he's also so much higher status than me that it would make no sense. Like, why would I pick a fight with somebody who's just going to crush me? It just makes no sense. But, I might fight with Ashton, right? We're close enough in the same level that if I beat him, I'm a winner, right? And so I might actually get something out of it. Whereas, if you're fighting with somebody who's super low, that doesn't make any sense. Like, so me picking on a graduate student is stupid. Why would I do that? Right? That would just bring me down. So Gould's argument is that conflict happens among status and equals. And so what this paper showed really, really brilliantly was that if you look at races, it's the people who are in equivalent position in the racing rank that will bump into each other on the racetrack and sort of exert their dominance over them in a way that's trying to get ahead. And so that's some really good work. And the other work is Ivan Chase's work on equivalence relations and dominance hierarchies for all kinds of critters, which he's done now. And so his goal is to try to figure out what makes a hierarchy, and so in order to get that, he's been using some of these methods. All right, I now have taken too much of Ashton's time, so we're going to stop there. And thank you, folks. Again, I hope you use this work, and we'll see you. And then it turns out that I don't actually need to leave, so.
Oh, okay.
So I think I need the mic. You will need the mic. And did you already load your presentation, or? It should be. Yes. Oh, there it is. This one says camera. Let's just download first.
Glad to be here, and Jim's again too kind. But yesterday I was talking to Peter, and he was saying that there were too many 90s references in these presentations. And I went back to my hotel and I said, hold my beer. So I apologize for that in advance. So today I'm going to be talking about kinship networks and health and some kind of new modeling applications that I think offer kind of additional ways to think about kinship networks as influencing our health or as topics of inquiry in and of themselves beyond what Jim just presented. So first I'm going to kind of talk through social networks and health as a field and sort of what network is being conceptualized within that, and really make the case for the importance of family and kinship networks in that. Then I'm going to kind of elucidate what I view as my framework for kind of thinking about how family and kinship networks might fit in the social networks and health kind of worldview, kind of building on some of the stuff Jim was just talking about. And the last, I'm going to kind of end with kind of various resources that exist for doing kinship network and health research that you could apply for your own work. And for those who are interested in the 1990s, you'll recognize the program as being the Festivus kind of set of events. So the first part is going to be really an airing of grievances. The second part will kind of be a feats of strength, kind of trying to feature and showcase some of the work that I've done that I'm really proud of. And then the last part will kind of be discussing the Festivus miracle that has come about in the last couple of years. So we're going to start with airing of grievances. One time I submitted a paper to social networks and, no, just kidding. So social networks and health research overwhelmingly concentrates on these kind of friendship, peer, and acquaintance ties. I think that that is what most people think of when they think of social network analysis, when they think of all sorts of kind of networks. Those are what come to mind, and that is what most of the kind of analytic tools and things like that are geared around. Most of the ergo models, all that stuff, are focused on these kind of ties that are changeable and kind of relation network collection that we can get through name generators and things like that. And there's a lot less attention to family and kinship ties. If you look at the Web of Science, you'll see 75,000 or so articles on social networks, but only about 8 to 10% of them have kind of family or kinship mentioned in that kind of analysis in the title abstract keywords. The same thing with the journal social networks. Early on, it started with almost no family, kinship, etc. networks. It kind of ramped up in the 90s, and it sort of settled in around 10% or so of the papers published in this field kind of explicitly talk about kinship and family networks. However, even though they don't talk about them, they have family and kinship networks embedded in them. And I think it's not hard for us to realize that family and kinship networks are a central part of our social networks. And so Craig earlier pointed out the Fowler and Christakis work. And I feel like one of the most underappreciated components of that work is how central family and kinship networks were in creating that. This was a found social network based on what people in the Framingham Heart Study said, oh, you could contact this person if you lose contact with me. And that was how they kind of constructed this network between all the people. And in that network, it's about 55% of the ties are classified as kin ties. So it's a primarily kin-based network. Similarly, if you look at Lynn's work and Miller McPherson's work on social isolation in America, and these discussions of growing or shrinking kind of social networks that we've seen over time, and if you look earlier at the Marston paper as well, you'll see that the majority of people that we nominate as people who we talk to about important matters, those are family and kinship ties. And even like classic kind of network kind of research, things that we might think that you'd access are weak ties for, like the Search for Abortionist paper. If you go back and look at that, 50% of the people that they asked first for help were family and kinship network members. And even in the non-health literature, like we could think Mark Granovetter stuff on weak ties. These are canonical examples of non kind of kin ties, we would think. But if you look at the book that he has, which the Strength of Weak Ties paper was based on, he enumerated like who people turned to when they were seeking a job. And most of those were family, not most, but a non-trivial proportion were family and kinship-based ties as well. And family and kinship ties are not just important like overall, they are particularly important for certain developmental stages. And a lot of my research focuses on sort of the older adult developmental stage, which I think is a period of time where family and kinship ties primarily really come to shine as central components of our networks. And so this is looking at the General Social Survey 85, 2004, and 2010 kind of important matters nominations and the proportion of ties that are kin or non-kin by age. You can see, above age 50, the majority of these kind of ties that people are nominating are these kin-based ties. Similarly, if you look at the time spent that people spend with different types of relations, most of our time spent with people in our network after the age of 50 or so is with these kind of close family ties, consistent with some of the theoretical models that were elaborated the other day. So what do we know about these ties? And this is where I think some of the network tools are kind of underdeveloped and need to kind of be reimagined and revitalized. So there is a really strong, as Jim pointed out, classic structural anthropology, kind of structural networks, anthropological networks literature that examines these ties, and it has great utility, kind of genealogical methods. Levi-Strauss and others have done things to look at kind of matrimonial exchange patterns where some clans are marrying their daughters off to the sons of other clans within a community, and that creates kind of the social structure overall. There's a kind of classic set of work by Doug White, the late Doug White, and others, kind of reimagining network graph statistics to not just think of kinships like this, where there's a parent who has 2 kids, but actually to flip the network around and think of it as a P-graph, where really the person themselves is connecting 2 nodes, and the nodes are different types of relations. This sort of builds on some of the ideas that Jim was talking about previously. There's different representations of those. And all of this literature is very strong and really interesting, but it's easy to get lost in. And I think in some ways for the social networks and health component, it is a little bit challenging to apply, although Jim just offered some really great examples of ways to think of it as applicable to kind of contemporary issues. So that was my airing of grievances. Now we're going to turn to the kind of feats of strength and thinking about how some of these kind of different approaches to kinship network modeling might be able to shed light on health kind of aspects in the contemporary era. So when I think of a framework for social networks, broadly defined, I kind of draw inspiration from Jim's kind of way of thinking about this, that you have both an architecture perspective, or how the ties are organized and who's connected to whom, and a diffusion perspective, or what is flowing through the pipes, like health behaviors, stigma, something like that. And then you have sort of a macro scale kind of thing, how structures are created that are beyond just the dyadic level, and then a sort of more dyadic scale, what I call the relational kind of area. And I think that while there's huge value in the structural anthropology and kinship literature, I think that we could think about where that fits in this perspective, and think about social networks and health as a way to enumerate with kinship networks, think about where we could build on that and come up with new ideas. So here's my attempt at that. I think a lot of the structural anthropology work really fits in this kind of upper structural and architecture-based kind of idea. And so the structural anthropology work really is thinking about how systems are organized, how matrimonial circuits exist, and things like that. So very much architecture-related stuff, and often kind of macro level kind of structure. But there's a lot of opportunity to think about the architecture kind of dimension at a more relational level. And here I think there are a lot of interesting questions that literature has not answered about person-level kin availability, or kind of access to kin-based resources, like do you have educated people in your network that you could go to learn about college opportunities, or access social support for them, and things like that. There's also the whole diffusional side of this, which I think is underdeveloped as well. And the diffusional side of this could be thought of at the macro structural level, which might be like societal caregiving pressures that certain countries maybe are facing, kind of crisis of care possibilities that are going to exacerbate social security demands and things like that. We could also think of it more at the relational level, on the diffusion side, of like what could be transmitted through kinship ties directly. And so like that could be interpersonal caregiving related things, or some of my stuff thinking about bereavement as transmission through these networks, that the death of someone in that network is influencing other people's health outcomes. And so there are a number of kind of different methods for these approaches. You'll see like surveys appear in all of them, and qualitative stuff I tried to put where I thought it would fit in to particularly elaborate ways of thinking about this. I think most people are familiar with kind of survey or experimental kind of approaches to some extent. But there are some areas that I think demographic methods offer particular ability to help us understand these contributions, and I try to elaborate them here. So I think demographic microsimulation work and other things that I'm going to talk about really fit in for helping thinking about some of these other areas. So that's what I wanted to introduce to you as kind of topics through a couple of case studies, and then showcase some resources that exist for analyzing data with that. So that would be microsimulation in the formal demography of kinship kind of approaches. Before I get to that, I'm going to just mention that there are some questions that we can answer with surveys about kinship networks overall. One that came up recently in the COVID period was, I had a couple papers that I'll talk about subsequently about bereavement from COVID, losing a loved one to COVID, and the number one question that I got asked every time I presented it is it different than losing a loved one to other types of things? And so I tried to answer this with a kind of interesting, I view it as a difference in difference kind of quasi-experimental design, where we can take people. There was a survey that was in the field, and it was in the field from November to June of 2019 to 2020, and there were people who lost their spouse in the pre-COVID period and people who lost their spouse to COVID during the COVID period, and we could sort of compare how much difference in that like 3-month in the people who were widows for 3 months, how much different their health was from these things. And so in the pre-COVID period, you see that the people who were not recently widowed versus the recently widowed, it's, you know, you tend to be lonelier, you tend to be more depressed. There's a few other health outcomes that are very similar. But that during the COVID period, those who had lost their spouses to COVID-19 were substantially lonelier, substantially more depressed than, you know, you'd sort of expect based on if you extrapolated the pre-COVID kind of trend. And subsequently, we have a new paper that we're submitting soon that shows that it's not just the COVID period, it's actually losing a spouse to COVID, which I think sheds some light on kind of mechanisms of bereavement and suddenness and things like that, which I think is pretty exciting. I have another paper that tries to think through how we could kind of do interventions on kinship networks and think about ways to kind of operationalize our kinship networks and mobilize our kinship networks to improve our health outcomes. So this is with an R1 with my colleague J.D. Daw at Penn State, and we have we're looking at people who need kidney transplants. Kidney transplants, overwhelmingly 75 or so % of them come from close family members when it's a living kidney donation. But people tend to ask the worst people that you could ask. They tend to ask their spouse. And your spouse, you have no genetic match with, you tend to share health behaviors, you tend to share kind of health status with. They tend to be a bad person to ask. So we're trying to help people to think of a broader way to kind of enumerate their kinship networks and who they might ask in their kinship networks to see if that improves their kind of kidney transplant outcomes. And so we go through and we give people both ways to talk to family members about kinship networks, which is something that people report as a big challenge, like how do I initiate this conversation? So we give them kind of a conversation initiator. And we go through, we enumerate their networks, and we determine who might be the most likely kind of candidates. Because in qualitative work that we did previously, one of the reasons that a lot of people give up searching for a kidney is they ask 1 or 2 people, they tend not to match, and then they kind of give up. They find a hard conversation and they give up. So we tried to kind of come up with interventions that build around those kinship network processes in a way that maybe will improve outcomes. And we're about 6 months away from knowing the answer, which I'm excited about. So those are some ways to think about kind of survey-based or interventional kind of ways to think about kinship networks and health. But I think that there's a lot of other things that could be done with modeling approaches. And so one area that I think I would advocate that you pay attention to, because I think there's a lot of great opportunities with this, is demographic microsimulation for kinship network analysis, which can tell us things about sort of the structural network conditions that maybe underpin a societal change or underpin a society, and can tell us a little bit about what we might expect in the future. So demographic microsimulation as a model, you take in a bunch of rates, age, sex, race, other category specific, marriage, fertility, mortality, divorce, etc. rates, and you put it into the microsimulation where people kind of interact with one another, and then it spits out like what the population structure is and how that might be changing, as well as like a complete census of all, like a life history census of all the relations in the society that are created through kind of birth, marriage, divorce, and things like that, that you can analyze and come up with kind of interesting, how many stepchildren do people have on average and things like that. Things that we can't enumerate with household surveys because they tend not to ask about living children that are outside of the household, for instance. And so the idea here is that you would have a number of people at a kind of initial time point, and then they either get married to other people, some of them die, they give birth to others, and some of them move out of the community or whatever. You can model all sorts of processes like that, and then trace what the resulting kinship network that links that kind of society that you've created artificially looks like. So I'll give an example of how that application can help us think about social networks and health at the kind of macro scale kind of perspective. So we tend to think of most traditional societies, like traditional Chinese culture, we think of it as this huge extended family dominated kind of cultural phenomenon where people have these massive families of many, many cousins, many, many aunts and uncles and things like that. So I took kind of various Chinese data from 1700s up until 2100, and I fed it into a demographic microsimulation. I tested it against available survey data to show that it comes up with basically the same kind of structures that you would expect in terms of numbers of children, in terms of numbers of siblings in the data that I had available. And that really it matches kind of the demographic history of China. And what's cool about these data is it shows us something completely different than we would expect based on this kind of cultural notion of this massive extended families in historical periods. What it shows us is that contemporary China, not ancient China, has the most extended family kin networks. And this, I said I started in 1700, so this is not just like it took a little while to build up the numbers of cousins and aunts and uncles. Those should be built up in 50 years. This is a feature of the contemporary demographic transition. The fall in mortality is what creates the possibility for a massive boom in kinship in the contemporary era. And I think this upends a lot of traditional thoughts about traditional societies and things like that, but it also highlights a big potential challenge coming up in the near future, which is that the downslope of this is coming, it's coming quickly, and it's going to be quite brutal for a lot of societies. If you think through what that downslope might mean, you can begin to kind of come up with kind of macro level, structural, relational architecture kind of components for what this might impose on the society in terms of filial caregiving burdens and kind of kinship challenges that are created through need to care for people. So this is just the proportion from the 50s to 2050 of people in China who have at least one living parent, kind of middle-aged people with at least one living parent, suggesting that there's going to be and we're in the midst of a pretty big increase in kind of the percentage of the population that is going to be involved in kind of elder care kind of activities. And you can look at kind of different age groups, but you see the same pattern kind of unfolding slightly offset for each age group. And this is happening at the same time as there are substantial declines in siblings that you could share that burden with. Your parents are less likely to have siblings themselves. That also sometimes help in these kind of kinship caregiving kind of situations. So it gives us an ability to kind of understand macro structural change that I think is kind of a unique opportunity. And it's not just China, like I don't want to just pick on China. This is a generalized feature of the demographic transition. This is based on villages in Thailand, but you could do the same thing with the United States or Switzerland or Ghana or whatever country. The demographic transition itself, the decline in mortality is what creates that burst of kind of kinship community structure, and then as fertility regularizes or declines to kind of lower levels, it then has a slope downwards. So this is a common feature that I think is broadly underappreciated. In the United States, I took the same kind of ideas and I applied it to thinking about, well, what kind of structure of family relations do older adults face in the United States going forward? And so one of the things that I was particularly interested in is the percentage of the older adult population that doesn't have children and doesn't have a spouse or a partner, as someone who might be able to provide care for them and think about kind of changes in the United States potential care needs. There's this very classic study by Redfoot and others, very highly kind of policy relevant, cited in presidential addresses and things like that, that thinks about the US kind of coming caregiving crisis as a product of just the ratio of 80-year-olds to 45-year-olds. And I think that what's cool about these models, these demographic microsimulation models, is they can allow us to answer that much more precisely. how many family caregivers are actually available. And if we were to merge it, which we are doing in a current paper that's under review, if we were to merge it with kind of disability needs or average patterns of care receipt, we can begin to understand the unfolding care crisis in a much more nuanced and accurate way than you would get just by looking at the cohort ratios of people that are 70 or 80 or whatever it is to the people who are 45. I also think that these models help us to begin to understand what I call like secondarily affected populations. And I think one of the projects that I'm the most proud of in recent years was thinking about the COVID-19 crisis as it unfolded. And I started out reading like these really dumb kind of tweets from Donald Trump and other people that were like, nobody dies of COVID. Of course, it's not a big deal. Nobody cares. These are only people that are really old and gonna die the next week. Nobody cares about them. And so I started kind of thinking, like, is that really true? Like, what is the average age at which people die? Who do they know in the population? And it got me to thinking about this kind of idea of a secondarily affected population, or people who experience an event but don't die of it themselves through kind of kinship relations. And so in that kind of model, I took a demographic microsimulation, and on top of that, I simulated people dying of COVID-19 based on age, sex, and other patterns of COVID-19 death. And I asked, like, how many people are they leaving behind on average? And the answer that we found was about 9 individuals in total, and that this kind of breaks down into kind of different kin relations of who's being lost. So only a couple spouses are lost, but lots of people are leaving behind their grandchildren, which I think could help us to think, should we pay more attention to certain types of family loss as being particularly detrimental to people's health? So then I followed it up with a survey-based paper looking at the loss of grandparents and a couple survey papers looking at children's academic performance, graduating high school, and things like that. And I feel like this work was really impactful, and I was really lucky to kind of be a part of it with my colleague Emily Smith Greenaway at USC. It kind of created all these like huge kind of cultural things that were really surprising to me. Like people made art on the basis of our project, which I was surprised by. And I think that it helps us to kind of contextualize disasters as being something that doesn't just kill those who, or doesn't just harm those who die themselves, but helps us to think about this broad kind of group of people that maybe are impacted beyond that. And I think social networks and health kind of research should pay more attention to thinking of ways that big events are being spread through networks and maybe have longer term kind of impacts on the population. Our estimates are that, for instance, over 10 million people in the US lost a close loved one to COVID-19. So this is a substantial kind of multiplier effect on the population, which could have huge population health ramifications. One of the things I was most proud of with this is we were the first people to recognize that a ton of children were actually losing their parents to COVID-19. When we first noted it was about 40,000, but now it's over 200,000. And our work kind of led to kind of national narrative changes and efforts to get those children like hooked up with the Social Security that they would be eligible to from Social Security survivor benefits that a lot of them weren't getting, but that other research from economists and others show greatly improves outcomes from parental death and likelihood of graduating high school, not getting arrested, all that sort of stuff. So I was really proud of all that work. But there are a lot of downsides to microsimulation that I think, just while I tout how great it is, I want to highlight that there are some challenges to it. So I'll go through the good parts of it. The good parts, it is one of the few tools, I think, that gives us the ability to look very long term at kind of social change beyond just 1 year or 6 months. It gives us the ability to look at social change over hundreds of years, and importantly, thinking about social change into the future, coming potential crises of caregiving, coming potential crises of bereavement or something like that. It also lets us look at kind of macro scale kind of phenomena that a lot of our models are poorly situated to help us understand. And you can merge it with various agent-based models, or what we did with the microsimulation work with COVID-19 bereavement was thinking about like emergent kind of pandemics. We threw that on top of this and thought about what the kind of impacts of that might be. It also gives us an ability to get around some of what I call the empirical n=1 problem. When you think of a society level thing, it's often the case that there is only one United States population, right? But there could be slight variations on the United States population that maybe we're kind of unaware of. And so these simulation models help us to realize, like, are we in a sort of special case of the United States population? Or could the United States population very easily have been 50 million fewer and 50 million higher or something? kind of things like that, as well as the processes that generated us to the current point with immigration and things like that. The big downsides of the microsimulation world, though, are that it historically was very hard to implement in software. The original programs were all based in like C++, or I wrote a version in MATLAB, and with Katie Faust, I wrote one in SAS, IML at one point, and so there are a lot of kind of really difficult challenges to implementing this. But that has changed. It's not true anymore. I'll come back to that in the resources Festivus Miracle portion of the talk. But the data requirements are also really onerous for these kinds of things. You need hundreds of years of kind of rate-based data on like mortality, fertility, marriage, migration, some of which you end up having to make up. Like, who knows what remarriage rates were like? Nobody measured that in 1920s China. So you sort of have to just take a guess and figure out, is it all right? It also kind of needs to be, because of those various guesses, you need to do some ground truthing, see if it matches empirical data. And so there's a lot of kind of iteration between running the model, testing whether it seems to work, making a tweak to the parameter, and things like that that are really challenging. And then, of course, you can't like readily compute this. The CDC is not going to put out numbers of people that are losing loved ones to COVID-19 because it's not addressable in that way. So which leads me to sort of the second set of models and a lot of my current work that I'm thinking about as a way to kind of think of advances in kinship networks and health kind of research and new kind of tools that we can use. So I like to go back to the kind of first paper on this, which was in the 1970s. People recognized that you could, through mathematical modeling, come up with expected distributions of kin under certain assumptions. If you know the age-specific fertility rates and age-specific mortality rates, you can say, if that were to continue indefinitely, how many, on average, siblings would a 30-year-old have? How many, on average, parents would a 70-year-old have? And so you could have these kind of very simple kind of models that would tell us, for instance, a 40-year-old woman, if she lived through the 1965 United States demographic environment, how many cousins, older sisters, etc. she would have. This really kind of great set of tools that was developed in the 70s. And I always kind of highlight this because it's useful to remember that the current kind of slow publication crisis is not just a current phenomenon. It existed back in the day too. I don't know if Andy Adler was in charge of theoretical population biology in the 70s, but and the challenge with this, though, these early models, was that they were focused on really simplified kind of ideas. Matrilineal only relations, only female kin, only female focal individuals. The rates can't change. You had to make an assumption that the population continued indefinitely at that rate. A lot of challenges like that that really made it divorced from any sort of reality that could be used, which is why these models, I don't think, were picked up at the level that they should have been. However, there's been a dam breaking on this kind of phenomenon recently and huge changes in what you could do with those types of models. So in particular, Hal Caswell has done brilliant work kind of extrapolating these models to think of all sorts of new phenomena that you can examine. So he has two-sex models, so you can examine both women and men. Turns out there were some older approximations, like double the number of parents, and that those yielded pretty good estimates in the end, but for certain types of things, actually two-sex models are particularly useful. There's also been work thinking about building in like exposure to people of certain types. So like Shisong and Hal have a nice set of papers thinking about exposure to unemployed individuals in your kinship network, which you can build into these models, and how those are changing over time. And then there's also some other ways of thinking about kind of changing rates and things to come up with much more realistic kind of population parameters that would tell us more realistic phenomena. And so I have a paper with Hal Caswell now that we're kind of trying to extend this to think about bereavement and think about cause of death contributions to bereavement. And so the innovation here is, instead of just modeling one type of mortality, we model as many as you want. You can stay in this kind of block model mortality matrix, and then you create a block modeled fertility matrix, and you can come up with how many kin you're expected to lose by a certain age to, say, cancer versus heart disease versus suicide, etc. And so I have a couple applications of this, and my ultimate goal, I think, where I'm hoping to get, is that we can take these models, plug them just like life expectancy statistics, and think of them as bereavement expectancies. If you live to age 40, what is the probability that you lose a loved one to a car accident or to breast cancer or any sort of disease like that, which I think will help us as a society think not just about how many people are dying, but also who's affected by those kind of events, and think about maybe targeting kind of disease funding and things like that in kind of this kind of population impact that might be a little bit different than the targeting that we're doing with how many life years are lost and things of that nature. What's also nice about these measures is you can think about kind of what happens if we delete a cause. So what happens if we get rid of breast cancer? Would people then go on to live a long time and reduce bereavement substantially, or would it just kind of be absorbed and bereavement would be sort of similar because those people would die of something else the next year? Breast cancer is probably not one of those examples, but you can imagine Parkinson's or Alzheimer's maybe cutting people off at kind of the end of stage of life, and they probably would die relatively shorter periods after that, which can kind of answer sort of different ways of thinking about bereavement. So with these data, we can calculate these kind of bereavement expectancies. There's way too many diseases here, but the idea is we can do it by race, we can do it by sex. So this shows the probability of losing one of a parent, grandparent, child, or sibling to each of the 16 leading causes of death by race groups. And you can see as you age, your probability of experiencing these events goes up. But of course, the big killers, heart disease, malignant neoplasms, which is cancer, those are the ones that we're most likely to lose people from. We can also think about it in a kind of disparities framework. What are the disparities in losing loved ones to different causes of death experienced by different race groups, by different ages? So that here just graphs, the one on the left graphs, if you take the lowest probability of each of these and zero it out from the others, we can think of where the gaps in this experience are the widest in terms of age groups, what groups are disproportionately losing loved ones to certain diseases. And we can begin to think about the kind of social ramifications of some of these narratives around like deaths of despair and things like that. Who is losing loved ones? The New York Times is like cued into this idea ahead of us, but they have a way of thinking about it that is not like informed by an actual underlying model. It's just that people under 40 probably have parents that are still alive. So these people are, it's not deaths of despair, it's people who are losing their children. And what we're able to do with our model is estimate actually how many people are losing children. What's the probability of losing your child to some of these deaths of despair causes, like suicide, liver disease, or drug overdose or accidents. And so these are kind of the rates of the crude suicide rates by race group. And I put them here to show that like those rates have gone up quite a bit for all the groups, but also that the next slide will show you those increases in levels and the group disparities are not translating directly into the bereavement levels. And so here are the bereavement levels for losing a child to suicide by age. So your probability, most people don't have kids before they're 20, and most people don't die of suicide at child ages. So we don't start seeing deaths of suicide, losing children to suicide until you're kind of in your 30s or 40s. But then you see this enormous unfolding disparity where Native American individuals are losing children to suicide at just staggering rates. And that those rates have gone up between 2003 and 2019, which are sort of the bookends of the available CDC data that I could harmonize. But it's not the story that we typically hear about this. It's not matching exactly what was happening with the death statistics. It's actually a little bit of a different story than we get. We can also look at the same idea by losing a sibling, for instance. And these numbers are pretty shockingly high. 37, 40 per thousand, which is 4 or 5% kind of people experiencing the death of a sibling to some of these deaths of despair. And what's nice about the formal demographic models is we can actually model this sort of stuff for groups like Native American individuals that demographic microsimulation are poorly suited to examine because the demographic rates historically weren't like well tabulated for them, so we can't really model them, and they tend to be sort of smaller groups. So I'll kind of wrap up with what I see as sort of the Festivus miracle. These models were historically very difficult to implement, and I feel like I developed some expertise in them, and then the research literature has sort of provided the ability for other people to use these models very easily. There are 2 resources coming out of the Max Planck Institute for Demographic Research. One is this package called RSOCSIM, which is the demographic microsimulation package, And the other is a R package called DemoKin, which allows you to compute these kind of matrix kinship models and some aspects of the bereavement stuff that are being implemented as we speak. So our SOCSIN package, this is the one for demographic microsimulation kind of modeling. You still have to get it through the DevTools kind of approach, and I wasn't able to come up with a good workbook, but I'm hopeful for 2024 that I'll have a good workbook tutorial. But if you can't wait for that, there's a great workshop listed below down here where they walk through kind of a toy analysis with United States rates, and you can run the models from that and kind of estimate kind of kinship models for the contemporary United States. Similarly, DemoKin, this is for the kind of formal demography of kinship kind of models, which currently has the two-sex model and things like that. Doesn't have the bereavement, cause-specific bereavement stuff that we recently developed, but that should be in there probably by the end of the summer. And that's an available R package that you can use right now. You can download it and use it. And the GitHub listed on the bottom there has a pretty good walkthrough of how to operationalize that and how to apply it for kind of various different rates to think about how demographic change maybe is influencing kind of these relational kind of networks. So I'm going to wrap up here because I know it's been a long day for a lot of people, but I think that I'll end with kind of plea to the people who are thinking about social networks and health to also think about family and kinship networks as being vital components of our social networks and something that we can begin to model with some of the tools that I think are exciting, and to think about how this is impacting our health, both at the kind of societal level, but also at the relational individual level. Family networks have kind of clear links to a lot of classic theories, as Jim's talk better articulated than I could. And I think what's nice is that they really do have these tools that are available to let you do this analysis yourself now. And I guess the last thing I'll say is that as society continues to age, as we have greater numbers of people over the age of 50, many more older adults, we're seeing a much larger proportion of the population enter into those age groups where family and kinship networks are the dominant forms of their relations. And therefore, I think this deserves extra attention when thinking about kind of population health issues related to that. So thank you very much.
Questions, comments?
I think that's another really great presentation. I guess this is more of a subject matter question. In health, the strategic ideas that is workshop, very frequently that we're having an older, sicker population, there's a mismatch to the healthcare workforce. So based on your projections, you had talked about, at least in China, there's going to be a very steep, very difficult drop-off. Would you see something similar in the U.S. or other countries? And then how would you, I don't know if this is unfair, but how would you kind of extrapolate that to the mismatch problem that we have?
Yes, so you do see something similar in the United States. What our paper and review shows is that actually it is not as bad as the pure demography would kind of make you think, just thinking about the ratio kind of thing, because sort of disability rates, the way they're clustered in kind of family relations and things like that, it's just not as bad, basically. It's a really long answer, so I can send you the paper, but it is not as bad of a problem in the United States as you would guess based on the demography. In other countries, it does seem to be worse, actually, though. And I'll start repeating the question, sorry.
So back up with the COVID data, have you guys looked qualitatively at the how the bereavement is working? Because during COVID, people couldn't have funerals, people couldn't grieve. What was that impact on families and children and things like that?
Yes, so during COVID-19, yes, there was periods of time where people weren't allowed to visit loved ones in the hospital. They weren't allowed to have funerals. They couldn't hug extended family members. All these things that we think would make us better able to kind of weather these crises. There's been some qualitative work on it. The challenge is it kind of lacks the counterfactual scenario, and so it's hard to really test, in my opinion, whether it's a qualitatively different experience. But that's where I think our new paper using the people who were widowed helps us to get a little bit of a handle on this, because in those data we have, when we originally did it, because of the way they released the data as it was coming out, all we could look at were pre-COVID widows and people who were widowed during COVID and their loved one died of COVID. So that was the comparison group. But subsequently they released people whose loved ones died during COVID, not of COVID. And so we have, under the exact same period, the ability to kind of triangulate that phenomenon. And what we find is that those whose loved ones died during COVID, not of COVID, look almost identical to those in the pre-COVID period. And it's really something about losing a loved one to this sudden kind of high health interventions disease that COVID was in the kind of early stage that is creating a worse circumstance, rather than just the lack of funerals or the social distancing or the general stress of the pandemic or any of those things, which I think sheds light on kind of a broader phenomenon in the bereavement literature, which I could wax a lot about. But it's I think a really unique ability to test what the mechanism is that's producing this kind of effect on people's kind of health from bereavement. The other thing that's notable about that is it's in 27 countries, so we find no differences between the countries in these effects either. And those countries had different levels of lockdown policies that you would expect maybe would give us a signal on that, but they don't seem to.
I have a really long way to go. I was so excited about your presentation, especially how we're now moving to a space where our simulation can be connected with beyond the survey data and multiple methods there. I was really curious about your future work and your current work and future work in terms of modeling and incorporating the evolution of communication that's going on. Because COVID is not, of course, the one thing that is rapidly changing our world. And I think the communication modalities have major impacts for relational ties, for depth of relationship, for closeness, especially in families. And so I'll give you an example, which is my family's binational, 75% in Cuba, 25% here. When I was growing up, I didn't really have a connection to my Cuban family. I now have, I'm pretty sure, 100 text messages, mostly news. Most of my Cuban relatives, this is the morning ritual. And so my daughter, every day, has access to my national family that really meaningful one. But the relationship is a little different because she has a rival each. She has a greater number of family ties in an extended family, but those ties are not necessarily as strong. And that's due to that societal and external illusions. So I'd love to hear kind of how you think the future modeling can incorporate these massive shifts that impact structural structure and integrity of networks in a lot of ways.
Right, so the question is, how do these shifts, how can we think about the ways to include in these shifts kind of qualitative tie differences, not just the presence or absence of kin ties, but maybe the activities that those ties are engaged in, and how we might think about binational kind of communication networks as affected by COVID-19. And so there's kind of two answers that I'll give. One is that most of these models were historically only run in one country. Only recently have people thought of like, oh, I can actually treat it as like two different groups and then have people migrate between them and come up with binational kind of microsimulation models, which I have a project that we're trying to do that for Mexico and US. And thinking about that raises the problem of how do you think about bereavement for populations of immigrant individuals. So in our model, we didn't model Hispanic or Asian bereavement in the United States because they're populations with relatively high numbers of immigrants. And how do you deal with losing a loved one in India, which is not going to be an event that occurs in our model. And so we have some ways that we're trying to address that in subsequent work, but we haven't done it. Turning back to the first question, the first part of your question about how would you model changes in the quality or some sort of quality of tie component, not just the presence or absence of kin tie. You can simulate that upon these networks and think about engagement in, say, like communication networks and things like that. To some extent, that's going to be influenced by the number and volume of ties that people have. And so we could look at the demographic processes as maybe changing those number and volume of ties, and then we think how much change would you have to see in the qualitative nature of the ties to maybe overcome the broad scale demographic change or something like that. And so we have some models where we've done that with social support, economic exchange, and things like that. We haven't done it with talking to relatives in a communication framework, but the basic idea of modeling the qualitative components of the ties on top of the ties we're able to do. And once you fix sort of the number of ties as predicted by these microsimulations, you can begin to get a handle on how much change there would need to be to overcome some of the demographic underpinnings of these changes. The other thing that you could do with this, with Jim, we kind of did a model where we, which we never finished. I never finished because I went and got a job, and then I had to, do being a professor kind of things. But we did something with Ebola where we were thinking about kind of contact rates and the likelihood of transmission along these kin ties, and how it might be different that you might contact your children every day, but your parents less often. And you might contact your siblings less often than others, and how those things might impact kind of transmission of disease dynamics, and how those kinship connectivity models might impact structural risk of a society for kind of disease outbreaks that in general our finding was that it's gone up tremendously in many of these places. Jim?
I make your paperwork,
Yeah.
The disparity by race, the labels are really small. I'm just curious, given the events we've seen in the news lately, do you have gun violence and mass shootings at all?
Yes, I have a gun violence one, but it's like going under review in the next week or two, so I didn't want to spoil that one. This one is, I'm not as worried because it's too complicated, so.
Well, I hope it comes out.
Thank
All right,
you.
folks. Thank you. All right, folks, that wraps up a very long day. Is Madeline back yet with our tickets? Not yet. All right, so Madeline had to go pick up the physical tickets, so she will be back shortly with those. And for those who want to go for a ball game, unfortunately, we have to actually have a physical ticket. So we were able to email you a QR code or something. So stick around and look at the posters and talk to folks. And when she shows up, you can grab your ticket and we'll head out to the ball game. Otherwise, tomorrow is it's a cruel trick to sort of exhaust you for 3 days and then throw a full day of stats at you, but that's what we're going to do tomorrow. So come fully caffeinated and keep that going for the rest of the day. And we'll see those of you that aren't going to the ball game tomorrow morning. And otherwise, like I said, you get to see your neighbors and hang out here. The tickets will be here in a minute, I'm sure. So.
Awesome job, man. Oh, thanks.
It really is awesome work. That's just great.
Yeah, I mean, the